Good morning. The Committee of Health, Hospital, and Human Services of July 29th, 2022 is hereby called to order. A pleasant good morning to the viewing and listening audience. Good morning to the people of the Virgin Islands. Good morning to central staff, and all in viewing and listening. Welcome to our nurses and representatives of the Nurse Licensure Board who will be providing an update, and to the representatives of the naturopathic field who will be testifying on bill number 34-0244. Today has been a long time coming. I'm honored and proud to have shepherded the bill number 34-0279, the Virgin Islands Behavioral Health Act, to this point. Last year, on February 26, 2021, I convened this same committee to discuss the proposed behavioral health and developmental disabilities legislation. At the conclusion of the hearing, it was clear that we had a lot of work to do. We needed agencies talking to each other. We had to be honest about the capacity of our behavioral health infrastructure, and we had to get all three branches of government around the table. Over a year, here we are today. I've always been clear about my intention to bring behavioral health to the forefront. Our mental health system has failed the people of the Virgin Islands for years. As a career law enforcement, I saw the intersection of mental health with law enforcement, usually without the best outcomes. As a community, I know that we have worked hard to move the stigma from persons needing behavioral health and support, and we have also have to make services available and accessible to those who need it. Today, I'm hoping to have that honest discussion and move this legislation forward, as well as, of course, being able to hear from our nurses, the Nurse Licensure Board, and be provided with an update. At this time, Madam Clerk, can you do the roll call?
Senator Marvin A. Blyden. Senator Blyden. Present.
Present.
Senator Samuel Carrion. Senator Carrion, absent. Senator Kenneth L. Gittins. Senator Gittins, absent. Senator Alma Francis Heiliger. Senator Francis Heiliger, absent. Senator Janelle K. Soro. Senator Soro, absent. Senator Kurt A. Vialet. Senator Vialet, absent. Senator Novell E. Francis Jr.
I'm here.
Senator Francis Jr., present. Mr. Chairman, you have 2 members present, 5 absent at roll call.
Very well, thank you. Madam Clerk, any correspondence to be read into the record at this time?
Yes, Mr. Chairman.
You may proceed.
The Honorable Novell E. Francis, Chairman, Legislature of the Virgin Islands, 3022 Golden Rock, St. Croix, U.S. Virgin Islands, 00820. Dear Chairman Francis, please be advised that I will be arriving late to today's hearing of the Committee on Health, Hospitals, and Human Services to be held in the Fritz Lowetz Conference Room on St. Croix. Please record my absence as excused and forward any information not previously made available on the committee drive to my office. I look forward to weighing in on today's discussions. I look forward to weighing in on discussions on today's agenda items upon my arrival. Thank you in advance for your understanding. Sincerely, Kenneth L. Gittins, Senator. The Honorable Novell E. Francis Jr., Chairperson, Committee on Health, Hospitals, and Human Services, 34th Legislature of the Virgin Islands, 3022 Estate, Golden Rock, Christiansted, VI, 00820. Dear Senator Francis Jr., I will be late for today's Committee on Health, Hospitals, and Human Services hearing due to a previously scheduled engagement. I apologize for any inconvenience this may cause, and I look forward to participating upon my arrival. Thank you for your kind consideration in this matter. Respectfully, Kurt A. Viale, Senator, 34th Legislature of the Virgin Islands.
Any other correspondence, Madam Clerk?
Yes, Mr. Chair. Honorable Novell E. Francis Jr., 34th Legislature, Chairman, Committee on Health, Hospitals, and Human Services. Greetings, Senator Francis. Due to circumstances beyond my control, please note for the record, I will be tardy to the Committee on Health, Hospitals, and Human Services schedule for today. Thank you for your understanding.
Who's that from?
Regards, Senator Alma Francis Heiliger.
Very well, please record non-committee member Senator Genevieve Whitaker as being present, and read today's agenda into the record, please.
The Committee on Health, Hospitals, and Human Services have scheduled a hearing on Friday, July 29th, 2022, 10 a.m. in the Fritz E. Lowetz Legislative Conference Room on St. Croix to receive testimony on Block 1, 10 a.m. to 1 p.m., Bill number 34-0244, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 191A and D, to expand and clarify the definition of naturopathic medicine and the physical modalities used in the practice of naturopathy. Sponsored by Senator Genevieve R. Whitaker. Invited testifiers, Aziza Shabazz, esthetician, physical trainer, Aziza's Nature's Spa. Dr. Lorianne Loggle, Studio 360 Chiropractic Wellness and Functional Movement Center. Shannon Braden, Executive Director, North American Board of Naturopathic Examiners. Chelsea Leander, Naturopathic Physician, VI Family Wellness. Daniel Seitz, JD, EDD, Executive Director, Council on Naturopathic Medical Education. The committee will receive an update on matters related to the nursing practices in the Virgin Islands, including compensation, working conditions, expired contracts, and the credentialing of traveling nurses. Invited testifiers, Jacqueline Canton, Registered Nurses Leadership Union Executive Chair, Chief Negotiator. Tanisha Penn, Chairperson, VI Board of Nurse Licensure. Block 2, 1:30 p.m. to 5 p.m. The committee will receive testimony on Bill 34-0279, an act amending 19 Virgin Islands Code, Part 5, restructuring, reclassifying, and adopting the first comprehensive Virgin Islands Behavioral Health Act to provide for services and interdepartmental coordination of agencies and organizations, to provide a structure of support to individuals throughout the Virgin Islands who suffer from behavioral health challenges, to establish community behavioral health services, as well as to provide for the first comprehensive public behavioral health facility to treat individuals voluntarily and involuntarily who face behavioral health challenges, amending and repealing conflicting laws, and providing for other related purposes. Sponsored by Senator Novell E. Francis Jr. Invited testifiers, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health. The Honorable Denise N. George, Esquire, Attorney General of the U.S. Virgin Islands. The Honorable Ray A. Martinez, Commissioner, VI Police Department. Ms. Cheryl Paxson, NAMI, AARP. Laurie Thompson, PhD, Psychologist, Insight. Tina Commission, Esquire, Chief Executive Officer, Snyder Regional Medical Center. Mr. Christopher E. Finch, Chairman, Virgin Islands Government Health and Hospital Corporation. Ms. Winnie Testamark, Director, VI Bureau of Corrections. Samuel Joseph Esquire, Chief Public Defender, Office of the Territorial Public Defender. Alicia Udwani Esquire, President, VI Bar Association.
Thank you very much, Madam Clerk. Do you have a correspondence from Senator Carrion?
No, I have not received correspondence, Senator.
He indicated by text that he's out sick and wouldn't be present to the hearing today, so we could let the record so reflect. At this time, again, I want to apologize to the individuals that's present here as well as those that's on the line. However, we'll take a recess, and when we resume, we will start with block number 1. And first of all, we'll have the nurses presenting at that time, and then we'll go right into bill number 34-0244. The Committee of Health, Hospital, and Human Services of July 29th hereby stands in recess. The, the Committee of Health, Hospital, and Human Services is out of recess. At this time, we'll be getting an update on matters relating to nursing practices in the Virgin Islands, including compensation, work conditions, expired contracts, and the credentialing of travel nurses. We'll start, if you could just introduce yourself initially, and then we'll go ahead and take testimonies. Also, please record Senator Janelle Saro as being present. Madam Clerk, Ms. Commission, you could just introduce yourself.
Arnell Commission, Treasurer for the Board of VI Board of North Licensure.
Thank you.
Carmen Vanderpool Romney, Executive Director, Virgin Islands Board of Nurse Licensure.
Good morning, Tanisha Penn, Chair of VIBNL.
Dr. Brittany Dawson, Vice Chair of VIBNL and also Vice Chair for District 1 CBU.
Ms. Montoya,
Michelle Montoya, registered nurse.
get a little bit closer to the mic.
Michelle Montoya, registered nurse.
Very well. And we have Ms. Jacqueline Canton online. Please introduce yourself.
Good morning, Jacqueline Canton, RLMU, Chief Negotiator and Chair.
Okay. At this time, we'll go to the Virgin Islands Nurse Licensure Board for their testimony. Who will be doing that? Ms. Commission, you will?
Yes, I will.
You may proceed.
Good morning, Honorable Chairman, Senator Francis, and Vice Chair, members of the Health, Hospital, and Human Services Committee, along with all other members of the Senate, staff, and listening audience. Through the pandemic, the Virgin Islands Board of Nurse Licensure has worked in tandem with the primary staffing entity, Pafford Medical Services, Inc., in establishing temporary permits under the state of emergency proclamation for travel or temporary nurses providing emergency staffing needs. Through the permitting process, though the permitting process was not a choice of the VIBNL board, but of the administration, we work as directed to meet the emergent needs of the U.S. Virgin Islands. Through the pandemic, the board processed over 1,101 temporary permits at the estimated cost of $140,000, which was not reimbursed to the board and did not include the time and energy required to complete these additional permits. The board also continued to process over 800 renewals and 49 endorsements for licensure during this time. At the beginning of 2022, the VIBNL board issued a directive to all public health facilities to include Snyder Regional Medical Center, Wang F. Louis Hospital and Medical Center, Department of Health, and other known clinics who had previously employed travel staff, along with Pafford Medical Services, Inc., through Mr. William Pope, Director of Operations, to begin moving all nurses applying for temporary permits to applications for full endorsement within the territory. Though the board's directive did not align with that of the state of the territory, the goal was to mitigate a crisis in staff and reduce the already exuberant workload expected of a small office. In January 2022, through the end of the emergency proclamation, nurses with temporary permits were not directed to begin the licensure process until imminent end of the proclamation was present, creating an unnecessary potential crisis that, again, the board was expected to expedite and potentially compromise equitability and licensure within the territory. Currently, nurses who enter the territory as travel nurses are required to hold a Virgin Islands nurse license prior to working and must complete a request for license by endorsement. The process is allotted a 90-day turnaround period through the Virgin Islands Code. However, the board has been working with Pafford Medical Service, Inc., and the hospital systems closely to ensure that this turnaround and licenses are handled on average within a 2-week period for those emergent staffing needs once all required documentation has been received within the office. The board has worked tirelessly to ensure that critical staffing is met at all facilities while maintaining the meticulous and safety required in ensuring nurse licensures. As we work through the required process to implement the nurse licensure compact within the territory, we must continue to operate within our current system. Compact is estimated to be live by the end of 2023, pending the implementation of the federal background check, which is currently being handled by the Department of Health and on average can take up to 12 months. We have implemented the first phase, which required the launch of our online application process through Certame LLC and the initiations of the federal background screening system through the Federal Bureau of Investigations. The online process application should be live and fully operational by the end of this year. This would allow for travel nurses who are licensed within the compact to work within the territory, but currently this is not the case due to the requirements to operate as part of the compact. As a board, we hold an open door process with all HR, human resources leadership, and hope to develop a close relationship with any new travel companies giving contracts within the territory. As we are a small board, we must work together with leadership to meet the critical staffing needs we as a territory continue to be faced with. Our priority at the board is not to only provide licensures for travel nursing, but for expediting all licensures for nurses, especially those who will be remaining in the territory. We would like to thank Health, Hospital, and Human Services Committee for allowing us to testify on the credentialing and licensing of travel nurses in the territory. We would like to say thank you to all nurses in the territory and abroad for their hard work that they do every day, as well as through the pandemic. BIBNL intent is to ensure that all nurses meet the requirements for licensure to practice safety in the Virgin Islands. We are honored to be present and welcome all questions. Thank you.
Thank you very much, Ms. Commission, for your testimony. Next, we'll go to Ms. Canton for her testimony.
Yes, good morning again.
Good morning.
Good morning, Honorable Vice President and of the 34th Legislature and
Ms.
Chair of
Canton,
the
can you
Hospital
go ahead
Health
and
Committee.
put on your camera at this time? Very well, you may proceed. We know that you're virtual and that, in fact, that you're on a training, but you could go ahead and proceed.
Actually, not at a training, as I explained, but I'll try to be discreet.
Thank you.
May I take it off at this time?
Go ahead and proceed.
Good morning, Honorable Vice President of the 34th Legislature and Chair of the Health and Hospital Committee, Honorable Committee members, Virgin Islands Board of Nurse Licensure, Honorable testifiers, listening and viewing audience, and legislature staff. I, Jacqueline Canton, registered nurse, executive chair, and chief negotiator of the Registered Nurse Leadership Union, remains honored to testify on behalf of the leadership nurses and all nurses within our territory. I would like the people of the Virgin Islands to know I am not here to accuse or attack anyone of our panelists or testifiers. Rather, I am here to inform our legislative body of the people and the people of the Virgin Islands on the human element that works within our health and hospital institutions, namely the nurses. It is no secret that our hospital and health facilities are currently facing structural challenges and issues regarding mold and other contaminants. I can honestly say that both institutions have taken some necessary mitigation efforts to alleviate the situation. However, it is not enough. Every day, the nurses at Department of Health and Wang Louis Hospital rise to the occasion to provide the best care we can to our patients, clients, and community. However, in our efforts to complete this task, we sacrifice our health and well-being every day. As the nurse in charge, I receive complaints from nurses regarding upper respiratory symptoms such as runny nose, runny eyes, and intense skin issues. Others experience worse symptoms such as asthma, chest discomfort, and headaches. It is challenging to care for others while we experience these issues at our health facilities, which should provide a safe and healthy environment that promotes wellness and healing. Instead, nurses at the Department of Health gather vaccines, medications, equipment, and supplies on a daily basis from the moldy modulars to transport them to the tent and mobile vans, which are located in the parking lot of the now condemned Charles Howard complex. Every day, nurses enter the Governor Wang Louis Hospital to challenges with air conditioning, mold challenges, challenges with oxygen supplies, equipment, and most importantly, staffing. Nurses in the emergency department have to assist patients to the outside restroom facilities. These issues are not new, some are long-standing and creates burnout of the staff and assistant personnel. At the time of our impromptu move, nurses at Department of Health were provided no means of communication at the mobile van areas, often using their personal cell phones to communicate with each other and oftentimes the public. One nurse remained within the modulars to sacrifice themselves to exposure, to answer phones and facilitate the needs of the nurses in the tent. Security is present during some hours of the day, but they too are stretched beyond their capabilities. In the parking area where tents are located, nurses and the public navigate numerous provide air conditioning to the plastic enclosed tent. Records are kept in a trailer in the proximity to the tent. Our staff often take numerous trips back and forth, navigating the stakes, holding the tents in place. The mobile vans are used as clinical areas, which has one exam room and two in the larger vans. Patients have to climb steps to navigate in and out the vans, creating safety issues regarding falls because most of our clientele are children and pregnant women. Therefore, further providing additional duties to our certified nursing assistants as they assist patients in and out of the van after completing their vital signs behind some screens within a small circular tent. While patients are being registered within the same area, creating privacy issues, I must remind you, we are actively still experiencing COVID cases. As we continue to assist clients the best we can, often trying to maintain safe distancing, we struggle to maintain a level of separation. When asked how long and what is the ultimate plan, we were told until the end of June. No other explanation was given on the plan to rectify the problems within the modular, but we were moved shortly. We would be moved shortly. Subsequently, the governor was asked to visit the area by the unions. After his visit, we were assured we would be accommodated. Shortly after, a space was identified, but the very clinic that deals with the tent conditions was subject to disrespect, as space was allocated without thought to client flow and level of care that we provide. Can that be a penalty for speaking out for our work conditions? As the governor maintained, he was unaware of our circumstances. The nurses at DOH skillfully created documents and a system of flow at the Community Health Center to initiate and set the framework for the Community Vaccine Center and provided the initial vaccination during the height of our COVID-19 response. All DOH nurses provided vaccines to the public every afternoon after working in the morning clinics. Eventually, outside nurses were brought and the Community Vaccine Center was moved from the moldy modulars to another venue. The local nurses were no longer needed. The outside nursing personnel was brought in, provided a spacious, mold-free environment with ample staff rotating on 2 shifts, security, transportation, and breakfast daily, while being paid more for the same labor. As our hospital rolled out the mandate, we lost nurses due to the initial decision to vaccinate or we will terminate. The hospital board and administration policy violated the collective bargaining agreement and was implemented without input from the nurses. The union stepped in and provided a plan of testing, which to date remain, to have it adopted and amended by the hospital board, creating an exemption process with stringent oversight by the members of the Department of Health who had involvement in creating the policy. Conflict of interest once again. As a reminder, COVID vaccines were not available for approximately 1 year. Thus, many nurses contracted the virus, some requiring ICU stays and hospitalizations. Unsure of the health ramifications and repercussions, some still suffer with prolonged COVID symptoms, to then be told, forget about your personal issues, vaccinate. Some nurses had doctor notes regarding the fragility of their current health that was challenged by individuals who were not their healthcare provider, knew nothing of their medical challenges, and were told you must vaccinate. One nurse was called the angel of death by medical personnel, namely doctors, as she rendered care safely, abiding with the testing twice a week. I say, where are we now when vaccinated or not, we can contract and spread the virus readily? However, to date, only 2 of our frequently tested nurses ever became positive, and because of rigorous testing, they were able to quarantine before any exposure. Can that be said about other vaccinated personnel? The unions rallied together with our nurses and secured testing for the small number of unvaccinated nurses for 1 calendar year. After that, each nurse had to pay $60 a week, which amounts to $240 a month, costing $2,880 a year. Snyder Regional Medical Center Laboratory benefited from the testing, and at JFL, nurses bought their own tests at $60 a week, and the health employee nurse did the test, which this procedure was carefully developed and seamlessly provided for all unvaccinated personnel to be tested. And I must say, this was developed by our now terminated nurse, Michelle Montoya, RN. With all this being said, can anyone answer why was the nurses and other unvaccinated employees required to pay while any citizen could be tested for free repeatedly at DOH, who receive ample testing materials provided by funding, like all states, by the CARES Act, with capabilities of providing unlimited testing? Most hospitals across our nations provided testing for all nurses, vaccinated or not. While a few did terminate, most of those institutions were private facilities, which were not covered by a collective bargaining agreement. So where are we? Understaffed in each agency and continuing to employ travel nurses at Snyder Regional Medical Center and a few remaining PAFA nurses at JFL and Snyder Regional Medical Center. But I presume the allocated $10 million will benefit the estimated 80 nurses that finally paid for permanent licensure. Approximately 900 nurses were brought into work in the territory. So for the 900 temporary nurse licensures, did the VI Board of Nurse Licensure receive any monies from these licensures? That brings me to our collective bargaining agreement, which expired on September 30th, 2020. Since that date, several negotiation dates were proposed by the Office of Collective Bargaining, only to be canceled for various reasons. We are again tentative for next month. The collective bargaining agreement in itself has many areas of compensation and practice issues to be revised, and still our dates are pending. St. Croix lost numerous nurses, some vaccinated and unvaccinated due to the environmental conditions and staffing issues and burnout, not to mention the vigorous testing routines. Many left for the mainland for better wages, better working conditions, and of course, anger grew when outside help was brought in and paid $20,000 a month with travel expenses, transportation, room and board, and meals. I repeat, 900 nurses came to the territory on temporary licensures. Can the Virgin Islands Nursing Licensure Board provide the fully licensed nurses with an explanation of the practice duties and accountability of temporary nurse licensure status, and how the responsibilities of a fully licensed nurse cover the temporary licensed nurse status? Can the board provide the nursing community with the agency that provided any kind of licensure prior to the executive order that gave the original right back to the VA Board of Nursing, Nurse Licensure where it belongs? Can the Virgin Islands Board of Nurse Licensure assure the nursing community that while meeting the demands from DOH for processing of these nurses on a quarterly basis was all processed without issue? Local nurses received nothing extra for their exposure except JFL, who provided 15% differential if you took care of a COVID patient. This was not provided at Snyder Regional Center due to financial reason. The Snyder Regional Medical Center stated they were not paying for the outside nurses because they were brought in under the CARES Act to provide care. Is this why at Snyder Regional Medical Center they allowed a private firm to bring in their own director of nursing that provided a new internal structure of nurses being scheduled and supervised within a government semi-autonomous hospital? Can you tell me where could this happen in any institution? Therefore, our citizens were subjected to unsupervised local care, which infringes on what we term in nursing, in the nursing profession, as cultural competency. I can define that for this body if asked. Also, how does that address temporary licensure if a medication error or treatment error occur? In the history of nursing practice in the Virgin Islands, nurses have never taken to the streets to protest our work conditions and lack of respect for professionalism. As a reminder, all nurses, no matter where they receive their education on the mainland or in the Virgin Islands, are prepared with the identical education and training as assured by several credentialing national entities and are qualified to take the national exam called the NCLEX. Upon passing the exam, it gives all nurses the ability to work in any 50 states and all territories. Local nurses that work at our facilities are proficient and capable because unlike our many facilities on the mainland, where hospitals are able to provide wound care teams, IV care teams, transporters, lab technicians, our nurses here do it all, rendering them highly skilled, even without the state-of-the-art equipment, technology, and resources. And I must say, working bathrooms and clean air. Imagine what we would do if these things were available at our institution. We almost did that when our very own local interventional cardiologists and others performed the first coronary bypass surgery and cardiac catheterizations in the territory. Now our cardiac center has been reduced to an inpatient facility. At JFL, nurses reach out to the union describing severe nursing challenges. For example, as we speak, the labor and delivery unit has 2 experienced nurses with a few newly cross-trained. Another 4 travel nurses who are expected to leave shortly. This equates to 1 fully experienced nurse per shift. I further mentioned the labor and delivery unit was moved in with the postpartum unit, a unit for after delivery. Therefore, mothers have to hear the intensity of childbirth after just experiencing this ordeal, attempting to rest. What about the mothers who experience a fetal or a newborn loss? She has to hear the cry and joy of a successful delivery of a newborn while she deals with her loss. If I go unit by unit, the stories will only become horrifying. This must stop. Imagine where we would be if services that provided training and enhanced capabilities were available to our staff and community. Imagine where we would be if we had a fully equipped hospital and health facility that focused on providing the best care to all our citizens. Imagine if our health facilities provided educational opportunities to our nurses and medical professionals. I ask this body, where in the world do employees have to ask for clean air, bathroom facilities, adequate equipment, and most importantly, nursing staff? In our training as medical professionals, we know a hospital, a healthcare facility must be kept to the highest standard to maintain infection control, promote healing, and ensure human dignity is maintained. Can we really say we are providing that at Wang Louis Hospital and at St. Croix Department of Health currently? I say no, and I will remain saying no. Thank you.
Thank you very much. Nurse Canton. It's real painful, hearing some of those comments that have been put on the record. At this time, we'll go to Ms. Dawson. Nurse Dawson, you're recognized for your, Dr. Dawson, you're recognized for your testimony.
Good morning, Honorable Senator Francis, Chair of the Committee Health and Hospital and Human Services,
Can you pull the mic down a little bit?
Yeah.
Very well.
Along with other members of the 31st Legislature. Of the Virgin Islands of the United States, other testifiers, nurses, and viewing public audience, I'm honored to be here today as Vice Chair of the VISNA CBU District 1 for the Wong F. Louise Hospital and Medical Center, as the Chief Negotiating Officer for the RN Bedside Union contracts. Prior to the pandemic, the territory was experiencing a nursing shortage not unfamiliar with what is going on globally. The current salaries and benefits for nursing staff have not been competitive for some time, and currently the state of healthcare globally continues to be even less so. Our nurses have been working with limited to little support staff in a condemned facility. This is without any additional hazard compensation, without adequate supplies, oftentimes under hostile leadership, and at unfortunate times without hot water or even air conditioning, and many more limited resources. On any given shift, there are times where there's only one nurse present who is expected time and time again to solely show up and make miracles out of mess. Nurses were asked to work through a global pandemic while never being truly compensated or supported. Instead, many were shamed and forced out of their careers for remaining unvaccinated. Furthermore, some employed nurses are currently spending hundreds of dollars a month in viral testing to remain employed, since we have now moved into an endemic status. We are rural healthcare. Our nurses are skilled and can function in multifaceted communities and facilities. This being the case, we have lost a tremendous amount of staff to travel and relocation for better work conditions, salaries, and overall quality of life. In most states, simply being a nurse or healthcare worker qualifies you for home loan grants, housing support, rental discounts, shopping, and travel benefits. During the pandemic, many small and large hospital systems provided child care assistance and daily living support, even things someone consider minor, such as implementing laundry services to reduce the exposure between the employees' families and hospital clothing. In the territories, senators had to step in to simply provide coverage for staff members falling ill from COVID. They were willing to expose themselves for our community's well-being without knowing the long-term effects it may have on them or their families. As we continue through the pandemic, nursing staff were promised from the governor compensation for their sacrifice, time, and dedication. The continued promise of $10 million allocated specifically for the retention and recruitment of nurses has yet to be dispersed or located. Many of the travel staff has expressed they don't know how our staff has done this for so long. Some not even lasting 2 shifts before subsequently leaving. Even the $5,000 a week compensation could not keep them, but many of our nurses stayed the course regardless. The truth behind this statement is I too do not know how our nurses have pulled through thus far. The current nursing staffing at Snyder Regional Medical Center is estimated at 68 nurses. JFL at 59, Department of Health at 6 in St. Croix and 5 in St. Thomas. This is an estimated 145 nurses to care for over 100,000 people in the hospitals and 11 for outpatient community care. We are in a state of emergency, and if you do not see this as a crisis, then I do not know how else to convey the importance. We would need to recruit over 100 nurses to meet the basic staffing needs, in which they should be compensated with aggressive salary packages and benefits. Realtor.com quoted that the average cost currently in the territory is to be estimated around $500,000 to purchase a home. Nurses in the areas with similar costs of living start with a salary of close to $75,000 a year, right out of school. This does not include additional compensation for nights, specialty certifications, weekends, or holidays. This also does not include their additional benefits, such as housing, discounts on services, legal fee packages, discounted or supplemental tuition. In the territory, our nurses are starting at $63,000 with only a 5% differential allocated for those working nights. Nurses with more than 15 years of experience are minimally compensated at $79,000 a year, while other nurses with similar experience are paid into the 90s. We are expecting qualified healthcare workers who are extremely needed from across the nation or even our own to relocate for less pay, poor work environments, condemned buildings, limited support, limited supplies, high cost of living, and a struggling education system. Let's not leave out the fact that the facilities are both operating still through a system of electronic charting and an archaic system of paper documentation. The unions have continued to struggle with administration directly violating the union contracts with no repercussions. These long, drawn-out battles take time, money, and energy and continue to play into the low morale within all facilities at this time. As of September 2020, the union contracts has expired. As a union, we began meeting with all the CBU leadership to include Department of Health, Snyder Regional Medical Center, and ourselves at JFL to review, update, and improve the contracts. After almost 2 years, multiple emails, protests, community outreach, meetings with the governor, a continued expired contract, and millions of dollars spent on travel and emergency staffing, we have no meeting scheduled to begin to even address the gross salaries our RNs, which are registered nurses, or advanced practice nurses are currently making within the territory, when the health of our community becomes a priority. The union is asking for an emergency stipulated salary agreement with retroactive pay for the post-Irma and Maria hazardous work environment, and the promised incentives for COVID be prioritized. We are asking for the immediate negotiation of union contracts following the aforementioned. We would also like to challenge legislature to develop and fund a housing supplemental grant program for healthcare workers to improve the community's investment for those locally and those relocating to the territory. Again, thank you, Senator Francis, and other committee members for granting the union the time to present our challenges to the Senate and the public.
Thank you very much, Dr. Dawson, for your testimony. Next, we'll go to Ms. Montoya for her testimony.
Good morning, Senator Francis, 34th Legislator, Senator Searle, and the public, other attendees. My name is Michelle Montoya. I'm a registered nurse. I have been for 10 years, 5 of those at JFL. I was born to be a nurse, and I love what I do. This comes across every day loud and clear in my professionalism and compassion that I exude every time that I work. My dedication is such that a few years ago, I did not have transportation for approximately 4 months, and I live all the way west, north side. And I would walk 1 to 1.5 hours hitchhiking to and from work after 12.5-hour shifts, just so that I could provide for the community. Such is my dedication as a nurse. This past weekend, I attended a funeral, and I had several people come up to me to tell me that I had attended to them in the emergency department, and they thanked me for my service. One of the stories was a woman who came up to me, and she had a 3-month-old in her arms, and she said to me, "You saved my baby's life." And she continued to tell me the story that she presented to the emergency department, saying that her baby could not breathe, and that people were telling her, "Okay, let's check you in," etc. That I came out, I immediately took her inside and made sure she was attended to, and she was crying, thanking me for saving her newborn. These are the stories that make you feel that you're doing the work that you're supposed to do. That being said, I'm here to speak about issues that we have here at JFL. JFL, since the time of COVID, has seen the loss of approximately 35 nurses, and perhaps more, now that the number is 59. And when this office last convened at the end of May, it was 69, so another 10 nurses in 2 months. We are working on an expired contract, and we've had no raise in 5 years. And when people speak about this, they are told that there's no sustainability in order to give raises to nurses. Yet, we sit next to travelers who make 4 to 5 times more than we do. And while we are thankful to have people help us, at the same time, it's telling us that, well, we can find money for them, but we can't find money for you, for the local people who have stayed through Maria, who have stayed through the deterioration of JFL. As I said, I've only been here 5 years, but I've worked with people who have been here for 15 years, 20 years, and they've told me about how JFL has deteriorated. Our current contract is not being upheld. So in addition to the fact that it's expired, it's not even being upheld in multiple facets. The first one I'll touch on is the pay. So the way that you're paid, it goes according to how many years you've been a nurse. When you graduate to a new level, currently, JFL is not honoring the new pay increase. And when I inquired about it, I was told that finance is aware and that they didn't know if and when they would be giving the step up to the people who are there. How do you think that makes people feel? In that we have an expired contract and even the current one is not being honored. Our contract was also violated for the mandate. And I say that because when nurses didn't want to take the vaccine, they were faced with termination. And in our agreement of our CBA, in Article 2, Section 5, it states that the employer may not dismiss, suspend, demote, reprimand, or discipline nurses without just cause. So is it just cause because someone is not ready to take a vaccine for termination? It also states no termination, dismissal, or any other disciplinary action may be taken against a nurse without due process. I know for a fact that nurses were handed letters of suspension because they were not vaccinated. I'm going to talk about the environment at JFL. JFL, as Dr. Dawson spoke about and as Jackie Canton spoke about, people are ill and they come and they have runny eyes, itchy nose, coughing, respiratory distress, people who don't even have respiratory disorders. Our L&D department is still closed. It was closed the last time you convened in May, and it's still closed, where we were told that only a few rooms showed any signs of anything that needed to be repaired, yet it's still not open. Working in the emergency department, I've seen the mold. I've seen the mold in the vents. I've asked, back then, that was in 2019, I asked if it could be tested for mold, and I was told it was tested for mold. And when I asked to see the report, so I could see for myself, so I could feel better, in the very least, I was told, oh, it's within normal limits, and no report was ever produced. You write reports every day, and you see a lack of action. You write these reports, you can ask anybody who's written a report there, has anybody ever come to you and asked you about these reports that you're writing, about these conditions that you're working in, about these incidents that have occurred? And the answer is no. Nobody ever comes back and talks to you about what you're writing. So how does that make you feel? It makes you feel undervalued. It makes you feel like, what's the point? More employees that are vaccinated than unvaccinated have had COVID. So why are the unvaccinated only testing? Now I'm going to go on to the new hospital. Do we know if the new hospital design has been completed? because the last time I spoke to the CEO, which was in May, it was about 90%. So how has an architectural design taken more than 4 years to complete? Has anybody gone to look at the oxygen housing? Has anyone been there in the 2 months? Because it went from, at the May, when you had a meeting, it was gonna be the end of July. And then sometime in June, it went to August. So who is keeping track of that? Also in that meeting, talked about an additional building being needed to house essential other staff, because the modulars that are up are for patient care. Has that been constructed yet? Has it started? It's been 2 months. Is the contract out? But these are questions I'm asking because Hurricane Maria was 5 years ago come May. I know for a fact that we still have supplies on the 3rd floor, which hasn't been used since then. So when I'm told that we're going to empty JFL to demolish and build back, when I know we still have supplies from Maria on the 3rd floor, it really leads me to wonder, is that even possible? Why have we purchased new land and we cannot build concurrently? Because waiting for JFL to build a next building that they're saying is going to take 10 months for the other essential departments, do we know it's going to take 10 months? Because you're talking about supplies, you're talking about weather, you're talking about labor. Because if we haven't been able to get the modulars on yet, and that's been 4+ years, how do we know how long that 10 months is going to take? I don't understand why we have new land and we're not building on it if we have the funds to start building now concurrently, because St. Croix will not see a new hospital for 10 years based on what's going on currently. And somebody needs to really have an overview of what is occurring, because people are happy to go to work and sit back and wait for things to happen instead of pushing forward and having a momentum forward for things to occur. The equipment at JFL is also failing. The CT machine, which is imperative for diagnosis, is failing, and we have a new one, a brand new one, sitting up in those modulars. A question is about that equipment in JFL, because it's millions of dollars from what I understand, JFL North. Is it being checked on? Is Biomed checking it? Because anyone that I have spoken to, including Biomed themselves, has said no. So that means we have millions of dollars of equipment sitting in those modulars, not being turned on, not being checked. And medical equipment needs that in order to function. So that's something to think about, because if, or I should say when, we are moved to those modulars, what condition are all those millions of dollars of equipment going to be in? And I'll close in saying that there is very low morale at JFL. And I started a movement for the nurses when we joined the teachers' rally, when we had our own rally, because they need a voice. Everybody goes to work and they are exhausted. They don't feel safe. They're scared. And they need a leader. And even more so in my own circumstances, after what happened to me, so many reached out to me. They told me how scared they are to come forward, to say things that are going on. What kind of environment are we creating where you have people who come into work and they're anxious and they're scared? and they're exhausted. And these are the people who are healers, who give of themselves to heal people. Community and staff alike are exhausted. We see change or rotation of the people in charge, but not change for the people. Thank you for your time.
Thank you very much, Nurse Montoya, for your testimony. And before I open the rounds for questions, I want to thank all of you for, again, your honest discussion this morning in respect to some of the challenges that you have. And I'm hoping that this process, that in fact, there will be some discussion in respect to how can we move the needle in terms of making recommendations and suggestions. How do we fix the challenges? I had the awesome responsibility to make the decision whether or not we want to air our dirty laundry in public. But I think it's real critical that the public is aware of some of the challenges that we're experiencing, because then we have the responsibility to fix those challenges. The community needs to be aware of it. I'm not one that look for the gloom and doom in our community, and I always look at the glass as being half filled. But nonetheless, I think that some of the matters that you have brought to light here is that this community needs to understand what you're up against. But more importantly, that we have a lot of committed, hardworking nurses, because the negativism is always painted with a broad brush. But I think it's critical that we understand that we have a lot of hard-working nurses, certainly with the compassion, certainly with the dedication, and with the care to serve this community. We in government have the responsibility to provide the manpower, the equipment, the policies to make sure that passion, compassion, care, and dedication is then transcribed into quality health care. So I want to thank you. I want to thank each and every one of you for your testimony here this morning. I'm going to open up the floor for a 5-minute round. And again, the senators only have 5 minutes, so please be as concise as possible with your responses so that they could have an opportunity to get in as many questions as they need to get in. I wanted to ask, first of all, I know that the Board of Nurse Licensure, that in fact we had a meeting yesterday in the Committee of Finance, and we did mention about the $125,000 reimbursement that's pending and due. And I'm hoping that we could be able to work collectively to be able to get the executive branch to reimburse that money into your coffers so that you can continue to do the work that you're doing there. So I'm expecting some supportive documentation that I will assist you in being able to get the administration to at least try to reimburse that funding. Anyone know whether or not the nurses have received their COVID stipends, bonuses, or incentives thus far?
This is Dr. Dawson. The only incentives that were received by nurses were the JFL 15%, and that was only if you worked directly with a COVID patient and that patient was diagnosed with COVID. There has been no other incentives.
Very well. And several of you asked some probative questions in respect to what's going on at the different facilities, and I'm hoping that we could provide that response to you. We have had some engagement with the JFL leadership staff, the executive team. We have done site visits as well. We supported the land purchases that was being made for the purpose, again, for staging and removing certain equipment and allowing for parking and different things so that the demolition could occur when it's necessary. We know that there is a transition plan in place, for the move into JFL North. I have asked the executive team at JFL to make sure that they're keeping the community as well as the nurse and staff updated as to what's going on, because in fact, these are legitimate questions and they should be responded to. At this time, I recognize Senator Blyden for his 5 minutes.
Thank you, Mr. Chair. Good morning to the listening viewing audience, staff, central staff. Good morning to all of the testifiers, and thank you so much for your testimonies. Before I go into my line of questioning, I honestly want to thank all the nurses for their sacrifice in what they do. In particular, I want to thank also Ms. Canton for speaking her truth, Ms. Montaya for speaking her truth, and others that spoke this morning. And Mr. Chair, as the co-chair of this committee, I'm happy that you made a decision to let them come and speak their truth because they say the truth will set you free. I believe that with many of the complaints and the issues and the challenges that our nurses are facing at GFL and Snyder Regional Hospital, I know that we need to have a backdoor meeting and have further discussion to assure that these individuals are made whole. It is not right, and it's unfair. You know, there's no way anyone should be coming to work feeling threatened or frightened, you know, feeling unsafe, you know, not being able to work and do their due diligence when it comes to the people of this territory because they care for us. And at any time in our life, we're all going to be end up in the hospital for one reason or next. I believe that the CBA and the due process needs to be addressed. So I look forward to having those further discussion, Mr. Chair, offline with these individuals to assure that they are made whole. Now, when it comes to many other conditions and issues at the hospitals, I need to ask in respect to the termination of many nurses who were not vaccinated, but at the same time, those nurses had to endure and go through many challenges. And in terms of the situation with pay and nurses who only dealt with upfront with COVID patients, but others who did not. But they all were in the same spaces. They all were doing the work during the time of the COVID pandemic, like many other agencies with other workers who are not even frontline workers who have been will be reimbursed. So I really do not understand the mindset or the concept of that way of thinking. But nonetheless, like I say, we need to have further discussions offline, and look forward to having those discussions. I want to go to the staffing and understaffing of nurse. And it became clear. See, I don't really have any questions, and I just want to speak to certain issues because, like I say, we need to have further discussions offline.
3 minutes.
With these individuals, because it baffles me that we are trying our best as legislators to onboard individuals, provide funding for nurses at our hospital because of the shortages in staff. But at the same time, it is clear to me that we have a structural problem because here it is. In testimony this morning, it was stated that they are being paid at a certain level, right? And many of the nurses that came in, the traveling nurses, quit after a week or two, even though they were paid very well because of the working conditions. So I believe it starts there. The working conditions of our nurses, our local Virgin Island nurses, because they cannot take care of us if they are constantly going to be worried about their health. They can't think straight. They're anxious. They're fearful, etc. So we need to deal with the environment first before we do anything else, because it makes no sense to do anything else when we can't even maintain traveling nurses in the territory because of the working conditions. Secondly, we need to find a way to deal with their salary. They basically are stating that the CBA is not being upheld, and in addition to that, they stated that the one that they are working on right now is not even being followed. So how can we expect our nurses to perform their duties despite, based on the testimony and based on what I know, their sacrifices in terms of assuring that they take care of us because they live here and they went to school to be a nurse for such a reason to
1 minute.
Thank you. To make sure that they do the right thing by us. So it baffles me this morning to hear many of the different struggles that they have been facing. I did not know it was that bad, to be honest with you. It's real bad, and we need to do something expeditiously to work with these nurses and assure that we address each and every one of these challenges that they face on a daily basis, because we're only going to continue losing nurses on a regular basis. And we really do not want that. I know Ms. Dr. Dawson spoke to different benefits that different states give their nurses in order to keep them. And she also spoke to housing supplemental grant. I will look into that and have further discussion in that respect. But nonetheless, I believe that we should do everything possible to maintain our nurses, to assure that we are doing everything possible in our power to assure that we are living up to the standard of assuring that they can work in a safe and healthy environment. Because if they cannot work in a safe and healthy environment, how can we as patients expect to get better or do any better? So, Mr. Chair, I understand and I appreciate you having them come in this morning to express themselves and speak their truth. And again, I want to commend you guys for what you have been doing and continue to do on the such conversations. And I can make one promise this morning that I will work with my colleagues and all individuals in respect to assuring that you are made whole and we do right by you. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Blyden. Madam Clerk, please recognize the presence of Senator Gittens as well as Senator Alma Francis Heiliger. Before we go to the next senator, which will be Senator Genevieve Whitaker for her 5 minutes, I wanted to ask you, Ms. Vanterpool Romney, in respect, I'm getting texts about delay in licensure. What, if anything, is causing any delay in respect to licensure?
Carmen Vanderpool Romney, Executive Director. Any delay in licensure that's being had, all nurses, we have maybe less than a 2-week turnaround period. If all your documentation was not submitted, you cannot get your license without that being there. So I would advise any nurse who is saying that they had a delay in licensure to call the board and see what's going on. We can be contacted by vinurseinfo@bnl.vi.gov for any inquiry that you may have on your license.
Can you just quickly speak to the initiative that you're rolling out, that the board had decided on in respect to the scheduling of licensure or license moving forward with the birth date and stuff? Can you speak to that?
Actually, effective for this period, the nurses will be licensed until, well, the odd year. We are in 2022, so their license will be until 2024. However, during that period, they will be renewed by birth date. So we will be doing a lot of information sharing via email, online, marketing, to let the nurses know how that process will be taking place. We're hoping to be completely on birth date for the registered nurses, which are that's the largest group of nurses. So hopefully by 2024 renewal period, we will be doing licenses by birth date. So that should be easier. If you can't remember your birthday, then it should be easier.
Very well. That's again to streamline the process and make sure that
Yes.
it's timely so you don't have that bottleneck. At this time, the chair will recognize Senator Whitaker for her 5 minutes.
Good morning, Chairman. Good morning, colleagues. Good morning to the people of the Virgin Islands. Good morning to our testifiers. I want to first off really thank each of you for being here today. On behalf of the nurses yourselves, also on behalf of the nurses and advocacy, I'm always pleased to see people advocate, not pleased by the conditions, but certainly pleased when people stand up for their rights, and I commend that effort. The question I have, I want to first start off with just get a sense of, because one of the things that I've been working a lot with our boards, a lot of our boards don't really have a lot of information out there publicly, of course, noting the nature of this board. The question I have is the licensure process. How has the board endeavored, because we still have, even with the Department of Health, and we saw a lot of paper-based mechanisms in order to achieve the application process. How have you all moved forward in modalities to be more efficient and more 21st century principles around the application process?
This is
Okay, go ahead.
okay. This is Dr. Dawson. So, part of the initiatives the board has been taking is meeting with nationals. So currently, things like our Nurse Practice Act all need to be updated in order to meet standards. So with this new board that's come into, I guess enactment is a really good place to go. We're actually moving to a completely online application platform. We've launched our website, which is the first step to that. We have meetings coming up in the next month or two with the National Council of Nursing to actually establish our contracts across the board to meet compact standards. But we're actually going to do that before implementing compact so that we don't have to go back through that and replace it again. We've also already made initiatives during our normal board meetings to remove some of the bulk that's currently present in contracts to help speedline the process while we're still in paper.
Thank you, and that's a great, and also Dr. Dawson, as you testified and coming onto the board as something was one of your goals, and it was achieved with your colleagues. So that's excellent. To Ms. Canton, the questions and even just not you, only person who can answer it. Others are sure can answer this question. As mentioned in your testimony, a lot of the hospitals around the nation do offer free COVID testing for all nurses, whether vaccinated or not. And you brought up the fact concerning the nurses at Wang Flui, and the fact that they had to purchase their own test kits. Can you, in one of the platforms, speak to where we are with that in terms of support for the nurse staff and testing, COVID testing still being offered to them, because we, of course, still are in the midst of the pandemic?
Good morning. Jacqueline Canton, registered nurse, RNLU. We're still doing the testing, and based on our complaints as high as to Government House, we were told that they will now be picking up the cost. But we're not talking about the human toll. I get nurses complaining that you're testing us twice a week with no scientific base. We are endemic, and they're suffering with their noses and their throats being swabbed. Remember, there is a reagent on these swabs that predisposes you to certain types of cancer. This is not a tool that should be used in that fashion, especially if we're not in a pandemic situation. And still, the board maintains that they want to still have the mandate. And if we're going to talk about the board, let's talk about how the board actually implemented that policy. The VI Code does not give the board that authority to implement a policy with existing employees that have a collective bargaining agreement. But no one wants to address that. And that's why we took them to court. And now we probably end up back into the PERB. We're now endemic. It needs to stop. There is no scientific base for doing this, and no one wants to address it. So we're about to write the board to sit down, have a meeting, and to have this to stop. It is an invasive procedure, and it should not be done. You're endemic. Endemic means that anyone at any time can spread the virus, and that our population has now been exposed enough that we have enough herd immunity from vaccination. Thank you.
Good morning. This is Michelle Montoya, registered nurse. That I know of, it has not been implemented, and I am the one who created the program at JFL. It's not just the nurses who are testing, it's more than the nurses. And the fact that more vaccinated people have contracted COVID than unvaccinated people is what leads to the question of the testing. Because if you're talking about safety, then everyone should be testing. Thank you.
Thank you for that. And my time's about to close. And just overall, for the horrific conditions that the persons are facing and nurses are facing at the hospital. What are the current mitigation efforts being instituted now? Because of course we know the hospital is going to be rebuilt, but what is going on now? Any update on some of the interim measures to make it more safe for nurses? Any highlights, any progress in any way?
This is Dr. Dawson. So
Time.
in both my roles at the hospital, I also function on the labor floor, and there was news about the mold and the mitigation needed for that. So the directors of facilities has taken a role in making sure that as each floor complains about something or needs something, they're really, really great at responding to those things. But the overall structure itself is the issue. We can't continue to patchwork in an environment that's falling apart. The hospital system does not have the money necessary to basically repair to the level of like standard of care deserving of our patients. And even with the move to the modular systems, it's still very concerning for all. It should be concerning for all because those modulars were only built to exist for 6 years. So we're moving into year 5 with an estimated 6 to 10 year build out on a hospital. So we're going to hit the end of that and still be in that modular system until, you know, the foreseeable time.
Thank you for that. Thank you for your testimonies. Thank you.
Thank you very much, Senator Whitaker, for your line of questions. Next, we'll go to Senator Francis Heidegger. You ready? You ready? You're recognized for your 5 minutes.
Thank you. Good afternoon to my colleagues, the people of the territory, to the testifiers, to staff. One thing that you had discussed in regards to more individuals that were vaccinated versus unvaccinated getting COVID. As an individual that has followed this trend as it relates to COVID, where the narrative has altered multiple times over the past 2 years. At one point, it was herd immunity. Another point, it's, you know, we just need to get people vaccinated. The last message I heard that it's more important to have natural immunity. It's 13 times more protective than the vaccination. It's so many things that we've heard that has led us to this point. But I personally would like to thank all the nurses and individuals that worked very hard during COVID to protect and assist the people of this territory. But when it comes back to your health and your wellness, why do you believe that the hospitals are insisting on utilizing the same method when it comes to dealing with COVID as opposed to easing because we are now in an endemic versus a pandemic?
This is Dr.
Anyone can respond.
I'll respond. So this is Dr. Dawson. I think that in the territory, we have to consistently layer on a place of caution because we have such limited resources and staff to support the patients if they do become ill. So I do think they're leaning more towards a conservative approach versus pulling back. Testing, we have at the hospital system, because I work there, begun to allow visitors to come in without, you know, with either a positive or a negative test or a vaccine card. So they are loosening some of their protocols and allowing visitors to exchange, but they're still taking a very conservative approach, but it doesn't mean that that approach is best practice currently.
Okay, well, thank you for saying that. I also want to know in regards to individuals that we knew that at some point there was a huge uproar in terminating nurses that chose not to be vaccinated. Do you know or have a number of how many nurses were released? And since we are now in an endemic and life has changed somewhat, do you think some of those nurses would be able to come back to work in order to potentially alleviate the cost of having to hire traveling nurses, which according to what was shared is 4 to 5 times more costly than supporting the very local nurses that are here?
Good morning, this is Michelle
Good morning, Senator.
Good morning, Senator. This is Michelle Montoya, registered nurse. The amount of nurses that have left is closing on the number of 50, considering that 10 more have left in the past couple of months. There's a mixture of people who were unvaccinated and vaccinated. What I do know is that currently, as the policy states, you are not allowed to even reapply to the hospitals unless you are vaccinated. So they're not taking people back. So if you didn't have an exemption before you left, you cannot come on new or apply again and have an exemption to come on if you choose not to be vaccinated. You have to be
Okay,
vaccinated
well,
to work.
if the tide is shifting, do you think that that is best practice since we are in need of nurses at a
Absolutely
cost
not.
measure?
Absolutely not. I think that it is something that the board needs to look at again because it created a division amongst people also. You're vaccinated, you're not vaccinated.
Okay.
And, you know, being that it's endemic now and we're all in this together,
1 minute.
we need to
Well-
be able to say that we need people
This is
on
part
board.
of the problem. I understood that narrative, what was being pushed on the public last year. Let's even say last year. But we've learned so much more about COVID since then that both vaccinated and unvaccinated equally, but it even seems more disparaging now that more unvaccinated people, more vaccinated, seem to have gotten COVID than the unvaccinated. So the narrative that was initially pushed that caused this division between vaccinated and unvaccinated turned out to be a false narrative.
I agree with you completely.
If this knowledge is now available, why is it the board is not accepting this current knowledge and recognizing the importance of potentially opening the doors back to these individuals, from my opinion, that might have been falsely been forced to leave because the narrative at that time has now been proven to be wrong?
Time.
May I respond?
Yes, you may respond.
In my personal opinion, it is sometimes that when people learn of something, they run with it. And they've gone so far down that lane that they don't know how to come back from it, regardless of what facts and science and numbers are now telling them. Thank you.
Wow. Thank you so much, and I appreciate the response, and thank you, Mr. Chair, for the additional time.
Thank you very much, Senator Heidegger, for your line of questions. Dr. Dawson, you had something?
Yeah, so I also wanted to add to the conversation that these mandates were never discussed with the unions and actually directly violated our union contracts. So even with outreach to the board, even in outreach to hospital leadership, they continue to violate the contracts without moving forward or even being willing to meet or negotiate them because we had alternate options prior.
Thank you. And again, this discussion is one that's alive and well. I know that I saw or read recent dialogue from the governor also asking the board to reconsider their posture within the vaccine mandate. You know, so we're hoping that the board will be taking this up under consideration in the very near future and rendering. You know, similarly in human services, there was this issue of child care where they were being mandated to be vaccinated or be subjected to a testing almost on a weekly basis in respect to that. And I know that they, you know, those are areas that we have to really revisit. I had many conversations with the both the providers that work within that facility as well as the executive team of DHS, you know, so, you know, those hardline mandates and in this endemic phase have to be revisited and decisions have to be made in the best interests of the people of the Virgin Islands. At this time, the chair will recognize Senator Saru. You recognize for your 5 minutes.
Thank you, Mr. Chair, and good morning to all. I'm a woman of a lot of words. And I don't think I really don't know what to ask you, to be honest, because the testimony here is quite heart-wrenching. And I'm no nurse. I don't even like to see blood. But I know it was difficult as an educator to, you know, report to work with a master's degree, making $28,000. And having to buy every single supply and deal with every issue of a child, and then you get a little raise to $32,000, and then came the 8% cut. It was enough to make you, you know, run. So I can only imagine the situation when you talk about climbing the steps outside and going through the jungle gym. Okay, it's not like a jungle gym outside to get to deal with the patient. And I didn't even want to, I don't know. Because you don't want to pontificate, because as a legislative body, we are bound, people tend to come to this body to be the alpha and the omega of government, and this is really an executive branch issue. So when you had the protest, and it goes back to just how we function. We passed legislation in this body to adjust the board and to make the hospital board be filled with more technical expertise and not political cronies. It passed, it got vetoed, it was overridden, and then the case ended up in court. So we tried to adjust the board to say, well, if you have more healthcare professionals, and you could actually have a conversation with a nurse on the board, some doctors on the boards, so it could make sense. Decisions could make sense. That didn't happen. We go to court. Fine. Now you had a protest. I saw the protest online. What was the outcome of that? When the governor said he'll meet with you, what was the outcome of that discussion with the chief executive?
Good morning, Senator. Can I answer that?
Who's that? That's Ms. Canton?
Yes, Ms. Canton.
Yes, it is.
Talk to me, Ms. Canton.
Actually, it was quite perplexing and disappointing because the initial meeting was, why were you here? Why did you come down to my house?
3 minutes.
And I really felt at that point that we weren't really being approached properly. But after the dialogue went on, he realized why we were there was because our supervisors, our commissioners, our CEOs did not respond to our voice and our complaints. And we went through every mechanism by writing, stating, attending meetings, going to the persons who represent us on the board. And to answer your other question, yes, we have nursing representation on the board, and they did not do their due diligence in moving forward our agenda because they had their own. And also, being a member and actually working for the establishment is a no-no because it actually makes you feel threatened on the job. And that's why we ended up there. So we didn't solve everything, but we got our voices heard. And we did get a chance to revisit OCB. But here we are again being told, hold on. So I hope I answer your question.
Okay. Who else was there? Dr. Dawson?
Yeah, so this is Dr. Dawson. So I would say that the initial approach was they didn't understand why we were protesting the governor. They felt like we were protesting the governor. When we initially approached, we explained that we're actually protesting the executive branch of who he's hired because we had not heard back from the board. We had not heard back from OCB. We had not heard back at the time from the commissioner. And when I say the board, I mean the Health and Hospital Board that designated over the territory. And when we continued to, bring up things about salary and work environments, the conversation was, well, haven't we started negotiations on your contract? I don't see the issue, but there's no urgency behind of that. When the salaries were brought up, we were told by the governor that
1 minute.
That basically the request in salaries that we were asking was not something that could be funded, that the most they could potentially do was increase the initial pay for new grads and maybe look at other things, even though Chief Springett at the time did reflect that what the unions are asking for is not some astronomical pay. It's actually what is middle ground in healthcare right now.
So, and what happened after that? No.
Nothing.
Done.
Nothing.
So we're here now.
Mm-hmm.
Okay. So let's go to Miss Romney, Vanderpool Romney. Tell me what's your issues that you're having with DOH from the board? Because I know there's something taking place between, Mr. Chair, we gonna have 2 rounds, like a rapid fire? Okay. Between when the health sends their nurses over and health is saying one thing and then the blame comes at you and then you clarify something else. And what's happening there with DOH and the board?
And this is pertaining, and for clarification in the record, the board with the union is the hospital board. We are the
Time.
version for licensing and credentialing.
Yeah, we just using board like randomly. Right? I
Yes.
have two boards. I
Right.
understand.
The issue that we are having currently with DOH is the fact that the board is the repository of licensing and credentialing in the Virgin Islands. We are the only one that governs the practice of nursing. No other authority, according to the VI code, should tell the board when, how, and who should be licensed. So once we get the information, those nurses must go through a vetting process and verification of their licensure, which means if there's a discipline or any infractions against it, we must ensure that this nurse is okay to practice. We just cannot, because someone says Senator Soro is a nurse and she's coming from the United States, she can go to work at Wang Louis, Snyder, or anywhere. That nurse must be vetted, her verification must be processed. If we do not know the verification, we cannot okay that nurse or give a license to practice at any bedside.
So, Mr. Chair, just to follow up. So, I understand you're telling me what you can and cannot do, but tell me what's the issue. You didn't really answer what I'm initially asking you, and I just want some full transparency today, so we could, discuss in a back door in a working meeting, propose solutions.
So we can.
This is Dr. Dawson. So I'll say, frankly, basically what's happening is that the authority of the board has continued to being pushed back by other people. The leadership for Department of Health has been giving initiatives or directives to those who operate the travel companies, for example, Pafford. So those nurses for Pafford are being told by their leadership to work without licenses because our current commissioner has stated that she will work with the board to get those licenses done. However, the only person that can tell a nurse whether or not to work in the territory who is not a volunteer healthcare person is the Board of Nursing. So we've had issues with that. We've had issues directly with Pafford when we've continued to put processes in place to help streamline that license. Pafford will continue to ignore the initiatives of the board, their leadership. A perfect example of that is this week, we were notified not even 2 days ago that they need over 30 applicants to be reviewed to start August 1st. When we have said over and over again, please give us at least a 2-week notice to process some of these licenses. And I want to be clear when I say that some of the nurses they bring into the territory have had infractions in other states that weren't eligible to work here. So they're mandating that based on the code, that they can get 90-day permits, but that code requires that the application, the fee, and all documentations be in at the board, and the board produces that 90-day license, no one else.
So the quality of healthcare is being compromised in a sense.
Correct.
And on a chair's time, I think Nurse Montoya wanted to add. Thank you, Mr. Chair, for the allowed
Very well. Thank you very much, Senator Saru. Nurse Montoya, you could respond on my
Thank
time.
you. Michelle Montoya, registered nurse. I just wanted to add to that, Pafford is not the answer. So we keep saying every month, everybody gets all scared, oh my God, Pafford's gonna leave, and then they end up extending. So we find money within the government to keep these nurses on. But then we continue to say to our own local nurses, you are not enough, and we can bring people from outside. We received over $500 million in COVID relief, which is where the $10 million to each hospital is coming from. Where's the rest of it? And how can we not afford to pay our nurses something else when we've received $500 million alone just for COVID relief? And touching on that, the $10 million that was given to each hospital, who's going to oversee how that is distributed? Based on the last hearing that you had, there were questionable practices that were funds that were allocated, specific funds that had to be questioned. Who signed this check? Or where did this money go? So who's going to see this $10 million? And the premium pay that was supposed to start distribution in June, the cap was at $70,000. And in the last hearing, it was said that they were going to try to increase that cap. Has that been addressed? Thank you for your time.
Thank you very much, Ms. Montoya, for your. Ms. Romney, you had a follow-up?
In response to Senator Sarur's question, one thing I might add, with the onboarding of the agency during the pandemic, in regards to licensing, credentialing, or anything to do with the nurses, that part was not, no one contacted the board or asked the board what is the process and how we were going to do it, and the board has never seen what was agreed upon signing that contract about licensing. We were never included.
Thank you for that, and that brings me to a perfect segue that, in fact, I think that we have a breakdown in communication that continue to occur, and I've endeavored to bring all the stakeholders together in that respect. Certainly the board, the executive branch, through the Commissioner of Health as well, so that that communication line could be open and those you could go back and forth in respect to making sure that there's understanding by how to proceed on these matters and be able to have an open dialogue amongst yourself. So I'll continue to beat that drum, and I'm hoping that I know that you recently met or had a discussion with the Commissioner of Health, and I'm hoping that that will manifest into at least a meeting so that we could address some of the concerns that have been raised here. Ms. Canton, you had a follow-up to a previous question. You recognize, please be succinct at this time.
Yes, I just want to say quickly, I wanted to answer Senator Blyden's question when he asks about compensation. The nurses in the territory who was the least or not compensated at all were Department of Health. Department of Health nurses did testing initially before we onboarded staff. Department of Health nurses went out in the community to give vaccines. Department of Health nurses gave vaccines, were never compensated for their exposure for COVID. And no, we did not have our nursing hours shortened, not based on what people may say, even while dealing with the mold. So no, out of all the nurses in the territory, Department of Health nurses were paid nothing for their work with COVID, not $1.
Thank you. Nurse Canton, next we'll recognize Senator Gittins. You're recognized for your 5 minutes at this time.
Thank you, Mr. Chair, and good afternoon to all. Nurses, we have to do what we have to do to take care of you guys as you take care of us. I'm waiting for a document regarding that premium pay that you spoke of, so I'll go to that after. However, because of the shortage of nurses here in the territory, as well as all over the nation, we have to contract personnel from outside. But what I'm told is that the Department of Health issues contracts for like 30 or 60-day contracts. And at times they send like maybe 20 to 30 nurses. And of course, these are for immediate needs at the hospital. So hence yesterday our discussion and me saying that y'all need to staff up the office so that you can have personnel to do the proper background checks, etc. How long is it basically, what's the turnaround for a new license? How long should it take? And I want short answers. 2 weeks, 1 month, how long?
This is Arnel Commission. So per our
What's your position?
I'm the treasurer for the Virgin Island Board of Nurses.
For the board, okay.
So per our for the VI code, it takes up to 90 days. But because of the shortage, we turn it around in 2 weeks once all the approved documents is in office.
So I understand what the code says about up to 90 days. So the code will give you up to 90 days, but should it take you 90 days to do it?
But that's what I'm saying. We get it out in 2 weeks once all the needed documents is in office.
So you get it out in 2 weeks.
Yes.
That's the current thing now.
We've been working and striving to get it out within 2 weeks.
Okay,
Once all the
working and striving to do it and doing it is two different
Well, we
things.
have been doing it.
Okay, so that's what I'm asking because apparently, again, the entity that we've entered into this contract with, we all know, Pafford, is seemingly having this problem in getting it done. But of course, if we're going to say we're bringing 20 to 30 people and it's for an immediate need, I
3
guess
minutes.
what I should ask is, do you give any, if someone shows, and this is what we talk about the nurse licensure compact before, but if a nurse has a licensure elsewhere, is there any provisions currently that you'll issue a temporary license until you complete your investigation for issuance of a Virgin Islands license?
This is Dr. Dawson. I'm going to answer that. So Pafford has honestly not been following the initiatives of the board. For immediate release, those nurses have been hired and brought onto Pafford, and they received those applications far before they have them on flights here. That's just how processing works. So the board has, in fact,
Slow down
when
for me.
working-
Say that for me again.
So when Pafford hires a nurse,
Right,
they know that nurse is coming to the territory on an expected date.
right.
Pafford has been told numerous times in meetings from the board to give us those applications as soon as possible, whether it's 2 weeks out or further, even if the nurse is expected to be here, if the contract is going to expire or not, so we can work on those. Pafford has not done that. Pafford continues to bring nurses into the territory on random flights, whether it be a Thursday or Friday, expecting the board to license them within 24 hours.
So that's a problem. If they're bringing them in without you
Correct.
first being able to get these applications
Correct.
and starting the process,
So
that's clearly on them. Now,
That's them.
is this communicated to them in writing as well? Because I'm telling you,
Correct, it has.
I get the complaints all the time, but that's not what I'm hearing. I'm hearing
we have
that-
communicated.
What I'm hearing is that we give all the application information and whatnot, and there's still a wait time when the contract is only 30 or 60 days. And sometimes by the time you're completed with the licensure process, it's time for that nurse to go back.
So that's false. That's misinformation. So the board has worked tirelessly with Pafford, and though we have given them directives, they continue to follow their own lead versus listening to the board. Like a perfect example, earlier I stated that we just received applications from Pafford not even 48 hours ago with expectations to license those nurses by Monday morning for shifts on August 1st. That's unacceptable. It's also unsafe. So temporary permits,
1 minute.
temporary licensure, I'll answer that. It takes the board about the same amount of time and effort to review that application and issue a temporary license as it would if we just processed and gave them permanent licenses. It's the same application and the same timeline. We are expediting the expected 90 days to less than 2 weeks, and in most instances, less than 5 days for those travel nurses to meet safety and to meet the needs of our community. We've stepped up to the plate, but we need to find some balance from their leadership.
Well, I know you need that balance for sure. And so, Ms. Vanderpool Reimer, I think, Romney, I'm sorry. Don't crucify me. But I put you on the line last evening. I just had a conversation last night with someone, and I told them, you know what, we need a balance on this. But I am going to introduce you personally to you. And I meant to give you a call, not even looking at my schedule and realizing that you're here today. But I am going to put you in touch with someone so that we could find a balance, like the good doctor just said, so that we can be able to process these applications. They meaning Pafford can do what is expected of them and not think that there's a bunch of superheroes in there to get this process done overnight. But I understand that it takes a process, and we can't have these folks on the plane already coming here and you haven't even started the process. Because what if you find something negative in that person's background? Then they can't get licensed. They would have already brought them here. But
And
we
that-
can't blame the nurse licensure board for them being here and they don't get that license.
And just to add to that, this is Comisión.
Please give your name, yes.
This
Go ahead.
is Ana Comisión. Why we say give us a leeway of time, because these nurses have to come on a flight. They sent these nurses' names in on Monday. Where are we this week? In St. Croix testifying. So the ED, the chair, nor myself could sign off on any of those. The staff could do the preliminary work, but it has to be officially signed off and granted. So for them to start on the 1st, that can't happen, but these are nurses that they're trying to tell us is in the territory already.
So, Mr. Chair, with your indulgence. So there's a set, and I'm doing this almost live because I'm getting information. So there's a set, you talk about the 1st. So there's a set that's supposed to start August 1st.
And we got it this Monday.
You got it this Monday? Now you see the type of information we got. You're saying that you got it this Monday.
Mm-hmm.
This information is telling me that it has been sent for weeks.
No.
So who is doing the timeline? There should be a checklist on this.
Okay, Senator, this is Karen Vanderpool Romney, Executive Director. This has been ongoing since the inception of this contract with Pafford, with I actually don't know who they are. I know one is Clay, one is Mr. Pope. We have told them constantly via telephone. I have sent correspondence via email, and that's for documentation purposes. I've sent it to hospitals. I've sent it to the Commissioner of Health. I've sent it to the directors in Pafford. Pafford, at one time I was told point blank by Pafford staff head, when I told him there are rules and regs that he must follow, he hung up the phone, and before he hung up, he said to me, stated, quote, "You will hear from the commissioner and the governor," and hung up the phone on me. I said, okay. I received call that I have to do these permits, and these permits were done. The Virgin Islands Board of Nurse Licensure never issued permits or temporary licenses before. This was all new. Policies, documentation for staff had to be done. We did what we needed to do because we understand our role is the safety of the public, and we will adhere to anything once that is to be done. Pafford continually ignore, as Dr. Dawson said, all our guidelines and what we are supposed to do. So they'll send a nurse and tell us that the nurses have been here on contract, sitting here, and paid, and we must, they want us to issue those licenses. What happened to the other endorsement? The board does endorsement for other applicants. The board then must stop. I was just out on leave. The chair actually came one night after work at 5 o'clock to license and present how many?
68.
68, sorry.
Initial licenses. with all needed to
68
be verified.
initial licenses in a night. This is the kind of work that we are doing. We are trying our best with Pafford and the public.
So what I'll ask is for you to have a checklist as to when these applications are received so that you can have a track. Because like I'm saying, and I don't disbelieve you, and I know that every time you explain this to me, you say the same thing. So I think I've been an investigator for long enough to know when somebody telling me a fib, but your story don't change. And I'm saying that if they're not being upfront with when they have submitted these applications, then that's on them. But I'm not going to tolerate anyone disrespecting you all either. To tell you that you will hear from the commissioner or the governor and hang up the phone. Because then if that's the case, then let the commissioner and the governor handle the blasted licensure. Okay, but we're not going to tolerate any disrespect from anyone. And they're watching and listening because I'm getting messages back and forth. So I'm publicly saying to Parford as well, whomever that employee was that was so disrespectful, that it will not be tolerated by the board, and there's a process. And if you're saying that these license applications supposed to get in by a certain time, then by all means, let's tell them you need to get it in 2 weeks in advance or whatever the case may be, or under these emergency situations, see how else it can be processed earlier. But thank you, Mr. Chair. Good discussion on this.
Thank you very much, Senator Gittins. Point of information, Senator Soro.
Thank you, Mr. Chair. Nationally, we struggle with the whole travel nurse debacle. Because I know a nurse, one of my close friends, that makes $11,000 a week as a travel nurse. But I need to, I know a Parford nurse that sat for the entire contract and then was called to work in the last 4 days of the contract, right? So this person is being paid the whole contract to just enjoy the beaches, have fun, and then called, and then you get them a car, a place to stay, a weekly stipend, toilet paper and all the good stuff, and then the contract ends, well, you know, and then you call them to work in the last week. So, Mr. Chair, the point of information is that we may need to look at the stipulations of the contract. Who, like, you know, you have a project, there's a project manager to see that the engineers that you hired, or not the engineers are seeing that the workers are placing the brick where it should be. Maybe we need to revisit or look at legislation that requires oversight of these contracts, that if you're going to have a travel agency, that if a nurse gets their license within a certain amount of time frame, they have to go to work. Things have to be done. Like, I don't know what the contract states. I'm not in your field, but maybe we need to really look at how we execute the contract, because you have a lot of Parford nurses here right now. I could tell you they're lounging. They're lounging. So we need to really look into seeing how we could get them to work as soon as possible, if that's what they come here for, right? So thank you, Mr. Chair, for the point of information.
Very well, thank you. I need to take a 2-minute recess, and when we come back, we'll do a wrap-up, and we'll have a rapid-fire round. The Committee of Health, Hospital, and Human Services stands in recess for 2 minutes. The Committee of Health, Hospital, and Human Services is out of recess. And at this time, we're having a discussion with the Board of Nurse Licensure as well as the nurses. And Senator, before we go to Senator Gittens, I really want to say that again, that it's critical that we're all working together and that there's an open line of communication. There's no way that we'll stand for any disrespect to our board. There's a process. The process needs to be adhered to. And, there's exigency circumstances. We know that we're in a state of emergency, but it's important that we are following some mechanism of policy, some mechanism of check and balance, because the minute you allow that to fall apart, then we could very well bring individuals that don't have the proper certification, have the proper licensure, and then they're embedded into our healthcare facilities, and that will be problematic. So, while we want to move in a timely fashion, it's important because of the establishment of the board is for just that, to make sure that we're adhering to the policies. Senator Gittens, you had a point of information. You recognize?
Thank you, Mr. Chair. Once again, I heard the good nurse across the aisle there talking about the premium pay and whether or not they can increase the threshold. I've been fighting this battle from the start of COVID. But back in January of this year, I wrote a 4-page document to our legal counsel office. And just in the note, I explained that as per the U.S. Department of Treasury premium pay for eligible workers under the American Rescue Act plan, Section 5 of the January 2022 U.S. Department of Treasury memorandum outlined that essential workers are those in critical infrastructure sectors who regularly perform in-person work, interact with others at work, or physically handle items handled by others. Critical infrastructure sectors include healthcare, education and childcare, transportation and sanitation, grocery and food production, and public health and safety, among others, as provided in the interim final rule. Government receiving fiscal recovery funds have the discretion to add additional sectors to this list, so long as the sectors are considered critical to protect the health and well-being of residents. The interim final rule emphasizes the need for recipients to prioritize premium pay for lower-income workers. Premium pay that would increase a worker's total pay above 150% of greater of the state or county average annual wage requires a specific justification for how it responds to the needs of these workers. So all you have to do, apparently the 150% of greater of the state or county average annual wage, they have calculated to $70,000. But what this is telling you that is that all you have to do is provide that justification. So every nurse, every doctor, every person working in the healthcare field is entitled to premium pay. Don't let anyone tell you otherwise. And your nurses, whoever make above $70,000, should be also compensated. All they have to do is write the proper justification, whatever agency they're working from. It also says that the U.S. Treasury Department further urges that premium pay be issued retroactively to these essential workers. And lastly, the body, and I want to publicly again thank my colleagues for not only unanimously voting in support of it, but also signing on to the measure. What we did was we amended the COVID Leave Act to include the federal public health emergency, which we're still under, and the endemic. Apparently, they stopped paying the COVID leave during because the end of the local state of emergency. However, with the shortage of healthcare services in the territory, the request was to ensure that these essential employees are not required to use their personal acquired leave, and the current act only spoke to a medical emergency and territorial state of emergency. However, this will extend now through an endemic and a federal public health emergency that affects the territory of the U.S. Virgin Islands. Also, this allows for other employees from other agencies as well to be able to be covered under this. Again, I want to publicly, on behalf of my colleagues, thank you all for all that you do. And whatever we could do from our seats, we will continue to support our nurses. Thank you again. Thank you, Mr. Chair.
Thank you very much, Senator Gittins. Before we go to the rapid fire round, I wanted to ask the board if you could just quickly speak about NCLEX, the testing process, as well as if you could touch a little bit on CNA, LPN, what's going through in respect to that process for certification.
The testing process, this is Carmen Vanderpool Romney, Executive Director. The testing process for the NCLEX was not changed. The nurses apply, fill out their application, provide the necessary documents that is needed, and then they are given the information back from the board, and they make the appointment to test for Pearson VUE, with Pearson VUE. We have had challenges on the island of St. Croix where we had a little bit of delay, but that was because of information was not given correctly to them. But I think we're back on track, and they should be able to test as soon as possible.
And I know that you're working on an office space in St. Croix for the Board of Nurse Licensure. Would the tests, NCLEX, be administered on St. Croix?
The testing will not be administered on St. Croix. I got that complaint a few months ago, and I reached out to Pearson VUE to see what could be done. However, because of, with the testing site is per capita, and it appears as though we are not large enough to have two testing sites. And they also explained, Pearson VUE also explained to me, to man those sites is expensive. Also to set them up is very expensive. Some of the security measures I did not even know existed. So I think there was one previously on St. Croix, but they said based on per capita and I guess maybe how many nurses they cannot man two, or they cannot do two centers. I try to explain that we're unique, separated by water, but still as present, we cannot. I asked about using, I think in St. Croix there's one in licensing and consumer, and that's when I got the explanation that it must be full security. The site will not be able to house NCLEX examinations.
So I think that there will need to be a conversation, and we'll look at this during the funding process, because I think it's burdensome for individuals from St. Croix to have to go over to St. Thomas. Chances are a lot of times they have to go over from the night before, get a hotel room, get the test the following day, and you know, if it goes long enough, they may not be even able to travel back on that particular day. So it might be a 3-day process in order for them to be able to take the NCLEX. So you know, we will have to have that conversation by how we could perhaps subsidize and assist these individuals in that process. Okay?
Senator.
So we'll go to a rapid fire round if you need it. Certainly you'll be recognized. If not, we could move on. Senator Blyden, 2 minutes. You're on mute, Senator.
I'm sorry. Can you hear me now? Very well. I'm happy that my colleague clarified that the nurses at the Department of Health need to be made whole retroactively, and I'm thank you, Senator, for that. Ms. Romney, good afternoon. Let me ask you quickly. You were spoken to in the testimony in respect to the Board of Licensing Literature, and also they spoke to challenges. I know you had challenges in the past with the hospitals, and in the testimony was stated that you work with Hartford and the hospitals. What does that collaboration and communication look like, and what are you doing to address the challenges you're facing, if any, at this time?
As the board, and I would say for the record, the threats that I had, I don't take them personal, but as the executive director, I am duty-bound to follow the Nurse Practice Act and the rules and regulations of the country. We at the board, we try our best to communicate as well as we can with the hospital. As a matter of fact, we do not. The board, human resources of both hospitals, they will call us today and tell us they need something, and we could pull out one license and issue it for them. We have done our best to communicate and work with the hospital to ensure that our nurses are there for them. So we are working together. I actually don't have a problem currently with the HR in the hospitals. We are only have problems with Pafford, with them disrespecting the board in when we request our documents or the time frame in which we are requesting them to submit the documents to us for faster processing.
30 seconds.
Other boards have worked with us. I don't see why Pafford cannot. Not
So what
other
are you doing
boards,
to-
sorry, other
what are you doing to-
agencies. Excuse me?
What are you doing to address those challenges with Hartford? In writing.
Yeah, repeat your question, Senator. You broke up.
What are you doing to address the challenges with Hartford? In writing.
We have done many things with Pafford. We actually give Pafford, I would say, ice cream with everything. We call them. I went out there. We met with them. We took their licenses to them. We correspond with them in emails. I have several emails to Pafford telling them what they need to do, but they continue to do what they, I guess, feel like doing, and
Time.
also their nurses. We have nurses telling us that they're not going to do certain things because their agency told them not to do it.
Well, I ask that you continue to uphold the law and do what's right. And
Correct.
at the end of the day, we'll do what we can do to deal with Hartford in respect to that, along with others who have oversight over them. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Blyden. I want to remind our testifiers that before you speak, if you just give your name, our recorder is remote. So, Ms. Romney, you recognize.
Yes, just for simplifying this whole thing. This is Carmen Vanderpool Romney. We are now dealing with IRE, which is a new agency that's coming into St. Croix. Prior to that agency coming into St. Croix, the staff recruiter called the board, asked for a meeting with the board to ask us how can she assist us in expediting this, her licenses. That's over 60 or 40 she's going to have. That's respect. And we are working with her. She is coming in to help us or help them expedite this process. They're not just sending something and expect us to do it. That's working together. Thank you.
Thank you very much. Senator Whitaker, you recognize for your 2 minutes.
Thank you, Chairman. So the question I have is really, what are the next steps? And when is the last, what would you all consider a meeting? I mean, I think we just need to come together. Meeting with the head of Pafford, the Commissioner of Health, and so would that be a next step that you guys will contemplate to address this issue? And of course, even us with the senators, we hold a kind of internal meeting so we can address this.
This is Tanisha Penn, the chair. This would be our third meeting with Pafford and Department of Health, as well as many emails that were sent among the process. We have no issues having this meeting again to reiterate the process, what takes place when it comes to licensing and credentialing of the nurses. Yes, we will have another meeting again.
Thank you. And I just a message to the administration. I mean, here it is. We are, I mean, I never really get the lack of following our laws. And that's our responsibility as senators. But I think when it becomes, we're getting to a point where we might need some legal approach to this because because it's really, it's not right what's taking place. And I think we're at that juncture. And so I think that what we may also need to contemplate is some legal decisions being made, some stoppage of what's going on, because we're compromising our people's health. You all are the experts, and you know what the process entails. And so I am committed to working along my colleagues. Of course, I'm not a necessarily a committee member, but I support healthcare and I support the health efforts. But what we should try to really do is, if they're not following the law, we have to take it then to a legal approach. And so have you all even consult, is there an attorney assigned to the board that can help you
30
wade through
seconds.
these illegal actions?
Carmen Vanderpool Romney, Executive Director. We did reach out to the Attorney General. I sent the chair, vice chair sent a letter about 2 weeks ago to ask for some, guidance, legal guidance. Thus far, we haven't received a response, so we're still waiting.
Okay, well, to Attorney General and anyone who's listening from her office, we have to get responses. So you're asking for a legal opinion, and that should be forthcoming. So I will work, of course, with the chairman. We should work all together to get the legal opinion to move this forward. And thank you all for your advocacy. Thank you.
Thank you very much, Senator Whitaker. Senator Sari, recognized for 2 minutes.
Thank you. Thank you, Mr. Chair. Just two brief questions. Those nurses who are in the negotiating table, what's the average salary that you're requesting? What those figures look like?
We're requesting to start at 75,000, I believe, currently, and I believe to max out closer to 105 for RN bedside nursing.
Not a RN, or I know you have the higher nurses.
The APRN?
Yeah.
The nurse practitioners, we're asking to start closer to 110 a year, and then they would max out closer to 160, I believe. But I have a pay scale that we sent to OCB as well that I can send.
Can it be sent to the body so we could look at?
Yes.
Okay, through the chair, I'd like to request that pay scale. And then roughly, what would the appropriate salary cost us yearly? You have those numbers? Like, what would that bump look like?
It would look currently at about a 25% increase across the board.
For all nurses?
All. Mm-hmm.
Okay. So based on what we pay you now, we just need to add 25% roughly to that.
Roughly.
That means your fringe would increase as well. Your fringe is still at the 46% mark? 48, 46?
Yes.
Okay. Ms. Canton, you want to talk to me? I was hearing some
Yes, I do, because the leadership nurses would be experiencing the same thing. It would be at 25%. Right now, we're at the max is 88,000 for our CCCs, and we're looking at those salaries also because, of course, supervisory has a different role within the hospital.
Ms. Canton?
So we're looking at that 25% also. You can hear me?
Yeah. What's a CTC?
A CCC is a clinical care coordinator. She actually works and takes care of the entire house. So she runs the hospital.
That's a nurse?
She's under the level of the chief nurse officer. Yes, she is. And also I cover the head nurses and the assistant head nurses and the administrative care coordinators, which are usually your case managers.
So, Mr. Chair, what's your max on that one again, the CTC or the leadership?
You'll see at 25% on that $88,000.
Well, right now the max is 88.
The max is 88. That is just base pay. That doesn't cover any overtime or anything that the supervisor might have done.
Thank you, Mr. Chair, for the latitude.
Thank you very much, Senator Soro. Senator Francis Heidegger, you're recognized for your 5 minutes. I'm sorry, that's 2 minutes. 2 minutes, 2 minutes.
It's okay. I know. Thank you once again for the time. I want to ask, one of the things that was brought up in the testimony had to do with the concerns of the environmental and workplace concerns that's been happening. Have you guys had a sit down or speak to anyone and receiving a timeline for some of these things to get fixed, and the concerns that you were having, as you did share that some of these issues prompted individuals to leave the hospitals as nurses?
This is Dr. Dawson speaking. In relation to JFL, the continued response has been primarily we're going to be moving to the JFL North facility, and it should resolve those issues. It wasn't until nurses on the unit, for example, labor and delivery, started becoming ill, and one specifically actually having to resign before anything actually occurred on that unit specifically. The conditions kind of continue to follow when something comes up. Rather than being preventative or working in advance, we're waiting and being reactive. So a lot of it's more reactive. And we have met, but
So-
the answer is JFL North.
Okay, so in regards to JFL, you're basically saying to me that they are aware that these things could potentially be causing health issues to the workers, as well as major concerns for the employees, but the response is just, we're moving. But we have been moving since I have been a member of this legislature. So I'm a little bit concerned that that's headed into 2 years. And to have these types of issues that you guys were discussing, that's a major problem. And, you know, it's one
30
thing when you
seconds.
come before the legislature and you bring this to our attention, but a lot of times these things have to be resolved under the executive branch. It's their job to execute. It's their job to clean up a lot of these things. And we're here in shock when we're hearing some of these things from you, because it should never be happening. But at the end of the day, I could only be a mouthpiece. I could pick up a phone, I could call, I can encourage. My colleagues could try to force issues by writing things into legislation. But a lot of these things have to do with policy and giving a hoot about the very people that you claim you give about and to care about. So I am seriously looking forward to you guys giving us an update as to what is being done, and not just consistently being told, you know, we're moving. We're moving is not an answer. Thank you so much, Mr. Chair, for the time.
If I may,
Thank you very much, Senator.
if I may respond to that.
Senator Francis Heidegger, you may. Again, you need to be succinct.
Thank you. This is Michelle Montoya, registered nurse. Senator, they have known about this for years. In 2019, the ICU staff had been complaining every day regarding the mold, the itching, respiratory issues, etc. It wasn't until the governor and an associate of his went into the ICU. The associate immediately had some type of respiratory attack, had to be ushered out, and then within 2 weeks, the ICU was closed and remodeled. So when you talk about, you know, the people that they claim to give a hoot about, that's exactly how we feel. It took for someone that is important to come in order for our own staff to be recognized in their health issues. Thank you for your time.
Thank you. Thank you very much,
May I
Senator.
answer, excuse me, may I answer on behalf of health also, since that question extends to us? We've done many things. We've reported our situation to OSHA. We've had an investigation done. We were refused the actual results of the testing of our building. All the modulars are infected to a certain extent, and we were told the staff is going to move. We are still in the tent and hopefully to move by the end of this month. And like Ms. Montoya said, it was only until we stepped up to the executive branch and said, this is the problem, when we were taking actually serious. And that's it. Thank you.
Thank you very much, Ms. Canton. Senator Gittens, you're recognized for your 2 minutes.
Thank you, Mr. Chair. So, on the line of the licensures, have you had any experience where any of these nurses have, or strike that, is the contracted company with these nurses required to do a preliminary background check on any nurses coming into the territory before they request a Virgin Islands license?
Tanisha Penn, Chair. All nurses that's coming into the territory, we do a vetting process.
Can you speak up a little
Sorry.
more?
All nurses coming into the territory for licensing, we do a confirm check using nurses. That's with our national database.
No, I know what you are required to do by,
you
by
mean for the
law.
company?
But does a company, do you require the company to do a preliminary check and then you still go over and do yours?
No.
No?
No, we do not.
This is Dr. Dawson. So we weren't ever involved in the company or contracting process to help streamline licensures. So we never were involved to help streamline that process. So we never gave input, and even though after our input, it still hasn't been taken into consideration.
So can I suggest that you have conversation with the Commissioner of Health so that this can take place? Because what
30 seconds.
I'm told that you had an instance where one of the same nurses that they were trying to push through and get you guys to see if you could get the license done, that they had actually lost their license elsewhere and was shuttled here, of course, because we're so desperate, I guess. We've had situations like that?
On Tanisha Penn, we have had situations where applicants came in and we saw disciplines on their record. So we just pulled those applicants out and had discussions with the board.
So you're being nice about it. I'm not talking about disciplines on the record. I'm talking about straight out revoke license and then come to the Virgin Islands.
Well, I haven't seen any revoked license, but I have seen disciplines on licenses when we're doing the vetting process. So once we see those, we pull those applicants out and we have the discussion with the board if to go forward with licensing those individuals.
Well, hopefully going forward after this discussion today, we're able to streamline a lot of this. I have already said I'll put some folks in contact with each other. So I'll ask, I'll do that after this hearing is done, and hopefully going forward, it will be a much smoother process in trying to get them. And lastly, do we give our nurses an opportunity? Is it, maybe the nurse could tell me whether or not our nurses get an opportunity to get a piece of this pie, because it seems like we prefer to pay people coming from outside way more than we're paying our own. Any of our local nurses getting a piece of this action?
This is Dr. Dawson. That's also been somewhat a challenge for JFL because we have lost some of the staff to travel contracts in St. Thomas.
And I'm noticing it even with the doctors. We prefer pay
Correct.
a entity, an exorbitant amount of money and whatnot, and not pay the doctor directly. And we end up paying much more money.
Senator, please wrap up. We
Thank
have
you.
two other measures,
Thank you. Wow, you were aggressive today, boy, with me. Thank you.
Oh, we've been at this for a while, and certainly we have two other measures. I have people that's been on standby since 10 o'clock this morning and have flights to catch and other things. So thank you. I think that this has really been a very robust discussion. There's a lot of information that has been brought to light here today, and my colleague spoke about next steps. I think it's critical that we're able to hone in on the next steps, and I am interested in some recommendations, some suggestions from you, the ones that's in the trenches, in respect to how do we come up with some recommendations to resolve some of the issues that's confronting us. All right, so again, I want to thank you, and we'll try to schedule a follow-up in the next perhaps 45 to 60 days, so that we can see where we're at and where we need to go in respect to what's happening in your various areas of responsibility. The Committee of Health, Hospital, and Human Services will stand in recess for 5 minutes, and then we'll quickly vet the next measure and then go into the behavioral health.
The Committee of Health, Hospital, and Human Services is back on record. And Madam Clerk, can you please read the next item on today's agenda?
Bill number 340244, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 191A and D, to expand and clarify the definition of naturopathic medicine and the physical modalities used in the practice of naturopathy, sponsored by Senator Genevieve R. Whitaker. Invited testifiers, Aziza Shabazz, esthetician, physical trainer, Aziza Nature Spa, Dr. Lorianne Logo, Studio 360, Chiropractic Wellness and Functional Movement Center, Shannon Braden, Executive Director, North American Board of Naturopathic Examiners, Chelsea Leander, Naturopathic Physician, VI Family Wellness, Daniel Seitz, JD-EDD, Executive Director, Council on Naturopathic Medical Education.
Thank you very much, Madam Clerk. Who speaks to this bill? Who speaks to bill number 34-0244?
I do.
Senator Whitaker, you recognize for presentation of bill number 34-0244.
Thank you, Mr. Chairman. Good afternoon again to my colleagues and to the people of the Virgin Islands. Good afternoon to the testifiers. I want to I'm here before you all today just in stand in hopes of passing bill number 34-0244, which addresses naturopathic medicine, moving naturopathic medicine forward. By way of background and history, on December 10 of 2001, pursuant December 10, 2001, the act was passed to fully establish naturopathic care in our territory. However, since that time till now, really the matter of naturopathic medicine, naturopathic healthcare has been, not that it's not stagnant, not available, but not fully really implemented. And so I seek to move this measure today. I also want to add that when we speak about natural medicine, we can, from the perspective of American naturopathy, that Benedict Luss, founded it in America, but we can really go further, much further back than that. All the way back to 2000 BC with ancient medicine, both ancient Chinese and Egyptian writings, really provided the descriptions of the medicinal use of plants that were used for healing rituals, and is really a tool for cultures around the world to heal individuals. Naturopathic doctors treat the root cause of many diseases and see their patients as a whole person. This medical practice helps to improve a patient's overall health and well-being, and my goal is to provide the Virgin Islands with the community of the Virgin Islands with another option in terms of medical practices. A naturopathic doctor can strengthen weakened immune systems, stimulate self-healing mechanisms, and remove harmful habits to your health, such as poor diet, digestive disturbances, inappropriate and chronic stress levels, and individual disharmony. Why do we want this bill? As provided in the 6 principles of naturopathy, and of the understanding of us, really understanding that naturopathic medicine does no harm to the body. It's healing power of nature. It helps to identify illnesses and remove obstacles to cures. Naturopathic medicine opens the doors for doctors to elevate their patients using health literacy. Naturopathic doctors can understand your body and treat the whole person. Naturopathic medicine helps prevention of illnesses and suffering through comprehensive practice. We want our people to learn beyond the traditional medicine, beyond some of the scientific practices, and then with hopes of moving this measure along with a companion bill, which will come in another committee, I submit this request and consideration of my colleagues to move this measure forward. I conclude in my introduction that I encourage my colleagues to approach the information you'll hear with an open mind and drive to improve the healthcare for the people of the Virgin Islands. And Hippocrates says, let your food be your medicine and your medicine be your food. Bill number 34-0244 is an act amending Title 27, Virgin Islands Code, Chapter 4, Section 191 and D to expand and clarify the definition of naturopathic medicine and physical modalities used in the practice of naturopathy. Section 1, the Title 27, Virgin Islands Code, Chapter 4, Section 191 is amended as follows. Subsection A is amended at the end of the subsection by adding a new sentence to read, it may include the use of electrotherapy, dermathy, hydrotherapy, naturopathic manipulative therapy, and acupuncture. B, subsection D is amended by striking the words and therapeutic exercise, inserting a comma, and adding the following language: electromagnetic, non-ionizing radiation, ultraviolet light, ultrasound, therapeutic exercises, and therapeutic substances recognized by the Council of Naturopathic Medical Education. This companion bill expands and clarifies the definition of naturopathic medicine and physical modalities that are used. And that concludes my introduction of the bill, Chair.
Thank you very much, Senator Whitaker, for introduction of Bill number 34-0244. At this time, we'll go to the testifiers, and I'll ask them to do a device check at this time. And, well, first of all, Ms. Shabazz, you want to introduce yourself?
Good afternoon. And thank you for having me, Honorable Senate President and Honorable Senator Genevieve Whitaker. And also I acknowledge all of the senators present from the 34th Legislature. I'm Aziza Shabazz, an esthetician.
Yeah, just your intro for now, and then I'll get you to give your statement. And Dr. Logo? Shannon Braden? Attorney Shees, how you pronounce his name? Says?
Yeah, he's not here.
Daniel Seitz?
Size. Okay. Very well.
Yeah.
Just a mic check at this
Daniel
time.
Seitz.
Introduce yourself.
I'm the Executive Director of the Council on Naturopathic Medical Education.
Okay, very well. And Leander? Chelsea Leander? Okay. Ms. Shabazz, you could go ahead and proceed with your testimony at this time.
Thank you. Aziza Shabazz, I present this testimony on Bill number 34-0244. I support the need for a naturopathic pharmacist and herbalist physician to be licensed and available throughout the territory and to serve on the Board of Naturopathic Physicians. The people of the Virgin Islands have historically turned towards the natural means taught generationally for health and maintenance and treatment for acute and chronic conditions with success. Many elders have relied on these methods and reluctantly seek treatment from our current medical allopathic care when conditions get acute. Guided preventative care, as well as acute treatment, is a welcome addition to our community and will serve to enhance the health status of our population. I continue to seek the advice and care of herbalists, naturopaths, acupuncturists, chiropractors in our Virgin Islands community and abroad to assist me in maintaining my health and well-being. Oftentimes, this care had to be accessed outside of the Virgin Islands. I advocate the need for the availability of these services here in the Virgin Islands. Preventative and natural-based health care has proven to enhance and improve the health of our communities and to allow for a higher level of life for individuals and families. Why naturopathic care? Please allow me to insert here a definition directly from the Association of Accredited naturopathic medical colleges. Naturopathic medicine is a distinct healthcare profession that combines the wisdom of nature with the rigors of modern science. Naturopathic doctors are trained as primary care providers who diagnose, treat, and manage patients with acute and chronic conditions while addressing disease and dysfunction at the level of body, mind, and spirit. Naturopathic physicians concentrate on whole patient wellness through health promotion and disease prevention, while addressing the underlying cause of the patient's condition. Naturopathic physicians care for patients of all ages and genders and practice in settings ranging from private clinics to integrative medical centers, urgent care clinics, and hospitals. They provide individualized, evidence-informed therapies that balance the least harmful and most effective approaches in order to help facilitate the body's inherent ability to restore and maintain optimal health. Naturopathic doctors are experts in natural medicine. Currently, there are 26 jurisdictions within the U.S. and territories that have provisions for naturopathic medicine. We are one of those. Many of those jurisdictions have large rural-based populations that have relied on natural means to maintain health. The Virgin Islands community has a foundation in agriculture with many backyard and container gardeners. These small herbal gardens have contributed to the health and longevity we have been known for. It is only recently, since our turn towards pharmaceutical remedies, that our elder population has suffered a rapid decline in health. I look forward to establishing a doorway for naturopathic medicine to become a viable and strong factor in our medical community. It is necessary to provide the access to holistic and preventative medicine through trained professionals as well as practice-based practitioners with the knowledge of natural and herbal remedies. I applaud the efforts of the members of this legislature in recognizing the need for this measure in our community and offer my full support of all efforts to implement this needed measure. Thank you.
Thank you very much for your testimony, Ms. Shabazz. Next, we'll go to Attorney Sykes. Sykes. You're recognized for your testimony at this time.
Great. Good afternoon, Senator Francis and members of the Committee on Health, Hospitals, and Human Services. My name is Daniel Seitz, and I'm the Executive Director for the Council on Naturopathic Medical Education. Thank you for this opportunity to share information on the Council, which I will refer to as CNME. The CNME is the only U.S. Department of Education recognized accrediting agency for Doctor of Naturopathy programs, often referred to as ND programs. The CNME's function as an accrediting agency is similar to that of the Liaison Committee on Medical Education, the LCME, the U.S. Department of Education recognized accrediting agency for MD programs. Also similar to LCME, which is composed of medical educators, medical doctors, medical students, and public members, the CNME is composed of naturopathic medical educators, naturopathic medical doctors, and public members. CNME accredited Doctor of Naturopathy programs prepare students to become licensed naturopathic medical doctors. These programs are primarily residential, are a minimum of 4,100 hours in length, and typically require 4 or more years of full-time study to complete, including a clinical internship in the 3rd and 4th years of the program. The institutions of higher education in the United States that offer CNME accredited ND programs are all also accredited by institutional accrediting agencies recognized by the U.S. Department of Education and the ND degree is authorized by the respective state boards of education where the institutions are located. The CNME has established high standards for the education of naturopathic medical doctors. Like conventional medicine, the practice of naturopathic medicine requires extensive knowledge and expertise, not only in natural approaches to healthcare, but also in the clinical and biomedical sciences typically taught in MD programs. The CNME's educational standards are used directly or indirectly as a basis for licensure in the 26 U.S. states and other jurisdictions that license naturopathic doctors. They provide assurances to the public who are increasingly using integrative, complementary, and alternative approaches to healthcare that graduates of ND programs are safe and effective healthcare providers. Licensing naturopathic doctors benefits the public in the Virgin Islands and elsewhere by ensuring that patients have access to safe and effective natural and integrative medicine care. Also, having a licensing process in place helps to attract new practitioners to a locale, which also benefits the public by increasing the availability of qualified naturopathic medical doctors. Lack of licensure, on the other hand, means that patients have no way of distinguishing well-qualified practitioners from those who may be poorly qualified. Finally, I'd like to note that naturopathic doctors, like MDs, study a wide range of therapies, both during their formal medical education and later on through postgraduate education. Once in practice, NDs generally develop specialties that reflect their interests. The therapies listed in Bill number 340244 are ones that naturopathic students and practitioners typically learn and utilize in their practice, though they are not specifically listed in the CNME standard that outlines the requirements for ND program curriculums. Thank you for this opportunity to share information on the Council on Naturopathic Medical Education. I am happy to answer any questions that you may have.
Thank you very much, Attorney Sykes, for your testimony here. And before I open up the floor, is there anyone else to testify on Bill 34-0244? If not, Senator Whitaker, you had something else to say on this? Okay, very well. So, Senator Blyden, you're recognized for your 3 minutes.
Thank you, Mr. Chair, and good afternoon to the testifier, and thank you so much for your testimony. I must say that Bill number 34-0244 basically clarifies and expands the practice of neuropathic medicine, and I believe that this legislation is deserving of enthusiastic support and co-sponsorship. Of course, I will sign on as a sponsor. I think it makes sense, and it advances the developments that have taken place in the field for many years and decades, as a matter of fact. As healthcare disciplines evolve and as techniques become available, and the technology advances, I think it's important that our regulatory laws and structures keep pace in order for Virgin Islands residents to receive such benefits and the latest advance when it comes to the medicine. As we know, we have many so-called, although as younger, you call them bush doctors, etc., who have been into the field, but once this bill advances, you will have people who qualify and are certified, and, in terms of what's stated about by Mr. Shabazz? No. But anyway, it basically speaks to us having more practitioners come to the island because, we're on a certain level, which makes sense. And I must note also that it should be in this bill, it is informed by standards and by the guidance of authorities within the field of naturopathy and not internal medicine or radiology or some other specialty, because I think that's critical when it comes to any type of bill that deals with healthcare and the health of our people. So I must say, I do support the bill. I believe that when it comes to this type of legislation, we must follow the guideline also of our legal counsel. I wanted to note to the sponsor of the bill, the drafters note that our legal counsel posted, which I know she will address, which states that pursuant to Section 16 of our Revised Organic Act of 1954, this section of the bill expands and clarifies the definition of naturopathic medicine and the physical modalities used has to be separate from the bill and addressed in a different area when it comes to the board of naturopathic medicine. So I believe that she will deal with that as the bill moves forward, but I think it's a good bill, and I will be supporting this bill at the appropriate time. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Blyden. Since you opened the door in respect to the drafters note, legal counsel, can you put on record or you speak to the note, the drafters note that was put on this particular bill in terms of having the separate legislation? There's also an amendment that will be offered at the appropriate time, but can you speak to the drafters note?
Yes, good. Is the mic on? Oh, good afternoon, Mr. Chair. This bill actually has a companion bill, but it appears that the companion bill was assigned to another committee, which basically deals with the membership of the board of the naturopathic medicine, pursuant to the Organic Act, Section 16C. When it comes to legislation involving any board in the Virgin Islands, any other type of legislation has to be in a separate legislation. So therefore, with the request that was sent in, which is BR 220190, I divided that bill. So there's a 22-0910B and 22-0910A. And the A specifically deals with the composition of the naturopathic board, and that one is also making its way through the committee. This bill in particular deals with the different modalities and expanding and clarifying the naturopathic medicine within the Virgin Islands.
Thank you very much for that clarity, and this is not an unusual drafter's note in respect to separating and right-fitting exactly where this bill will fall. So that bill will be considered in the Committee of Rules and Judiciary that has the responsibility over boards. So before we go to Senator Asaro for her line of questions, I wanted to ask, because of course body chemistry is all made up differently, and at what point, Ms. Shabazz, will someone determine whether or not they want to go towards prescribed medication versus maybe natural medicine? How do you make that determination? Is there a referral that's made to you? How are you deriving your patients?
Thank you. Aziza Shabazz here. Basically, the naturopathic physician has to make that determination based on the factors presented when the patient comes for consultation, because many times they have consulted traditional medical sources before coming and reviewing the information, the presenting issue, the diagnosis. All of that is what is used to determine what is the best road to take for healing. Many times, two roads will go. First, you will do the traditional medical suggestions, and oftentimes, depending on the patient's condition, the results are not being seen. Many times what's been prescribed is not, it's prescribed as, try this, see if this will work for you. Whereas with naturopathic remedies, many of the remedies are already known to help that particular condition, and there will be another prescribed method of treatment.
And is there any form of medication that's given by naturopathic therapists? Is it herbs or any kind of medication?
There are many different forms. It could be herbally, it could be using oils, it could be using other essences. There are many different formats. Also, it could be the type of treatment itself, like the electromagnetic treatments. Also, there's vibrational medicine that's used. Hands-on treatment is used as well. There's many different types of treatment depending on the condition and also on the person's background health-wise. So it's more geared towards individual care and on long-term prevention of the continued condition. So not just taking care of that problem today, preventing the problem from continuing in the future, and keeping health at its optimal.
Thank you very much. Senator Soro, you recognize for your 3 minutes.
Thank you, Mr. Chair. Just to piggyback on the question that's happening, do you think that that could be rectified through promulgation of rules and regs via the board?
I'm not clear. Could you repeat?
The initial question was knowing when to refer the client or the patient for care elsewhere, right? Like most doctors do. If you go to a doctor, they say, hey, I can't do this. Let me refer you to a specialist. Do you believe that outside of the honor system, where the naturopath has to, the honor system where the naturopath would use their common sense to say, hey, something more is happening, do you think that should be something that's really like in black and white, promulgating in rules and regs?
Generally, the training and wisdom of these physicians is such that they can recognize what they can care for and what they cannot. It's part of their background education. And many are trained well enough to know what they can handle and what they cannot. Also, many will suggest that the clients seek other care alongside of the naturopathic care, because many of the natural remedies are more preventative and long-term, whereas if it's gotten to an acute state or a chronic condition, it may be beyond the scope of what the naturopath can handle.
Because I just know someone that was trying to have a home birth, and that went way left, and that person didn't know to say, hey, you know, we need to go to the hospital at this point. So, and I guess the bill sponsor, you said an amendment is coming, because I do believe that we need to add the massage therapist and the like under this, because I think under this legislation, because I think you really need a board. Everything should be housed under that one component, so there can be rules and regs, because I don't know where massage therapists fall under, and that's
1
natural,
minute.
right? So, and a personal question. I mean,
Yes.
you have a very nice bachelor's degree in political science, and you abandoned us for aesthetics. Nothing's wrong with that. It's okay.
Well, I actually did go to law school for part of a semester and decided that healthcare was more of my
Your calling.
field. Yeah, my
Yeah.
calling. Unfortunately, at the time I went to school, naturopathic medicine was not in the forefront. There were not many options for that education, or I would have definitely pursued that and been now a physician. So people call me doctor because of all the things that I have learned and done. And I will speak on your comment about the home birth. I have attended home births, and I have also advised women against staying at home, because I think that there are many risk factors there, and it should not be something that people just take on without proper backup. And I'm one of the first ones to tell people this is not something that can be handled outside of the regular medical field. So
Time.
it has its place.
Thank you so much, and I'll support the.
May I ask? May I respond to the question of referral?
Yeah, one second, Attorney Sykes.
Sure.
I didn't even know he was online, but sure, on your time, Mr. Chair. Thank you so much.
Thank you very much, Senator Saru. Attorney Sykes, you may respond on my time.
Yes, I just want to say, and again, I'm the executive director for the Council on Naturopathic Medical Education, which actually sets the educational standards for these doctoral programs, and we inspect the colleges where they're offered. And knowing how to refer, when to refer is a very important and substantial part of the training. Naturopathic doctors work within a prescribed scope of practice, and they absolutely have to understand when they are dealing with acute conditions for which they do not have the medicines or the treatments that are appropriate, and also for certain chronic conditions that naturopathic medicine may not be suitable for. Oftentimes, naturopathic doctors training also will be alongside other medical professions, so they also have opportunities to learn about what other medical professions do and what their strengths and shortcomings are. So it's really not up to the common sense of the individual practitioner or to custom or whatever. It really is an essential and explicit part of the naturopathic training.
Thank you, Attorney Sykes. Point of inquiry, Senator Saru. Please recognize Senator Saru's mic.
Thank you, Mr. Chair. Doctors of osteopathy really focus a lot on the natural component. I guess this is to the attorney. What's your last name again, sir?
Sykes.
Sykes. Should doctors of osteopathy fall under your purview as well, or where would they fall?
So let me say, yes, you're absolutely right that doctors of osteopathy also tend to be very open to natural and integrative approaches to healthcare. They are closer, you might say, at least traditionally, to chiropractors in that they emphasized a lot of the training on structural manipulation of the human body. But like chiropractors, they also have tended to expand into looking at other aspects of natural medicine, such as diet and nutrition and so forth. In many states, osteopaths are now licensed by the same board that licenses MDs, and that's because there's a fair amount of commonality between their two programs. Naturopathic doctors are similar to osteopaths and MDs in that they also study a lot of the basic and clinical sciences that MDs and osteopaths study. And they also have to do the full pre-med type of training before they are eligible to apply to naturopathic doctoral programs. What makes them a little bit different is that they study a range of different natural therapies. As was discussed before, these include diet, nutrition. There is a naturopathic manipulation technique. They use such things as homeopathy, herbal medicine. They can sometimes use acupuncture and so on. So that's the big difference, that they're learning a range of different natural modalities, but they're also coming from the same background as MDs and DOs in the sense of doing basic and clinical sciences from the Western standpoint.
Thank you. Thank you very much. Next, we'll recognize Senator Francis Heidegger. You're recognized for your 3 minutes.
Thank you so much. Good afternoon to the testifiers, to the people of the territory, as well as central staff and my colleagues. Well, my first set of questions, do we have a number of how many naturopathic doctors are here in the territory that currently exist?
Who is that question to?
Well, I could address it to the attorney, Sykes. Is he aware since he?
No, I do not track that type of information.
So would anybody on testifying would know if anyone here has a naturopathic. No one?
Well, typically,
Okay.
typically a licensing board, and I'm not quite clear on the licensure status. I know you do have a licensing law, but that would be the entity that would most likely know the number.
What I also wanted to find out when it comes to naturopathic medicine is any type of pharmaceutical training in case of emergency or et cetera, is that also taught to them in school, or would a board have to create a policy in regards to that?
The education does include training in pharmacognosy and pharmacology. And again, that's in order for the naturopathic doctor to be able to recognize potential side effects, and also to know that if patients are on any conventional medications, whether there may be concerns with any of their natural interventions in terms of the effect on the conventional remedies. So they gain what you might say a baseline literacy in pharmacology so that they can better serve the needs of their patients. In a few states, they are allowed to prescribe certain conventional remedies, but that's done on a state-by-state basis, and that would be specified by statute or regulation.
Okay, thank you for that. I know that it was suggested that licensees potentially have to do and complete 30 days of continuing training. Is this something that you believe that? Oh, I thought someone had said something. In regards to continuation of training and education as a naturopath, do you believe that this is something that has to be board approved, or is this something national where it's standard for naturopaths to continue to have continuing education?
It's certainly standard for doctors of naturopathy to have continuing education. And there are national organizations. There's a national professional organization in the U.S. that offers extensive training. There are also state professional associations and some specialty societies. And some of these programs are state recognized, state approved, and that's a state-by-state decision.
Okay, thank you. Did I hear time? I want to make sure because we're limited to
You have 30
minutes.
seconds remaining, Senator.
Okay, thank you. I want to ask in regards to the process of licensure that that would be coming about. Would there be parallel to licensure for, say, a regular doctor versus a naturopathic doctor cost-wise? Because some might say they're different levels. Do you think that they should be on the same level when it comes to cost and fees, et cetera? Regular versus naturopathic?
Time.
So just, I mean, I can answer that if that's helpful. Typically, states will base the cost on the number of practitioners. It depends upon whether the legislature feels that the fee should be able to support the work of the board or not. So there's a judgment call on that. Because there are a smaller number of naturopathic doctors, it may be a higher fee that's charged them, although you would not want to be so prohibitive that people would not be able to afford to become licensed. But apart from the fees, the licensure process is very similar across all medical professions. Graduation from an accredited program, passage of a licensing exam, a check into the legal aspects of a person, whether there are any criminal record and so forth. And sometimes states will also check in, provide some training on the laws of that state.
Okay, thank you so much for those responses. Thank you, Mr. Chair, for the additional time.
Thank you very much, Senator Francis Heiliger. I was wondering, in terms of oversight, regulatory oversight, is Department of Health overseas? Nicole Kirkwell Sims, you could shake your hand. Or you do?
Wait.
Yeah, very well. Yeah, okay. Senator Whitaker, you recognize for your point of information?
Thank you. Thank you. Thank you, Chairman. For point of information, so the overall goal of the efforts that I'm making is that to expand the scope, to enable our current naturopathic physicians in the territory to be able to even offer insurance, but to expand the scope as well as to address the board, and that's why my companion bill will be held. It's going to be heard in the Committee on Rules and Judiciary because it's a two-part approach. We did have testimony today on the record. One of the doctors had to leave because she had a patient to take care of because of the timing of today's hearing. But that is part of the record, and she expounded, as Dr. Leander expounded on her treatment mechanisms, also offered amendments which her and I had discussed be offered as we move this forward. So I just want to put a point of information that this is an ongoing effort. I will be offering another amendment to push this forward, but we're trying to expand the scope. The board needs to be stood up because it's not, and you have instances where persons are not able to fully practice because of the limitations of our law.
Senator, you're not recognized for your 3 minutes.
Okay. Thank you. Thank you, Chairman. And good afternoon. Once again, I want to first off thank all the testifiers for their testimony, even those who were not present, but for sharing their testimony and the support for moving this forward. To Ms. Shabazz, based on a lot of your training, particularly in the healing world, esthetician, and also as a practitioner in that area, what resources, infrastructure-wise, do you see us do we need in order to really move this pathway forward to really have an efficient naturopathic industry here in the territory?
Because of the lack of resources that have been historically here in the Virgin Islands, it's something that's going to need a full support of our government to make sure it's implemented properly. The legislation that you're putting forward was one of the first steps, but also information in the community about this particular field is very important. Education on the level from in our system for people to understand that there are other ways to stay healthy, to prevent disease. So all of that has to be implemented in order for this to be something that is a successful measure. Reaching out to people that have this skill that could come forward to the Virgin Islands to provide this to community services. Outreach would be needed. Also measures of providing the resources that these practitioners would need to have them available here in the territory so that they can use these for their treatment of patients.
Thank you, and to Attorney Seitz, in terms of best practices around and your involvement with some of, like for example, the Virgin Islands that needs to move forward, and we're rather stagnant in this area. Have you any examples of best practices in moving naturopathic medicine forward in jurisdictions where similarly positioned to the Virgin Islands, where we're sort of in a stagnancy with respect to moving forward?
Well, as was just said, just having a clear licensing process in place makes a big difference, because it's one thing for someone to come to a new place and set up a practice where there's ambiguity about what's allowed and what their status is. And it's a whole different experience if they know exactly that what they will be allowed to do and that they can be recognized through licensure as an established medical practitioner. So that's a first big step. Naturopathic doctors, once they become established, will often engage in the type of education that helps people understand what they are able to offer. There are hospitals around the U.S. that do have naturopathic doctors on staff, and encouraging medical clinics and hospitals to consider the possibility of bringing on natural doctors would be a good step as well. So those would be a few things. But I think first just making sure that the status is clear and that there's a direct pathway for qualified people.
Thank you. If I just may wrap up, Chairman. Yes, and just in closing too, and I like this really good points by both testifiers. I have actually already engaged well, he's no longer new at the time when he was brand new, of our Wong Flu Hospital, and even to both of our hospitals. We're going to have to also recruit those naturopathic doctors, and I look forward to that effort. So I really appreciate the strong suggestions in making most successful legislation. And so we're going to continue to move forward, and I firmly believe that naturopathic is a powerful tool that we will is not to supplant the other traditional medicine, but to work cohesively to truly heal our people. Too many of our people are in these long, they're taking the same pills for many years, and they're suffering. We want to be able to heal our people. Thank you.
Very well, thank you very much. And of course, I would imagine that you want to ask your colleagues to support this measure as they move forward.
Yes.
You may do that.
Okay. And I also thank you for that, Chairman, for additional time. I wanted to say that I'm really asking for the support of my colleagues in moving this measure forward, and looking forward to the support, and of course to the entire community for us to move this important measure forward in all the elements to make this most successful. Thank you.
Thank you very much. I had moved similar legislation in the past because there must be an alternative, so I know that in consulting with the Commissioner of Health, she also indicated that in fact 2 naturopathic licenses were granted based by the medical board based on recent legislation that was passed. I see here that there are some opportunities for us because there's various modalities, and you don't want to exclude any of those. So I would suggest that as you consider amendments moving forward, that I'm seeing that there is some modalities that's already being offered: shockwave therapy, e-stim therapy, pregnancy adjustment, neck and back pain treatment, chiropractic adjustments. If there's any void, this is your opportunity, to make sure that all of those modalities are identified, so you don't have to make adjustments, which is necessary and may be possible. But I'm saying that there's an opportunity here to also include those additionals in there. I think that this has been a very good discussion. This really concludes this particular round. I'll allow for the Attorney Sykes as well as Ms. Dr. Shabazz to be able to give a 30-second closing wrap-up. Ladies first.
I applaud this effort again, Aziza Shabazz, and I also agree with you about other modalities because I'm also trained and familiar with Ayurvedic treatments, which are based in the tradition of Indian healing and yoga therapies, which is similar, but still different. So in definition, there might be something else to add, and also in vibrational therapies, which are certified and also respective of naturopathic healing. And I look forward to our expansion of this, which would also help others who come to the territory. It will be a welcome addition to our offering as a community here. Thank you so much.
Well, thank you. Attorney Sykes?
Sure, and thank you once again for this opportunity. I just want to make a few points. First, again, to emphasize that these programs are accredited by an accrediting agency recognized by the U.S. Department of Education, which means we have to live up to a very high standard of precision in the work that we do. Graduates of these programs are safe and effective practitioners, and by licensing practitioners, there is a way for the public to be able to distinguish between well-trained practitioners and those who may be only marginally trained. So that's a real public service and a way of providing public protection. Finally, naturopathic doctors understand that they work within a medical community. They're trained to know when to refer. They're trained to know how to co-manage patients. And they understand that there's no single right way necessarily to treat a patient, but that it really the best care is provided by a team of people being able to offer different types of expertise. So I think that you would find that they would be a wonderful addition and would be able to work well within your existing medical and healthcare community. Thank you again.
Very well. I want to thank you both again coming before the Committee of Health, Hospital, and Human Services. I apologize. I know you've been here before 10 o'clock this morning, and it's been somewhat of a long day, but thank you for sticking it out and staying with us because this measure is rather important as we move it through. At this time, we'll take a 5-minute recess, and then we'll go to the last item on today's agenda. The Committee of Health, Hospital, and Human Services stands in recess for 5 minutes.
Good afternoon. The Committee on Health, Hospitals, and Human Services for Friday, July 29th is back on record. Sitting in for the chair. Madam Clerk, can you read the next agenda item for us, please? Thank you.
The committee will receive testimony on Bill number 34-0279, an act amending 19 Virgin Islands Code, Part 5, restructuring, reclassifying, and adopting the first comprehensive Virgin Islands Behavioral Health Act to provide for services and interdepartmental coordination of agencies and organizations to provide a structure of support to individuals throughout the Virgin Islands who suffer from behavioral health challenges, to establish community behavioral health services, as well as to provide for the first comprehensive public behavioral health facility to treat individuals voluntarily and involuntarily who face behavioral health challenges, amending and repealing conflicting laws, and providing for other related purposes, sponsored by Senator Novell E. Francis, Jr. Invited testifiers, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health, the Honorable Denise N. George, Esquire, Attorney General of the U.S. Virgin Islands, the Honorable Ray A. Martinez, Commissioner, VI Police Department, Miss Cheryl Paxson, NAMI, AARP, Lori Thompson, PhD, Psychologist, Insight, Tina Commission, Esquire, Chief Executive Officer, Snyder Regional Medical Center, Mr. Christopher E. Finch, Chairman, Virgin Islands Government Health and Hospital Corporation, Miss Winnie Testemark, Director, VI Bureau of Corrections, Samuel Joseph, Esquire, Chief Public Defender, Office of the Territorial Public Defender, Alicia Udwani, Esquire, President, VI Bar Association.
Thank you, Madam Clerk. I just have one problem with this bill before us. I'm not understanding why I'm only seeing the good senator's name on there, but we'll adjust that later as we go along. Let me just ask the testifiers before us to kindly put your name and title on the record. And those of you that's online, please make sure that your devices are muted until you're recognized. I'll start within the well here on St. Croix on my left and go around.
Deputy Commissioner Renan Steele, Department of Health.
Thank you. And you're a big man, so I want you to speak up when you're speaking into the mic. Next, ma'am.
Carolyn Pogson, I'm the Senior Operations Specialist for ARP in the Virgin Islands.
Okay, we're gonna need to do this right. So you're gonna, when you're speaking or testifying, please speak directly into the mic, because I'm already getting, the eye contact and telling me that you need to speak up. Our stenographer is in the other district, and they would need to hear us.
Good afternoon. Lori Thompson, PhD, clinical psychologist both at Schneider Regional Medical Center and Insight Psychological.
Thank you.
Good afternoon, everyone. I'm Justa Ortiz Encarnacion, Commissioner of the Virgin Islands Department of Health.
Welcome back.
Thank you.
Good afternoon. Tina Commission, Chief Executive Officer of Schneider Regional Medical Center.
Welcome.
Good afternoon. Christopher Finch, Chairman of the Virgin Islands Hospital and Health Facilities Corporation.
Thank you.
Good afternoon, Dr. Nicole Cragwell Sims, Assistant Commissioner, Department of Health.
See, Nicole Sims, Dr. Sims know how to do this. She pulled the mic out and speak directly into the mic. Welcome.
Good afternoon, Makish Taylor-Jones, and Chief Legal Counsel for the Department of Health.
How are you? Nice to meet you again.
Good afternoon, Giselle Ramos.
You could pull that mic out. See? All right.
Good afternoon, Giselle Ramos, Department of Health Assistant Director.
Thank you. And you're Assistant Director of what?
Sorry, behavioral health.
Thank you. In St. Thomas, I see we have the police commissioner there.
Yes, good afternoon. Ray Martinez, Police Commissioner.
Thank you. Online, I see representatives from the Attorney General's office.
Good afternoon, Carol Thomas Jacobs, Chief Deputy Attorney General.
Welcome. Anyone else from Justice? I see Human Services, Commissioner.
Good afternoon. Kimberly Causey Gomez, Commissioner, Virgin Islands Department of Human Services.
Good afternoon. Anyone else from Justice? Anyone else from Human Services? Okay. Public Defender's Office?
Good afternoon, Samuel Joseph, Chief Public Defender, Office of the Territorial Public Defender.
Welcome.
Thank you.
Department of Health? Online?
Good afternoon, Ruben Malloy, Assistant Commissioner, Department of Health.
Welcome. Anyone else? Okay, thank you. And those of you, again, online, please make sure that your devices are muted until you're recognized. We're going to start with the introduction of the bill. Senator Francis, you're recognized for the introduction of Bill number 34-0279.
Thank you very much, Mr. Chair, and good afternoon to everyone. Today, I'm very excited about presenting Bill number 34-0279, which has really been a labor of love. This bill was sent down by the governor and the administration back in the 33rd legislature of the Virgin Islands, and really just fell in line with everything that myself and several of my colleagues have been working on in respect to addressing our behavioral health issues throughout the territory. This comprehensive behavioral health reform bill has gone through several iterations, and here we are today, again, considering this piece of legislation. Behavioral health and how we manage it has been a long-standing crisis in the Virgin Islands. When it comes to local laws, the statute is silent and in some areas and conflicted in others. This bill essentially enfolds the territory's behavioral health statutes under one umbrella. It provides for interdepartmental coordination of agencies and organization and provides for interdepartmental coordination of various agencies and organizations. It provides a structure of support for persons with behavioral health needs and also for their caretakers, a group that is often left out of the discussion on care and services. And I know NAMI is here again to speak to that. It treats developmental disabilities separately because the conflation of these disabilities with behavioral health is inaccurate. Bill number 34-0279 closes a gap in the code by expanding language for voluntary and involuntary treatment and specifically address handling of cases involving behavioral health in our judicial system. This is not a perfect bill. We have gone through multiple drafts to get us to where we are at today. As our testifiers will state, it needs to be fully supported by funding and further fleshed out to address concerns about protecting the rights of the vulnerable population. At the appropriate time, I'll be offering amending language that is intended to clean up the typos as well as the clarifying language. As I said, it's not a perfect bill. However, we cannot allow the perfect to stand in the way of good. This is a good bill, and I commit to continue to work with my colleagues and stakeholders to refine this bill throughout the legislative process. My thanks to Judge Willott, the Office of the Governor, Commissioner Encarnacion and her team, AARP, NAMI, all of the stakeholders that have really worked and moving this measure and having discussion in respect to moving this measure forward and getting us closer to the finish line. There's still much work to be done, but we have to start at some point. And again, we have assembled a team here. Not all will be in agreement with the bill. Some will have some recommendations for amendment. Some will talk about the needs for additional funding, and we get it. But it's in this forum that we're able to then determine what the funding needs will be, and it'll be supported as necessary as we continue to consider this piece of legislation. This population cannot wait any longer. We cannot wait any longer. We've seen it every single day, the fallouts on our roadways and our streets, in our neighborhoods. There are family members, there are veterans, there are colleagues, there are nurses, teachers, medical professionals. Colleagues and stakeholders, I'm asking again for your commitment to move this measure forward, and let's tweak and fix it as we move along. We'll fix the plane in flight. Thank you very much, Mr. Chair, for the opportunity, and again, I'm asking for my colleagues' support in moving this measure.
Thank you, Senator Francis, and you have my commitment to work alongside you with this. Madam Clerk, I neglected to ask you if you had any correspondence to be read into the record.
Yes, Mr. Chairman.
All right, and one that is not testimony at this time, correct?
Both are testimonies.
Okay, at the appropriate time, I'll call on you for those testimonies.
Okay, Mr. Chair.
Thank you. We'll start now with Dr. Thompson from Insight. You're recognized for your testimony, followed by the Honorable Commissioner of Health. You may proceed.
Thank you. Good afternoon, Senator Francis and honorable members of the 34th Legislature. Thank you for allowing me to testify for the Comprehensive Virgin Islands Behavioral Health Act. I would like to start by thanking Senator Novell Francis for bringing this bill to our attention, as mental health has been overlooked by many in the past. Additionally, the plan to open a behavioral health treatment facility to treat the mentally ill is also a welcome addition and is much needed for the people of the Virgin Islands. I also appreciate the invitation to testify on this matter. I grew up in St. Thomas and graduated from All Saints Cathedral School, and after obtaining my doctoral degree in clinical psychology, I returned to the territory to treat the people of the Virgin Islands. I have been treating the behavioral health population for almost 20 years at Schneider Regional Medical Center and for 15 years at Insight Psychological Services, LLC. In spite of the bill's good intentions, the bill as drafted raises many problems that will invariably lead to many unintended and undesirable consequences. I see three primary areas of concern. The first relates to funding. The bill as written will likely bankrupt the territory, as this bill now makes it the Department of Health's legal responsibility to provide all-inclusive mental health care for indigent members of the territory. Having a psychiatrist on staff is considered the bare minimum of care provided by a government-funded mental health agency. The Department of Health has not been able to fund a full-time psychiatrist position for over 6 years. Multiple positions once held by psychologists and social workers in the Department of Health have been left open and unfunded following the retirement of these professionals. Additionally, the Elder Schulterbrand residential facility has considerable staffing issues for both direct care staff and medical professionals due to lack of funds and difficulty recruiting because of low salaries. Because of this, they are unable to accept more patients for long-term residential care. Over the past 20 years, the staff at SRMC have made numerous requests for recurring mentally ill patients to obtain long-term residential care off-island, but we have been unsuccessful in this endeavor because the Department of Mental Health has informed us that they lack the funds necessary to do so. Given the Department of Health's current inability to fund basic mental health services, I see no feasible way that the Department of Health will be able to fulfill the obligations legally required by this proposed bill. Furthermore, Section 1007B of this bill states, quote, all indigent patients must be kept and maintained at a behavioral health facility at the expense of the government of the Virgin Islands. And Section 1009A indicates that the expense of conveying all indigent patients to a behavioral health hospital must be borne by the government of the Virgin Islands and must be paid upon sworn account of the officer or person performing such service, thus making the cost of travel to such off-island agencies the government's responsibility as well. The 19% allocated from the Casino Revenue Fund will not be able to cover these proposed required costs. Additionally, this bill is potentially opening the territory up to multiple lawsuits. Any person or persons with a substance abuse problem can insist that they be provided with a free trip to a residential substance abuse facility for an unlimited amount of time. The territory will be required to pay for the travel there and the treatment provided. Additionally, this bill institutes training requirements for agencies outside of the Department of Health. Though admirable in theory, this could also promote liability situations that could bankrupt the territory. For example, Section 1022B requires that every police officer receive 40 hours, 1 whole week, of mental health training. What would be the consequences if a new police officer injures a mentally ill individual prior to obtaining the 40 hours of required training? A lawyer could successfully argue that the government is liable in this situation because the police officer did not follow the legal standards for training imposed by this mandate. Who will be providing this training? Who is paying for the 40 hours of pay for each police officer to receive this training? This is only one example of the requirements for training/education/collaboration with other governmental agencies that could increase liability concerns for the government. The bill as written gives the illusion of funding through the Casino Revenue Fund, but this money is finite. Nonetheless, the bill imposes infinite obligations, costs, and liabilities on the government, which will far exceed any revenue generated by the casinos. The second area of concern is the lack of clarity regarding the definition of an approved private treatment facility, which is described as, in quotes, a private agency meeting the standards prescribed in Section 1002 of this title and approved under Section 1004 of this title, which can cover or provide services for behavioral health disorders. According to the proposed bill as currently written, the director for the behavioral health treatment facility appears to have the authority to charge fees for the inspection of said private facilities, may periodically inspect said facilities, and may, in quotes, examine the books and accounts of any approved public or private treatment facility refusing to consent to inspection or examination by the division, or which the division has probable cause to believe is operating in violation of this chapter, Section 1004. Unless this is rewritten to provide more clarity, it appears that this would enable government interference in private behavioral health agencies, such as private group practices or medical offices, regardless of whether they were contracted by the government, which is a significant overstep of government authority. The likely consequence of this is that the private agencies that have been providing the bulk of care over the past several years will choose to close their doors rather than allow governmental interference in how they run their practices. Private facilities are subject to and should be subject to oversight, but only through their respective licensing boards and professional associations, who already have strict and rigorous guidelines and standards in place to monitor and police appropriate care. The third area of concern is the violation of patients' rights scattered throughout this proposed bill. For example, this bill gives authority for the director of the behavioral health facility or residential care facility or the director's designee to allow for, in quotes, restraint, including any mechanical means of restricting movement, and seclusion, including isolation by means of doors that cannot be opened by the patient, if either is required by the medical needs of the patient. See Section 1006C. Currently, the use of restraint is no longer used at the SRMC Behavioral Health Unit because of the significant risk of harm to others. Seclusion can only be used at the hospital after all other less restrictive attempts to control patients' behaviors have been implemented, and only with an order from a psychiatrist. Not only does this bill allow for someone other than a psychiatrist to approve restraint or seclusion for a patient, adding the term "or designee" allows for unqualified/unlicensed individuals to make these decisions. Requiring medical personnel to make these decisions has become industry standard because of the increased possibility of death from seclusion or restraint. Through the years, multiple hospitals/residential facilities have closed due to liability issues because of injury or death of a patient. Why would we allow ourselves and our patients to be placed at risk in this manner? Additionally, this bill encourages the establishment of a community service network where, in quotes, the network members shall share confidential client information, even without a client's consent, to the extent necessary to protect the client's health and safety in a period of urgent need. A person or entity participating in good faith in sharing information under this paragraph is immune from civil liability that might otherwise result from these actions. See Section 1019-A-6-I. This is a clear violation of HIPAA standards and would adversely affect client care because people will refrain from obtaining treatment for fear that this government-controlled network will become aware of their mental health difficulties. This is a significant problem. Furthermore, under the revised involuntary commitment section, the following is stated, in quotes, "A person committed under this section shall remain in the custody of the Department of Health/Division of Behavioral Health for treatment for a time established by the court or for an indefinite period." End quotes. See Section 1026-0. Guidelines have been established over the years to balance the health and safety/privacy of the community with the health and safety/privacy of the mentally ill. While I support and have participated in the involuntary commitment of numerous patients at SRMC over the years, patients have the right to learn from these experiences and have opportunities to make better decisions as they become more educated about their diagnoses and appropriate treatment options. Allowing the Department of Health/Division of Behavioral Health to indefinitely have authority over mentally ill persons and/or violate their HIPAA rights is again an overreach of governmental power. As the Government Relations Committee Chair of the Association of Virgin Islands Psychologists, the psychologist at the SRMC Behavioral Health Unit, the owner of Insight Psychological Services, LLC, and an advocate for the rights of the mentally ill in the territory, I am extremely concerned that this bill is under legislative review as it is currently written. It appears that the main goal of this proposed bill is to make another top-heavy layer of bureaucracy over an already stretched and underfunded system. It also appears to allow for one or two persons to be designated, i.e. the director of the behavioral health facility and the director of the Division of Behavioral Health, with enormous control over inpatient and outpatient systems that they may have limited knowledge or experience with. This bill affords these select individuals to oversee a vast array of what has been autonomous or semi-autonomous agencies/providers, and in doing so could possibly jeopardize the agencies that have been able to succeed and provide much-needed mental health services to the people of the Virgin Islands. Additionally, this bill vastly expands the responsibilities of the Department of Health when the Department of Health has not had the financial resources to keep the areas that the Department of Health is currently mandated to fill, i.e. providing psychological/psychiatric care to outpatients, viable. The factual reason that the Virgin Islands mental health system is in a state of dysfunction is that there are limited funds available for the treatment of the mentally ill. This bill does little to address these financial concerns and instead places more restrictions, rules, and regulations on an already overburdened system that simply needs additional funding. I understand the urge to do something. What would my advice be? It's simple. Let's start with funding one or two outpatient psychiatry positions to address the urgent needs of this population through the Department of Health. Once this has been accomplished, let's raise the salaries for the staff at the Elder Schulterbrand Residential Treatment Facility so that we can quickly transfer more patients to that agency. Finally, building a new behavioral health treatment facility would be the next logical step in making our territory's mental health programs more available to the community. Thank you for allowing me the opportunity to share my concerns and suggestions. I look forward to continued collaboration on this matter so that we can pursue the good intentions of improving the quality and care to our citizens with mental health challenges without the unintended consequences. Respectfully, Lori Thompson, PhD, licensed clinical psychologist, government relations chair, AVIP.
Thank you, Dr. Thompson. Next up, we'll hear from the Honorable Commissioner Hussein Kanasyong, Department of Health. You're recognized for your testimony.
Thank you, sir. Good day. Honorable Senator Novalee Francis, Junior Vice President of the 34th Legislature and Chair of the Committee on Health, Hospital, and Human Services, Honorable Senator Kenneth Gittens, committee members and our other non-committee members, and the viewing and listening audience. I am Justa Ortita Encarnacion, the Virgin Islands Department of Health's Commissioner. Thank you for the opportunity to provide testimony on the first Behavioral Health Act. Joining me today, our Assistant Commissioner Nicole Cragwell-Sims, Deputy Commissioner Renan Steele, and Acting Assistant Director Giselle Ramos. We also have Chief Legal Counsel Makeish Taylor Brown and and Assistant Commissioner Ruben Malloy is joining us virtually. I have asked Dr. Charmaine Myers, Director of Maternal and Child Health, to also join us virtually to discuss behavioral health activities performed by and in collaboration with other entities. Winnie Testemark, Director of Bureau of Correction, is attending virtually and will also be available for comments and questions. The purpose of the Behavioral Health Bill 34-0279 is to support the Behavioral Health Act, proposed by the Honorable Governor Albert Bryan Jr. and sponsored by Senator Francis, to establish a coordinated and comprehensive system of care for persons with behavioral health conditions in the Virgin Islands. The bill serves to expand behavioral health services, thereby eliminating gaps in the continuum of care by creating residential psychiatric services, community-based crisis services, intensive outpatient services, and associated recovery support services. The varying levels of care supported through the proposed residential psychiatric services include acute, transitional, long-term care, and detox care for those suffering from substance abuse. The bill serves to amend Title 19, Part 5, Chapter 45 of the Virgin Islands Code, Mental Health. The establishment of these services shall ensure that the population's clinical behavioral health needs are met within a territory regardless of any individual's needs. Behavioral health and corresponding community needs in respect to this area has been a major topic of concern for several years. While there have been significant steps to begin collaboration between agencies, interagency collaboration including the Department of Health, Department of Human Services, Virgin Islands Police Department, and both district hospitals, Royal L. Snyder Hospital, as well as Wang F. Louis Hospital Medical Center, the Department of Education, and the Department of Justice, and the National Alliance of Mental Illness. This bill provides a more structured approach to develop new and/or maintain existing collaborative partnership across agencies, providers, and programs to strengthen the delivery, monitoring, and measuring outcomes of behavioral health services. The theme of collaboration to address behavioral health and disability concern carries throughout the bill, as evidenced by the establishment of bodies such as the Interdepartmental Coordinating Committee, Behavioral Health Act Advisory Council, and the Community Services Network. This is paramount as there are several categories of needs that those with chronic behavioral health challenges typically possess, which span beyond the services capable of being provided solely by the Department of Health. True to our mission and to ensure preventive approach to care, the Behavioral Health Advisory Council will ensure that data is aggregated, summarized, analyzed, and finally placed into actionable responses. A high priority will be placed on the Adverse Childhood Events, or ACE, that contributes to high incidence of behavioral health challenges exhibited in the middle school age population. In conclusion, changes in the de facto behavioral health care system over time reflect organizational and entrepreneurial responsiveness to changes in the overall landscape of healthcare policy. As an outcome of the recent attendance to the Southern Region Summit, Improving the Court and Community Response to Those with Mental Illness, held in Austin, Texas, the Virgin Islands contingent, led by the Honorable Reese S. Hodge, Chief Justice, and represented by members of the 34th Legislature, Department of Justice, Department of Human Services, Bureau of Correction, the Virgin Islands Police Department, and the Office of Public Defenders, the Department of Health committed to develop Further, a strategic approach to behavioral health services supported by this bill. The Act will build community behavioral health services, develop behavioral health services in general hospital settings, integrate behavioral health services into primary health care, and promote equity and justice. The Virgin Islands Department of Health's executive team and I would like to thank the Virgin Islands Department of Health family for their continued dedication to the Virgin Islands community and recognition to all of our team members for working tirelessly to protect us and support you, the people of the Virgin Islands. Special recognition is given to our behavioral health, alcohol, and drug dependency services team. In conclusion, Senator, the Department of Health is committed to reducing health risk, increasing access to quality health care, and enforcing health standards. We stand ready to respond to any questions you may have. Thank you, sir.
Thank you, Commissioner Encarnacion. Next, we'll hear from Chairman Finch. From the board, you recognize.
Thank you. Good afternoon, Honorable Chairman Novelli Francis Jr., other members of the Committee on Health, Hospitals, and Human Services, other senators attending, Senate staff, other testifiers, and the listening and viewing public. I am Christopher Finch. I am a member of the St. Croix District Governing Board for the Governor Juan F. Louis Hospital and chairman of the Virgin Islands Government Hospital and Health Facilities Corporation, commonly known as the Territorial Hospital Board. Thank you for this opportunity to testify on Bill 34-0279, the Virgin Islands Behavioral Health Act. As stated, I presently chair the Territorial Hospital Board, and this impacts the hospitals, so much of my testimony will be focused there. I am also a social worker with 43 years of work experience in the Virgin Islands in both direct services and in administrative capacities as Executive Director of Youth and Social Services of the Virgin Islands and Commissioner of the Department of Human Services. I will also share my perspective gained from that work. As I look back over my career as a social worker, in certain ways, we had more robust mental health services in the late 1970s and early 1980s than we have had since. I congratulate the sponsor of this bill, the Honorable Senator Novelli Francis Jr. Additionally, I congratulate the many persons within the impacted government agencies who have been working through drafts of this proposed legislation along with the Office of the Governor. This is very much needed and has been needed for a long time. It is hard to overstate the importance of clarifying our laws around mental health programs, policies, and treatments, and creating a framework through which a true cradle-to-grave comprehensive mental health service continuum can be developed and implemented. I am pleased to see that this bill recognizes the importance of families, self-help groups, nonprofit agencies, for-profit agencies, and other community resources. The provision of such comprehensive services needs the inclusion of all these entities. As we all know, this bill is only the first step. The implementation of all the provisions called for in the bill will take work, time, and an infusion of human capital and financial resources. The challenge and work ahead are worth the effort to create a mental health service delivery system that ranges from education and prevention and family support to 24-hour crisis intervention plus early intervention, to ongoing treatment for persons with acute and chronic conditions, to residential treatment and hospitalization, whether voluntary or involuntary. I'll start my testimony with hospital-specific comments, then address items I wish to point out from my perspective as particularly important, and conclude with some concerns and suggestions. The impact of the bill on the hospitals. The major role of the hospitals in the mental health services continuum is that of short-term hospitalization and psychiatric evaluation and treatment, usually for persons suffering from an acute episode. That is a role the Governor Juan F. Louis Hospital has traditionally filled. The Roy Lester Snyder Hospital has filled that role as well as provided some longer-term hospitalizations for persons who have needed that. Hospitalization is sometimes a result when other less intensive services were not available or not sufficient. With the comprehensive services proposed in this bill, the need for hospitalizations for mental health issues may decrease as individuals get the services they need before a problem escalates to the level of a psychiatric commitment. I believe the whole community, including the hospitals, would appreciate that. The bill and/or the proposed amendment calls for the specific involvement of the chairperson of the Virgin Islands Government Hospitals and Health Facilities Corporation in 3 areas. These are, first, Section 1007D, as amended, authorize the Territorial Hospital Board Chair and the Commissioner of Health to be able to request the court to cite a guardian or other financially responsible person of a hospitalized patient who is not paying for the costs of the patient's care. Second, Section 1007F, as amended, authorizes the Territorial Hospital Board Chair and the Commissioner of Health to set the rates for care that are reasonable and customary for our community and to authorize the court to accept the rates established by the Hospital Board Chair. I believe the amendment authorizing the court's acceptance of the hospital established rate should reference line 3 instead of line 18. Third, Section 10017 requires the Territorial Hospital Board Chair to serve on the Interdepartmental Coordinating Committee. On behalf of the Territorial Hospital Board, I believe these proposed authorities and the required Interdepartmental Coordinating Committee are proper responsibilities for the Board Chair. I will continue with specific hospital sections. Section 2 of the bill references taking the 15% provided from the Casino Revenue Fund to the Department of Health and transferring it along with other revenues from that fund to the Behavioral Health Treatment Facility. That section of the Casino Fund actually provides 15% to hospitals and health. My understanding is that each hospital receives annually approximately $100,000 from that fund. Should this change be made, we ask for consideration to replace the hospital funding from a different source. For Section 1011 on discharge, the amendment proposes adding the hospital medical director as a person required to regularly review the continued hospitalization of each patient. This is an important requirement to help ensure no one gets forgotten and the medical director is the correct position for the hospital patients. Section 1024A, subsection K, requires that, quote, each district hospital shall dedicate at least 8 beds for persons with behavioral health challenges or mental health disorders, end quote. Presently, JFL has no beds dedicated for such purposes. The temporary facility, JFL North, will have 4 beds that will all be in the emergency department. The new Waneth Louis Hospital that is being planned to have, correction in my testimony, to have 16 behavioral and mental health beds, of which 2 are planned for the emergency department, 2 to be pediatric beds, 4 to be adolescent beds, and 8 to be acute adult beds. Roy Lester Snyder has a present 14-bed capacity, although it is usually staffed for around 8 beds. As planned, both hospitals, when rebuilt, will meet or exceed the requirements of this bill. The bill sets out requirements for protective custody, emergency commitments, and involuntary commitments in sections 1023 and 1024 A, B, and C. Presumably, some or perhaps most of these involuntary commitments will use the hospital for the placement and treatment of the involuntary committed person. The bill carefully describes a timeline allowing an initial 48 hours of involuntary commitment, followed by up to 3 additional dates if a court order is sought for a longer commitment period, and allows the commitment to continue while the court process is underway. The bill properly turns over treatment decisions to the hospital once the initial commitment is made and lays out requirements for the hospital to follow. My suggestion on this section, specifically for section 1024A on emergency commitment, subsection F and G, is that wherever a psychiatrist is referenced, it's amended to add, quote, or treating medical practitioner, end quote. This makes it consistent with the other provisions of this section that refer to the treating medical practitioner and ensures that if there is ever an absence of a psychiatrist, the provisions of the subsection may still be legally adhered to. I have a concern in section 1027 under involuntary treatment with medication. Paragraph A of this section requires that if a patient is unwilling or unable to comply with a prescribed medication, the primary treating physician may request a court order for the involuntary treatment or medication. The bill describes information that must be included in the request to the court. Into the introduction to this 1027 section, the sentence on lines 8 to 10 seems to indicate that this court approval is only required for medication to treat the behavioral health or mental health disorder and not all medication or treatment, but it is vague. The sentence reads, quote, "For the purposes of this section, involuntary treatment is limited to medication for the treatment of persons who suffer from behavioral health challenges or disorders and laboratory testing and medication for the monitoring and management of side effects," end quote. I suggest that clarifying language is added to allow the primary treating physician to prescribe essential life-saving medication and treatment for those in voluntary commitment and unwilling or unable to comply with the suggested treatment. I believe that is the intent of the bill, and it may provide physicians with more confidence if it is specifically addressed. General comments on the bill. I was pleased to read the definition of indigent in the definition section number 25. This concerns who will be expected to pay for treatment. The included language allows the Department of Health to set the financial standard for indigents. This is an important distinction since a typical definition for indigent usually refers to poverty. With residential behavioral health costs at $300 to $400 a day on the low end, very few people can afford to pay for their care for long, even if they are significantly above the poverty level. The included definition allows the Department of Health to set reasonable requirements. I'm also pleased the bill allows the Department of Health the option to contract for required services, both residential and outpatient, with private providers. This includes contracting for an, quote, approved public treatment facility, end quote. The greater flexibility of the private sector, both for-profit and nonprofit, to create and hire full-time and part-time and on-call positions can make it easier to staff a 24-hour facility that must maintain a specific level of staffing. Private facilities may also have simpler procurement requirements and a greater ability to get volunteers and donations of goods and services and money. The potential exists that a private entity may be connected with a large national organization with experience in this field that can provide technical assistance, training, operational policies and procedures, and funding and other assistance. The implementation of this bill may encourage agencies to develop more behavioral and mental health treatment programs in the territory. I was very pleased to see the focus in Section 1014 on duties regarding behavioral health challenges on collecting data and creating programs around reversing the lifelong devastating effects of childhood trauma through the inclusion of ACEs, or adverse childhood experiences. The original ACE study was done by the Centers for Disease Control and Kaiser Permanente Insurance from 1995 to 1997 and is one of the largest investigations of childhood trauma, abuse and neglect, and later life challenges to health and well-being. It was found that the greater number of adverse childhood experiences a child suffered, the greater likelihood that the child would have physical and mental health challenges as an adult. I have taken the liberty to include a link in my written testimony to a TED Talk given by Dr. Nadine Burke-Harris, a pediatrician, on how her research on ACEs with her children's patients led her to change her practice. All interested in getting more information on the importance of ACEs may find her talk instructive. And I would like to add that locally, and I'm sure there's additional examples, but Lutheran Social Services, for its early Head Start staff, receiving their certificate, their Child Development Associate certificates, receive teaching on the ACEs and how the teachers can recognize trauma among their young children. And I spoke today with a UVI psychology professor who is working on intensive training on trauma-informed care for the early childhood education students at UVI going forward. So there's already knowledge and interest in the ACE study, and I'm sure there are other examples. I was also pleased to see the inclusion of a robust crisis intervention suite of services, including 24-hour availability and a hotline. This is included in Section 1020 Appropriate fast intervention can prevent a mental health episode from becoming tragic. Suggestion for changes in the bill. The final part of my testimony includes suggestions for two of the bill's section. Section 1004, under the standards for public and private treatment facilities, enforcement procedures, and penalties. This section calls for residential programs to be accredited by the Joint Commission on the Accreditation of Healthcare Organizations. There are other national accrediting bodies that may fit a particular residential program better than the Joint Commission, and may be easier for those programs to obtain and maintain accreditation while providing the quality of care assurance this bill seeks. I suggest that the words, quote, or other national accrediting body recognized by SAMHSA, which is a Center of Substance Abuse and, actually I'm not sure all the definitions, but it's the main HHS organization over mental health services, end quote, be considered to be included as an accreditation option. Section 1006 under patient rights under subsection C on restraints allows the use of restraints only if approved by the head of the facility. Accreditation standards should also be considered. I suggest that the following sentence is included. Quote, the use of restraints must be limited to uses allowed under the standards of the facility's accrediting body, and unaccredited facilities shall adhere to the Joint Commission standards on restraints. In conclusion, Bill 340279, the Virgin Islands Behavioral Health Act, describes the creation of a comprehensive set of mental and behavioral health services to be coordinated and spans the spectrum of prevention to intensive intervention. It will be expensive to fully fund the services called for in this bill, and the ultimate success will depend on appropriating sufficient funding to enable high-quality programs. I truly hope we are able to do so. It is needed. I am in support of this legislation, and I thank the committee for the opportunity to testify today. This concludes my testimony, and I'm available to answer questions at the appropriate time. Thank you.
Thank you, Chairman Finch. Next up, CEO Commission. You're recognized, followed by the clerk reading CEO Cook's testimony from the Wang F. Louis Hospital.
Good afternoon to the Honorable Kenneth Gittens, who's chairing today's meeting, the Honorable Novell E. Francis Jr., Vice President of the 34th Legislature and Chairman on the Committee on Health, Hospitals, and Human Services. Good afternoon to all the other senators present and to the listening and viewing audience. I am Tina Comisiong, Chief Executive Officer of Schneider Regional Medical Center. I would like to thank this committee for the opportunity to give testimony on Bill 34-0279, proposed legislation to establish the first comprehensive behavioral health act for the U.S. Virgin Islands. The community's behavioral health needs are significant. Individuals and families across the territory continue to be impacted by the lack of available and consistent wraparound services for the treatment of behavioral health conditions. We commend this legislative body and the Office of the Governor for giving your attention to the behavioral health issues that exist and for this proposed legislation that seeks to eliminate gaps in care through the creation and expansion of outpatient care services and through structured initiatives that improve and increase collaborative efforts across the spectrum of providers of behavioral health services. This legislation presents an opportunity to improve access to care and treatment options and to improve outcomes for people with varying behavioral health conditions across the prevention, treatment, and recovery continuum through an integrated approach. We support the expansion of behavioral health treatment options in the territory and the construction of a dedicated behavioral health facility for the territory. As the community's hospital, we will continue to play an active role in the provision of behavioral health services to the community by providing emergency stabilization and inpatient hospitalization for patients with acute behavioral health needs. I want to thank our hardworking, caring, compassionate staff at Schneider Regional Medical Center for the excellent care they give to all of our patients, including those suffering with behavioral health conditions. We're generally very supportive of this proposed legislation. There are, however, two areas that we wish to highlight where we would request changes to avoid any negative or unintentional impact on the territory's hospital. First, as was recognized by other testifiers, we want to request funding for the services that are enabled through this legislation. And second, we would like to request an adjustment to certain definitions within the legislation that could directly affect the governance, functions, and accreditation of the hospital if not reworded. SRMC will continue to provide acute care and stabilization services to patients in need even after the creation of this new chapter and even after the new behavioral health treatment facility is opened. It is therefore critical to our operations that we sustain and maintain adequate funding for our treatment of behavioral health patients. Prior to the passage of Act 8577 by this body on April 22nd of this year, the hospitals were allotted a portion of the casino revenue funds. Approximately 15% of those funds were previously split between the hospitals and with the Department of Health. For the period October 2020 to September 2021, SRMC received $76,749. For the period of October 2021 to September 2022, SRMC received $132,492. While these are not huge sums of money, these funds did help to offset the cost of caring for behavioral health patients at Schneider Regional. SRMC spends approximately $4 million annually on staffing, supplies, and other fixed costs to operate its behavioral health inpatient unit, which has 8 staffed inpatient beds and typically has a census of 6 inpatients. SRMC spends approximately $2.3 million annually on providing stabilization care and treatment to behavioral health patients in its emergency department. SRMC treated 293 patients with behavioral health issues in the emergency department in fiscal year 20, 395 patients with behavioral issues in the emergency department in FY 21, and more than 215 patients with behavioral health issues in the emergency department so far for fiscal year 22. SRMC would greatly appreciate consideration from this body for funding to support both the inpatient care and the emergency stabilization care that we provide to patients in our community. As you know, SRMC has an obligation to and does treat anyone who presents to our emergency room in need of acute care and stabilization, regardless of their ability to pay. SRMC frequently admits behavioral health patients to our inpatient unit who need additional care and who have no ability to pay for that care. An allocation of funds through this legislation would help to support the important care we provide at Schneider Regional and help us to remain a strong partner in the continuum of care for individuals who suffer from behavioral health challenges. We also would like to highlight the need for clarification of the definitions behavioral health care hospital or facility and public facility. We suggest that language be added to those definitions to limit the scope of the definition to public facilities under the Department of Health. The way the definitions are currently drafted creates conflicts between the proposed regulatory oversight that the bill mandates and the regulations that are imposed by our regulatory bodies and accrediting bodies, the Joint Commission and the Centers for Medicare and Medicaid Services, otherwise known as CMS. The definitions in their current form provide, for example, that the administrator of the new behavioral health facility would have the authority to make decisions about care of individuals at the hospital, including the use of restraints, admissions, discharges, and transfers. Our accreditation regulations and bylaws dictate that these types of decisions for the care of patients in the hospital can only be made by the attending or treating physician and by credentialed, licensed medical staff members. The definitions as they're currently drafted within the legislation would make us run afoul of the rules and regulations of our accrediting bodies. We propose an update to the definitions that would define behavioral health care hospital or facility and public facility as a public or private facility under the Department of Health and exclude those governed by the Virgin Islands Government Hospitals and Health Facilities Corporation. The hospitals, as semi-autonomous agencies, are fully vested in participating in the continuum of care provided to individuals with behavioral health needs and will, where necessary, create MOUs with the Department of Health, with the Bureau of Corrections, and with any other agency or private entity to ensure coordination of services for continuity of care. Further, the hospitals are already subject to the regulatory oversight of the Department of Health and are required to participate in the treatment of persons with behavioral health needs through other already existing sections of the Virgin Islands Code and through federal mandates. Aside from these two concerns that require this body's attention, SRMC fully supports the intent of this bill. SRMC remains an advocate for the expansion of all healthcare services in the Virgin Islands, and we will continue to partner with all stakeholders to ensure that quality care is provided to our community. This concludes my testimony, and I welcome your questions at the appropriate time. Thank you, Senator.
Thank you so much, CEO Commission. We'll hear from the clerk now with the testimony from CEO Cook from the Governor Huang from Cisco Louis Hospital on St. Croix.
Good afternoon, Honorable Chairman Novell E. Francis Jr., other members of the Committee on Health, Hospitals, and Human Services, other senators attending, Senate staff, Governor Wong F. Louis Hospital leadership, other testifiers, and the listening and viewing public. I am Douglas E. Cook, CEO of the Governor Wong F. Louis Hospital, JFL. My sincere apologies for not being able to be present for today's testimony. Please accept this written testimony on my behalf and will make myself available for future questions or conversations related to this critically important topic. Thank you for this opportunity to testify on Bill 34-0279, the Virgin Islands Behavioral Health Act. As you know, I have only been a community member of St. Croix and the CEO of JFL for the past 7 months. I do not pretend to be an expert on the vast array of complex issues and challenges that the U.S. Virgin Islands are faced with as it relates to behavioral health. However, I applaud the sponsor of this bill, the Honorable Senator Novell Francis Jr., as well as the Governor's Office and the many agencies and individuals that have put in countless hours of work to get this much-needed proposed legislation to this point. In the short time I have been involved with JFL, I have seen several accounts on how the lack of behavioral health resources is having a negative impact on not only the hospital, but most importantly, the patient, their families, and the community. JFL currently does not have an inpatient behavioral unit. The new JFL North will have 4 beds in the emergency room dedicated to the acute care stabilization of behavioral health patients. Additionally, the current design plans for our replacement hospital is being proposed with an acute inpatient behavioral health unit for adult, adolescent, and pediatric behavioral health care. The hospital, physicians, and the employees do an amazing job caring for the acute care needs of our behavioral health population with limited resources on a daily basis. I want to publicly acknowledge and thank them for their tireless efforts. While the JFL team cares for the acute care needs of this population, it is important to know that without the proper community resources in place, such as being proposed in this legislation, these patients remain admitted to our hospital for much longer durations than necessary. As I stated earlier, our teams do amazing work, but once the patient is no longer within an acute phase, the hospital is no longer the appropriate environment for their care continuum. Unnecessary prolonged stays with the hospital further exposes this patient population to unnecessary risk and consumes precious resources that are diverted away from other patient populations. The proposed legislation is an excellent first step in providing comprehensive programs and services. I believe this legislation is the first step in creating a program that can be seen as a model of care that other communities should aspire to be. We have the opportunity to establish a program that is best in class and provides an all-inclusive, comprehensive program for our community. JFL fully supports this vision and stands ready as a willing and active key stakeholder in this journey. There are, however, a few areas to acknowledge, such as the long-term funding and territorial commitment by many agencies that are needed for such programs to be successful. The proposed bill references taking the 15% provided from the Casino Revenue Fund to the Department of Health and transferring it along with other revenues from that fund to the Behavioral Health Treatment Facility. That section of the Casino Revenue Fund actually provides 15% to hospitals and health. As you are aware, our hospitals have significant funding challenges and many unmet needs. While this proposed legislation may offer some relief in operational burden that is placed on the hospitals by caring for these patients longer than necessary, the hospital will always need to remain ready to serve the acute needs of this vulnerable population. We respectfully ask that other funding sources be considered before diverting additional funds away from the hospitals, or that we consider other options for our hospitals. The creation of these much-needed programs and alternative treatment models is the correct direction in properly addressing our community's needs, and we must need to be mindful of the limited number of specialized specialists that currently exist within the territory. The further development of programs will continue to put increased demand on already strained human capital resources and may further divide these doctors, nurses, and therapists into different work settings. A long-term strategy is needed to attract and retain such specialists to the Virgin Islands that are inclusive of other hard-to-find healthcare talent. In concluding my remarks regarding Bill 34-0279, the Virgin Islands Behavioral Health Act describes the creation of a comprehensive set of mental and behavioral health programs. I am encouraged by the direction of this bill and encourage all that are associated to remain committed to seeing such services implemented within the Virgin Islands. It is a monumental task, but every great cause deserves the time, energy, and sacrifice to ultimately see it through to fruition. There is no better cause or reward than knowing collectively we can and will be changing the lives of so many that need our support and expertise. I am in support of the creation of a comprehensive set of mental and behavioral health programs and hope that my comments can further shape this journey to one of long-term success for our communities. This concludes my testimony, and while I am not available in person today, I offer the opportunity for anyone to reach out to me for further dialogue related to this legislation.
Thank you, Madam Clerk. Now we'll hear from Ms. Pogson, the AARP representative, followed by Attorney Joseph, and then we'll read the testimony from the Bar Association. You may proceed.
Good day. Honorable Senator Novelle E. Francis, Chair of the Committee on Health, Hospitals, and Human Services, and Senators of the 34th Legislature. My name is Sherilyn Pogson, and I'm the Senior Operations Specialist for ARP in the Virgin Islands, and I'm also a NAMI, the National Alliance on Mental Illness St. Croix Affiliate Board member. I want to thank you for including ARP in the Virgin Islands in this important discussion on behavioral health services in this territory. As the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age, we advocate at the local and federal level for issues that matter most to our membership of 38 million members nationwide and approximately 22,000 in the Virgin Islands, including access to health care. Through its policy, ARP supports fair and equitable access to health care. As it stands, Virgin Islanders are disenfranchised, both in terms of access and outcomes, resulting in many of our residents receiving less than optimal care to support healthy living as they age. We support healthcare reforms that significantly improve access to adequate and affordable coverage for vulnerable and underserved citizens living in the territory. For these reasons, we would like to express our support to ongoing efforts that reform behavioral health services with the enactment of this legislation. Mental health is a fundamental component of overall health. Mental illness affects people of all ages and incomes and can be as debilitating as any other major medical illness. About 1 in 5 adults experience a mental health condition in any given year. Prior to the enactment of the Affordable Care Act, many people with mental illness did not receive treatment because of stigma, patients' resistance to treatment, and the lack of the structural and functional mental health care delivery in the healthcare system. In addition, resources including trained professionals for community-based mental health services are extremely limited. This bill seeks to change this narrative. By enacting this bill, the Virgin Islands adopts a holistic approach of helping persons living with mental illness access much-needed services. When persons are unable to access health care, they may delay needed care or not properly manage their chronic conditions, which can lead to unnecessary suffering and worsen health. While some mental health services are available, studies from a recent ARP survey indicate that the ability to access and afford treatment is limited. There are myriad approaches to expanding access to services and prioritizing mental health and making care more convenient to help more people. For example, addressing basic necessities. As policymakers, consider increasing the funding to community-based mental health services that assist people coping with mental health issues with all aspects of basic life necessities. When we're talking about food, shelter, and employment. By providing additional funding, these centers can continue to conduct the necessary outreach to patients and their families. The Emergency Mental Health Hotline. In 2020, the US Congress authorized the 988 code with the intent of giving Americans across access to over 200 crisis centers across the nation. The installation of Emergency Mental Health Hotline here in the Virgin Islands can make care convenient and accessible to those families caring for their mentally ill loved ones by connecting them to local resources. And lastly, ensure access and equity. Public and private sectors should work together to promote improvements in health. As lawmakers, leverage your position to strengthen the healthcare system by ensuring coordinated approaches are in place to deliver high quality, affordable care. In closing, everyone deserves access to equitable and accessible healthcare. And this legislation contains proposals that move the Virgin Islands closer to the vision of improving people's lives. It is certainly within your power as elected officials to ensure that the mental health needs of Virgin Islanders are better met. You can lead the way by advancing Bill number 34-0279 and meeting these goals, and ultimately making the Virgin Islands a more livable community. ARP strongly urges the members of this committee and all members of the 34th Legislature to vote in favor of this bill. Thank you, and I will make myself available for any questions.
Thank you, Ms. Parkson. Now we'll hear from Attorney Joseph from the Public Defender's Office, followed by the testimony from the clerk on behalf of the President of the Bar Association.
Good afternoon, Chairman Senator Novel E. Francis, members of the Committee on Health, Hospitals, and Human Services, members of the 34th Legislature in attendance, invited testifiers, and individuals in the listening and viewing audience. I am Samuel L. Joseph, Esquire, Chief Public Defender for the Office of the Territorial Public Defender. The Office of the Territorial Public Defender has been invited here today to comment on the proposed bill to establish the first Behavioral Health and Development Disability Act. As the head of a stakeholder agency, a Virgin Islander, and a member of this community, I would like to say thank you to all that played a role in the proposed legislation. The testimony I offer today is within the context of the criminal justice setting and the ramifications thereof. While there has been substantial work on this legislation since the last hearing, there remains a few areas that needs further consideration. The first area that should be addressed is the method of determining indigency. Pursuant to the proposed legislation, indigency is based on an eligibility system developed by the Department of Health. Notwithstanding, the judiciary has its own method of determining indigency. These potentially varied positions could result in a stymied application or outright denial of mental health services to those in need. Essentially, the court may find an individual should receive treatment at a behavioral health facility, while the Department of Health can deny that person services due to the indigency requirements. This body should consider a uniform method of determining indigency, and in this case, one that is aligned with the judiciary's method. The second area of concern is the use of the term probable cause. There are several places where probable cause appears in the proposed legislation. Based on the various places and contexts used, it is clear there are different meanings. By way of example, the first use of the term probable cause is found in section 1004 under Standards for Public and Private Treatment Facility Enforcement Procedures, Penalties. Subsection F states, upon petition of the director and after a hearing held upon reasonable notice to the facility, the Superior Court may issue a warrant to an officer or employee of the division authorizing him to enter and inspect at reasonable times and examine the books and accounts of any approved public or private treatment facility, refusing to consent to inspection or examination by the division or which a division has probable cause to believe is operated is a violation of this subchapter. This section clearly relates to the operational side of behavioral health facilities. Conversely, subchapter 7, protective custody and emergent sections 1023 through 1024 states, when a law enforcement officer or crisis intervention personnel has probable cause to believe that a person may be suffering from behavioral health challenge, mental health disorder, or substance use disorder, and that due to that condition, the person presents a threat of harm to him or herself or to others or to property, the law enforcement officer or crisis intervention personnel shall immediately take the person into custody and deliver the person immediately for examination by a medical practitioner to a hospital or appropriate behavioral health treatment facility. Based on the aforementioned sections of the proposed legislation, it appears there are different uses of the term probable cause. Generally speaking, the term probable cause is used within the context of criminal law violation, such that reasonable, articulable suspicion exists that criminal activity is afoot. Furthermore, the contextualizing of probable cause under the Minneapolis court's finding in Graham v. Barnett is not binding on this jurisdiction. If our courts do not agree with the previously mentioned approach, this will impact the core of the bill. While no statute is perfect, we should always be mindful of the high potential for the constitutional challenges. Another area of concern is Section 1006H, which states, mail or other communication to or from a patient in any approved treatment facility shall not be intercepted, read, or censored unless the director, administrator, or another person in a position of authority has cause to believe that the mail or other communication contains contraband information regarding an unlawful event or activity or otherwise warrants interception, in which case the mail or other communication shall be forwarded to the Department of Justice for appropriate action. A real application of this portion of the bill would give most behavioral health facility employees authority to intercept and read every piece of mail, which could include legal correspondence on cause to believe. Cause to believe it is tantamount to a hunch or feeling. The goal of any legislation is to get the most comprehensive act while balancing it with societal needs and requirements. This includes, but is not limited to, due process and other constitutional rights. The language of Section 1006H is vague, overbroad, and will not pass constitutional scrutiny. Next, I urge this body to consider the impact of the definition of eligible individual pursuant to Sections 1039 through 1044, civil commitment and rehabilitation of individuals suffering from substance use disorder. Individuals with substance abuse disorders cannot avail themselves to certain treatments or programs. Under the current language, the proposed bill, these non-eligible individuals include, but are not limited to, persons charged with crimes of violence, persons against whom there is a pending a prior charge of a felony which has not been fully determined, or an individual who has been convicted of a felony on 2 or more occasions. This language is counterproductive and will unnecessarily disqualify individuals with actions or whose actions fall within the previously defined categories, despite their diseases playing a major role in their actions. Lastly, an extremely important section that should be corrected is who is responsible for the cost of mental health evaluations for those considered indigent. I'm of the position the cost of these reports should be attributed to the Department of Health. The only exception would be where a defense counsel procures one on his or her own for purposes of putting on a defense at trial. As you are aware, the first step in any criminal matter is to bring the individual before the court for his or her advice of rights hearing. At this preliminary stage, the defendant must have a basic level of understanding of where they are, why they are there, and the persons involved. If a defendant lacks this basic understanding, the prosecution of the matter cannot move forward, and the government as a prosecuting authority cannot cause the defendant to be held indefinitely. Thus, it is pertinent that competency be established at the very beginning of the process. Anything less would result in a gross violation of the defendant's constitutional rights. The Department of Health Division of Behavioral Health, Alcoholism, and Drug Dependency is a publicly funded division of the government of the Virgin Islands with the express duty to administer or supervise the administration of the provisions relating to the mentally ill in any territory plan submitted for federal funding pursuant to federal health, welfare, or treatment legislation, and provide treatment facilities for the mentally ill. Virgin Islands Code, Section 19, Virgin Islands Code Title 19, Section 713, Subsection 4, and Virgin Islands Code Title 19, Section 713, Subsection 8, and Subsection 8. Title 3, Section 418 of the Virgin Islands Code notes the Department of Health is mandated to develop a sound community behavioral health program and has direct responsibility for conducting mental health programs. In People of the Virgin Islands versus Hyman, 2012 Virgin Islands Lexus 33, even a second competency evaluation was warranted and ordered by the Superior Court. The court held the Department of Health is statutorily required to assist the prosecution to determine a defendant's competency. Based upon Virgin Islands statutory provisions, the court also concludes the Department of Health is statutorily responsible for assisting in the prosecution in meeting the burden of proof when a criminal defendant's mental competency is at issue. The Commissioner shall establish comprehensive and coordinated programs for the treatment of the mentally ill, alcoholics, intoxicated, and drug-dependent persons. The term treatment is expansive and includes a broad range of emergency, outpatient, immediate, and inpatient services and care, including diagnostic, evaluation, medical, psychiatric, psychological, and social service care, vocational rehabilitation, and career counseling, which may be extended to alcoholics and intoxicated persons. Hyman, this is the Hyman case, 2012, Virgin Islands, Lexus 33. Simply put, the cost of mental health evaluations for the purpose of determining competency when an individual is brought before the court in a criminal matter should be attributed to the Department of Health and any other agency, entity, or persons. This holds true even after the initial evaluation for competency. The proposed legislation should not be used to rewrite the obligation of the Department of Health. While the issue of payment for evaluations in criminal matters has never been specifically codified in the Virgin Islands Code, based on the foregoing reasons, the cost should be attributed to the Department of Health as the agency that has the duty to serve the health needs of the territory. Similar to other government agencies that service those considered indigent at little to no cost, so should the Department of Health operate. This is morally correct and furthers the ends of justice. As Chief Public Defender, I have seen firsthand the issues that normally come along with or fall within the world of criminal justice relating to behavioral health. This legislation is the biggest step taken in decades to address the behavioral health issues in our territory. While I find some comfort in the proposed steps, the sections of concern have identified must be addressed. I thank you for the opportunity to share my thoughts, and I await any questions you may have.
Thank you, Attorney Joseph. Now we'll hear from the clerk on behalf of the Bar Association President, Attorney Yudwani.
On behalf of the Virgin Islands Bar Association, I thank you for sending for our consideration of the Virgin Islands Behavioral Health Act, a comprehensive bill to ensure a structure of support to individuals throughout the Virgin Islands who suffer from behavioral health challenges. The Virgin Islands Bar Association, VIBA, does not oppose this bill. However, we wish to make the following suggestion regarding the bill. The VIBA requests that there be a reconsideration in the funding source, as removing critical funding of 15% to hospitals and health from our territory's hospitals is a matter of critical concern for all Virgin Islanders. In conclusion, the Virgin Islands Bar Association does not oppose the Virgin Islands Behavioral Health Act, however, suggests amending the bill in the manner listed above. Respectfully submitted, Virgin Islands Bar Association, Alicia Udwani, Esquire, President.
Thank you, Madam Clerk. Before we proceed, I think I do see, is there any other testimony from those online at this time? Commissioner Gomez, I see we had Director Testamark. I'm not sure if... Okay. So, hearing none, the committee will take a 2-minute brief recess. 1, 2, 1, 2. The Committee on Health, Hospital, and Human Services for Friday, July 29th is back on record. Senator Francis, you recognize for any alibi before we open up the discussion. And before I recognize you, Senator Francis, for your alibi, let me recognize the presence of our Senate President in the St. Thomas St. Thomas? President Donna Fred Gregory, welcome. Senator Francis, you recognize for your alibi.
Thank you very much, Mr. Chair. Just two things real quickly. First of all, I want to thank all of the stakeholders' input into this very important measure. As I discussed, this is a repair in progress as we move this legislation forward. So it's not a perfect bill, but we'll continue to fix it as we go along. In respect to the testimony by the president of the Bar Association, and I'm trying to address the headlines for tomorrow. We're not trying to take 15% from the hospital and health, but rather that, in fact, this very same earmark of 15% goes towards mental health and behavioral health to the hospitals, and rather trying to create a fund that would be able to, again, support our behavioral health situation. So, media, this has nothing to do with taking money from the hospitals or health, all right? Quickly, I wanted to ask a Chief Public Defender, Joseph, in respect to, and we very much appreciate his comments in regards to the probable cause, and it's something that we'll certainly address in this particular issue. But he also mentioned about competency, and I wanted him to further discuss the issue of competency or his concern in respect to that. Attorney Joseph?
Yes, can you hear me?
Yes, we can hear you now.
And if the senator could repeat his question.
Yes, sir. Again, Attorney Joseph, you mentioned Chief Joseph, in regards to your comment about competency, can you further explain what's your concern about that particular issue?
Well, with respect to the issue of competency, an evaluation is needed to determine whether or not the person is either competent to stand trial or even competent in the sense of understanding what the proceedings that are occurring as it relates to him or her. Initially, when a person is brought in, as some may be aware, they go before the court for what's known as an advice of rights hearing. Oftentimes you see, or you have a situation where individuals have no understanding of what's going on. So at that point in time, when does that person gain the ability to understand what's going on? If that doesn't occur within relatively short order, then the matter itself can't proceed and that individual can't be held indefinitely. Recently, we've had an issue where, and relating specifically to this bill, where there was an issue of payment for an evaluation. Now, the evaluation wasn't requested specifically by our office, but it was asked that it be paid for by our office with someone that was contracted by the Department of Health. So we don't even know what their costs were, what the evaluation entailed, where they were evaluated from, a number of things. But outside of that, competency and evaluating the person to see whether or not the case can move forward is always a particular issue. Our office and similar offices shouldn't be burdened with the fact of having to pay for these evaluations, because we are on the defendant side. A case simply can't move forward without that competency evaluation being done. So even at a minimum, and similar to what I stated in my testimony, even at a minimum, and initially when a person is brought before the court, competency has to be established to some extent. Otherwise, you can't move forward with the case. And as noted before, you can't hold an individual indefinitely.
Very well, thank you for that. I wanted to ask our legal counsel, Attorney Sekou, because It is my understanding that competency will be determined, and of course, the defense attorney should be making that on the first appearance during the advisor rights, whether or not the individual could understand or comprehend what's transpiring. Attorney Siku, can you?
Yes. Thank you through the chair to Senator Francis. In terms of the competency, it is our understanding that usually a criminal defendant is considered or presumed to be competent to stand trial unless there is some indication that the person is not competent or unless their defense attorney raises that competency. So in trying to make sure that we tighten up the bill, I just wanted to make sure we were in fact on the right track, because the bill already indicates that at any time during the proceedings, a competency can be raised, and that would just simply be whether or not the defendant can in fact understand the charges that are against them and whether they're able to assist in their defense. So I guess we're sort of unclear as to exactly what other language your office would see that we would need in the bill.
Well, I would put it within the context of, it's not just about so much about the competency to understand and to stand trial alone. It's about moving the process forward from the most basic and initial stage. And in terms of moving it from that basic and initial stage, which is the advice of rights stage, there still needs to be a mental health evaluation, right? Some sort of evaluation to say what direction are we going, can we even go forward? So we sometimes use the words interchangeably and in close connection or relation when we say, mental health evaluation, but the mental health evaluation could determine competency to some extent. So we are not opposed to any levels of checking on competency, which is obviously needed. What our concern, health evaluation, who should that cost be attributed to? Who should that responsibility be for? So, for example, you have a defendant who may appear in court for, let's say, what they've been charged with vandalism for breaking a window, right? Obviously, this person, based on the way they keep themselves from a physical standpoint, has some mental health issues. It's an individual we've seen within the community. You get before the court now, and the person refuses to speak, or they're speaking in a lexicon or a language which is not considered quote unquote normal, or they start making peculiar or weird actions or noises, and they refuse to answer the judge as requested by the court. Things that indicate that this person is not of what we would consider normal or rational mind. That's where the issue of the evaluation comes in. And then the evaluation would tell us whether or not they're competent. So my issue per se is not the competency evaluation, and it's not the competency itself or the finding, but the evaluation that's required to get to the point of competency. Who should that cost be attributed to?
Thank you, Attorney Joseph. In the essence of time, I'm going to just reshuffle the order that we would speak as we open the discussions. We'll allow for the Senate President to ask her questions, and Madam Clerk, 5 minutes for everyone. Thank you. Senate President Fred Gregory, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to my colleagues. And I want to apologize for this morning, but we have a matter that's before us that I've been very involved in. So thank you for allowing me to go before my colleagues because I have to leave. But when I got back to my office, I was listening to the conversation and I realized that I needed to run upstairs. We've been at this for quite some time, and this bill replaces the piecemeal laws that we have in the Virgin Islands around behavioral health. And I heard the testimony particularly by Lori Thompson, and it made me stand at attention because she made some statements in her testimony referring to indigent patients in section 1007B, indicating that, well, that's what it states in that section, that all indigent patients must be kept and maintained at a behavioral health facility at the expense of the government of the Virgin Islands, and on and on. And I think that her concerns are valid as it relates to the costs associated with providing this level of service. We have to figure out how do we really address this in a meaningful way and not put the government of the Virgin Islands in a situation where it's eventually sued for not being able to provide that service. She also, and she talked about opening the territory to multiple lawsuits. I am hoping that there'll be someone on the government side who's been working with my colleague who can address these concerns. One of the things that she did not do, which concerned me, is make any recommendations for amendment. So I'm going to ask Attorney Thompson, the psychologist, Dr. Lori Thompson, if she has any recommendations to address the concerns that she laid out in the in her testimony. And I'm going to allow you to answer. And then there was an area where there's also a concern about the director of the facility, or the overall director of behavioral health in the territory, and the amount of power that this bill is giving. And that is of concern to me too. So I want to hear today, because this mental health, behavioral health rather, is an issue in the Virgin Islands, and it's something that we need to address. So I would like to hear from those that have specific issues around the legislation, who gave their statements but didn't give us any recommendations to address or to move this forward. You know, what do they see that we can do to move this legislation forward? But there's something that was very profound that Dr. Thompson said, and I have to read it. She said, she spoke to the fact that, let me see, let's start with funding 1 or 2 outpatient psychiatry positions to address the urgent needs of this population through the Department of Health. Once this has been accomplished, let's raise the salaries for the staff at the Eldra Shelterman Residential Treatment Facility so that we can quickly transfer more patients in need to that agency. And then she said, finally, building a new behavioral health treatment facility would be the next logical step in making our territory's mental health programs more available to the community. And I really think, you know, while she did not give us any recommendations, this is a profound statement that we really need to drill down on this afternoon as to what we can really do outside of this 70-page document. How do we really address mental health in a meaningful way? In 2019, we gave Department of Health $3.2 million. Yesterday, we found out that they still have $1-something million left for mental health. So we have to get to the place where, outside of a voluminous document, we really need to drill down on how do we address this matter in a meaningful way. So I want to hear from Attorney Thompson. I keep calling you attorney, Dr. Thompson, around your recommendations to assist with moving the legislation forward.
Madam President, I meant to tell you that Dr. Thompson is no longer in the chambers with us.
Okay, so.
Your questions weren't going on deaf ears, so everyone heard you.
May I respond?
Oh, wow. So
and
is there anyone from the Department of Health?
Yes, the commissioner would like to respond.
Yes, thank you.
Good afternoon, and thank you, Senate President. A couple of things. I do agree with you in reference to some of the discussion taking place and how we can also further recommend changes to the bill. In reference to the 3 aspects of Dr. Thompson's concern, 1, we have extended external entities to provide mental health or behavioral health counseling She's also one of them that we pay on a monthly basis to do so. So we have contracted with her as well as 2 other agencies to assist us in terms of crisis intervention as well as care on an ongoing basis. So that's being done. In reference to Elder Shelterman, I agree. We are right now beginning our negotiations with our collective bargaining union to increase the salary and the wages for clinical staff throughout the territory. So that is on its way. And this bill actually speaks to the development of a psychiatric facility that she is speaking of. And I recognize that 1 million and more monies are still here and not spent for a facility. However, that too would create a piecemeal objective. A behavioral facility costs at least $35 million, and that's one of the reasons why we keep coming around to the same conversations. How are we going to get the funding, a lump sum of funding, to be able to create a behavioral health facility that provides wraparound services, long-term care, transitional care, subacute care? So all of those will have to come together, and I'm sure that DC Steele is here. He can probably speak to it a little bit more. But those things that she has pointed out, she also is one of the contracts that are included in providing outpatient mental health services or behavioral health services. So yeah, hopefully you have more questions for us, but like I said, DC Steele is here and he can speak to it as well.
I'm certain that my time has been called.
We'll allow them to respond.
My time was called, Mr. Chair?
Yes, but we'll allow the Deputy Commissioner to respond.
Okay, all right. I'll listen. Thank you.
Okay. Hello. Thank you.
You can pull that mic out if you, yes.
Yes, thank you. As Commissioner mentioned, all those things already, but we also, in the process, we recently onboarded another in-house psychiatrist that will be joining the team before the end of the month, because we do see the importance of having our psychiatric care in-house and having the availability so that individuals don't have to wait for long durations of time to not only receive it in outpatient, but to meet the demands from the courts for ongoing evaluations.
Thank you. Point of information, Senator Francis, you recognize?
Thank you very much, Mr. Chair. I also wanted to interject that while we're making reference to the Elder Shelterbrand and the fact that they're having staffing issues, we don't have any institution here in the District of St. Croix. None whatsoever. So I think that the discussion here is really, comprehensive, where we're talking about institutionalizing, having an institution here on St. Croix as well, and to be able to comprehensively and territorially address the issue of behavioral health and mental health in the Virgin Islands. So, there is no silver bullet, but at the same time, I must interject that we have been at this for quite some time in respect to at least having some type of institution here on St. Croix to be able to support the behavioral health. In more than one instances, individuals have been sent from St. Croix to St. Thomas, and also to the States. And we all could agree that when you're outside of your environment, that presents some challenges in itself. So I think it's essential that we're able to, when we discuss this particular issue, is to really look at all of the four corners of the issue that has been raised. Thank you very much, Mr. Chair.
Thank you. And before we go to Senator Blyden, since you just stated that, Senator Francis, Commissioner, you want to provide an update on the status of the Anna's Hope facility? I think I read something yesterday where there was about $3 million that was given for a build out there or something.
Correct. It was for a renovation of a heart structure that's on the plot. And we did an assessment and we realized that right now we cannot use the building as is. It's not structurally sound, as well as it would have to be renovated to meet the current needs of a behavioral health facility that's needed. So we did ask permission and receive permission to have those funds shifted over in architectural and design entities so that we can have someone come in and truly build out a facility that, even if we start small, we know that it may take 30 million and over to do it, but if we start small and build upon it, we'll be able to do so.
You said you asked permission for that to be transferred over. Who you asked
By the
permission?
legislature, Senator Francis,
Okay.
Senator Noville Francis.
All right. Senator Blyden, you're recognized for your 5 minutes.
Thank you, Mr. Chair. Good afternoon. All testified, and thank you so much for your testimonies. I really appreciated the insightfulness of the testimonies, the suggestions, recommendations, concerns, all of the above. It's clear that we don't have to have further dialogue. I do support the intent of this legislation. It's comprehensive, that's what we need. I myself have brought forth several behavioral health legislation also, and the chair have been working on this for some time now. And I really want to commend him on all of his work he has done thus far, and as we continue to move forward, I look forward to having all of these individuals at the table moving forward so we can really fill all the gaps moving forward. I really want to thank Dr. Thompson for her testimony also, and Attorney Jordan, beautiful testimony. Someone mic is open. Someone mic is open.
Excuse me, 1 second. Excuse me 1 second. Media, can you turn off the testifier's mic on St. Thomas, please? Thank you. You may proceed, Senator Blyden.
Thank you so much. Like I was stating, I really enjoyed the dialogue and the collaboration. And I think we need much more of that to make sure this bill is on point and we fill all the gaps. But one of the key points that was stated by Dr. Thompson when it comes to behavioral health and the thing that's hampering the bill implementation in terms of behavioral health, I'll actually Commissioner Encarnacion. You spoke to everyone that testified spoke to funding. Every single person spoke to funding. And there was several mention also about HAPA violation, etc. But in terms of funding, what would you think it would cost in terms of initial startup to assist in making this bill a reality? Have you done any assessment? Commissioner?
I am so sorry, Senator, but part of your question broke through, so I didn't hear everything you said.
I said everyone in the testimony spoke to funding, okay? And it is clear as to whether we are providing sufficient resources to ensure that basically this doesn't become another unfunded mandate. So based on your department review of this measure, have you developed any estimate of what the initial funding would be necessary to put all of the elements of this bill in place in terms of an annual cost?
Well, we have actually, I don't have those dollars with me, but we have looked at crisis intervention, we do have a staffing plan for Elder Shelterbrand, so we can get that information to you as soon as possible through Senator Francis. We've looked at the cost of a rebuild of a facility, and that would be about 30 million, but we don't have to start with 30 million, so we can get all those figures for you, including staffing.
I would appreciate that because also what was stated in Dr. Thompson's testimony also was in reference to the Elder Shelterbrand facility in terms of assuring that we staff up that facility in the interim. And also that study needs to be done too, because that I'm not expert in the area, but I think it makes a lot of sense. And it will take us a far way in terms of at least assisting at least 30 individuals in the meanwhile, while we are working on all the other areas. So it would be nice to have that information also in order to move forward comprehensively in respect to the bill and the outcomes. So I want to basically, before I go, ask also Board Chair Finch. He spoke relative to several concerns also, but I would like to have him expound on his concerns that he spoke to in his presentation. Board Chair Finch.
Thank you, Senator. I'm also missing part of the question. Which was the specific area you wanted me to expound on?
Well, I know the chairs, the bill sponsor spoke to the funding from the casino revolving fund, the 15%. So he's basically stating that it will come in as overall funding for both hospitals. So once that's done, would that concern, would that take care of your concern in terms of that 50% funding for the hospitals?
Thank you for that, Senator. The requirements of the bill are very likely.
1 minute.
Proceed. The requirements of the bill are very likely going to increase the cost of the hospital. Governor Juan F. Luis Hospital right now is not paying for a psychiatric center, and will be, and that has always been part of the plan. So, understanding that the casino fund for each hospital was approximately $100,000 a year. Perhaps not a large part, but losing $100,000 when your costs are already going to go up anyway. The request was for other consideration if the decision is made to reallocate. The casino fund, we would just ask that money get replaced somewhere else. If I could, I don't mean to run down the road with the senator's question, but from some of the other conversation, the Department of Human Services is mandated to provide a tremendous amount of the residential care that exists in the territory now. Many, many years ago, there was an executive order of a tri-agency agreement between health, human services, and education that required the cost for residential care to fall under education, really for all youth-related concerns, whether mental health or developmentally disabled, and for adults, with the exception of adults with acute mental illness. So as we began to think about what might the world of this residential care cost us, and of course Human Services has used a lot of it in stateside facilities, there is examples to look at that budget. I mean, we wouldn't be just starting with a blank slate, and we can look at that experience of what it costs to on their end to manage that process and what those dollars are. And I know there's a hefty amount, but at least that's a somewhat known number.
Mr. Chair, I have one last follow-up question because I had some issues up front. Can I just conclude, please?
Sure, you may.
Okay, very well. Attorney Joseph, in your testimony, you spoke to indigency requirements, and in particular, you spoke to the term probable cause. So what would your recommendation be in respect to probable cause in the legislation?
As it relates to taking into consideration conflict of interest issues, I will state this. As it relates to probable cause, my opinion or position is that that would not be the best fitting verbiage to be used. There is two sections which I pointed out that I found seem to be in conflict. One spoke specifically to the operational side and the ability to view books to see whether or not the facility is being run the way it should. And then the other aspect, or the other portion, is where it spoke specifically to taking persons into custody for purposes of commitment. Generally, as I noted in my testimony, probable cause is found within the criminal context. And the case that is cited in the legislation or reference is not from our circuit, and it doesn't mean that our courts may follow it. And in putting forward any legislation, we obviously want to get as close to the best as possible, and not something that will allow for challenges, and then challenges that strike the core of the legislation. So something along the lines, based on reasonableness, may be more appropriate. But I don't have any more specific suggestion other than something more reasonable.
But thank you for your responses, and I look forward to further discussion on this most important pressing issue we have facing us, which is behavioral health. Thank you so much, Mr. Chair, for the time.
Thank you, Senator Blyden. Point of information, Senator Francis, followed by Senator Francis Heiliger.
Thank you very much, Mr. Chair. I just want to say funding is, in fact, a very important component of this discussion today. And there's some contemplation on my part where First of all, I moved legislation sometime back to mandate that a portion of our budget goes towards agriculture. And if we are thinking that this is serious enough, the problem of behavioral health and mental illness is serious enough, I believe that is this body's authority to make a decision whether or not a similar legislation need to be created where we line item and mandate that a portion of our budget goes towards behavioral health and mental health issue. It is something that I'll discuss with my colleagues, but that is what comes to my mind while we're having this discussion regarding funding, because it is a tremendous heavy lift, as well as there's a lot of federal opportunities for funding that's going through right now, and that, in fact, we just need to try to capture those as well. But as a government, we have a responsibility to take care of our indigent. We have a responsibility to take care of our vulnerables, and I'm thinking that we as a body could make a decision to earmark a portion of our budget to go towards that endeavor. Thank you very much, Mr. Chair.
Thank you, Senator Francis. Senator Francis Heiliger, you're recognized for your 5 minutes.
Thank you so much. Good afternoon again to my colleagues, to the testifiers, to the people of this territory, and to the staff. Since I've been in this 34th legislature, we have been discussing this particular bill. And for me, every time I think it's going to come out a little bit cleaner, there's more questions. And I'm a little bit concerned where I think we need to focus on potentially zoning in on a lot of these concerns that was brought to us by many of the testifiers today, such as violation of HIPAA laws. One of the concerns I have has to do with giving quite a bit of power to this Director of Behavioral Health. I also have a concern as to the potential calculation of dealing with our indigent here in the territory. Have we done any sort of calculation as to how much this would cost? I could speak for myself that recently had to deal with a behavioral health issue within my own family. And if we did not have insurance, I could clearly see how issues like this could bankrupt a family. And I'm serious enough to know the importance of having a program and a setup for behavioral health, but I also have to weigh and balance it with the fact that we don't even have the facilities to do so. Now, we speak about the one location at Schultebrand. I had an opportunity to visit them, and I think they told me, if I recall correctly, they could house 14. And you are correct, some of those individuals came over from St. Croix. There's also a separate building up there that have some roof damage. I got a tour of that building. That building seems to be very sound building-wise. The roof needs to fix. Has there been any type of assessment to see if to fix that roof is going to cost another $5-6 million, if that much? Because then that location, according to what was shared, can hold another 32 to 35 people. And in speaking to colleagues and knowing what transpired in the meetings, I think yesterday, as to potentially needing another $30 million to build a facility on St. Croix, I am a firm believer that we do need to focus on shoring up the locations in order to do all of these things we're claiming we want to do. We have question about funding. We have questions here about one of the things that stuck out for me in the document. It spoke to the treating medical provider versus someone that's a psychiatrist. So are we now going to shift to someone that is just a treating medical provider to assure that they have the capabilities, the knowledge, and the training to potentially put someone away? These kind of things concern me. And I fully understand what needs to be done and what we want to do with this piece of legislation, but I think it needs to be continually worked on until it's a document that is very safe and erases or takes away quite a bit of the concerns that many of these testifiers shared with us today. Constitutional issues, bankruptcy, cost of indigency, giving power to individuals that now is causing me a pause. So I really think that whether we're going to be amending this document, bringing forward information to do so, I will be looking forward to that when it comes so we could clean it up. But I also think we need to focus on actually having the locations fixed. We have Schultebrand here, another 32 to 35 people can be there. Get the building in St. Croix done. And I'm not saying this because I just want to be talking about it. We have a habit here in the Virgin Islands. We spend money on architectural drawings. We spend money on case studies. We spend monies on the consultant to the consultant to the consultant to the architecture, and then the building never gets built. That's a problem for me. Either we're going to be serious about this, or we're just going to keep giving lip service, push through a bill that it don't even have any buildings in order to help the people with. That wouldn't make any sense to me.
Time.
So thank you very much. Let me just close up. I'm simply asking my colleagues, could we please clean this up? I think behavioral health is important. We need legislation like this, but most importantly, we need the locations to help the people that need the help here in our territory. Thank you very much, Mr. Chair, for the time.
Mr. Chair.
Thank you, Senator Francis Heiliger. Commissioner Encarnacion, you recognize.
Thank you very much. I think there's some clarification.
Please recognize Commissioner Encarnacion's mic. You may proceed.
Thank you, sir. I think there's some clarification that's needed. When embarking on a behavioral health or any kind of clinical facilities, I think that CEO Attorney Commission was the first person that spoke about it, and that is regulatory entities. We have CMS, we have Joint Commission. Those regulatory entities provide rules and regs as to how the operational functions should take place. So it's not going to be haphazard. Any entity, whether it be public or private, if Medicare, Medicaid services are being provided and paid for by Medicaid or Medicare, the regulatory responsibilities fall under health as well as the Centers for Medicare and Medicaid Services. So the guidance would be given there, the mandates would be given there, so it's not going to be done haphazardly. So that's one of the things I felt best to clarify. Right now we pay, another thing is cost. Right now we pay about $400 to $500. I think one agency we pay more than $500 per day for services. So it will be similar to that. The difference is that we will have these individuals home, and I think that building a facility closer and having one in St. Croix, as well as fixing Elder Schultebrand, and I have Assistant Commissioner Ruben Malloy, who can tell us exactly what's going on with Elder Schultebrand and why we have to, if there's a delay on that as well. I just wanted to make those clarifications. Right now we have 27 individuals in Elder Schultebrand. We can hold about 32. Thank you. And so in terms of indigent fee, currently right now, the Department of Health and the government of the Virgin Islands do pay for individuals with a certain degree. If they have insurance, of course, that is considered for most of the cost for inpatient care throughout the territory and off island as well.
Thank you. Thank you, Commissioner, for that clarification. We'll wrap up now with the bill sponsor. Senator Francis, you recognize for your 5 minutes.
Thank you very much, Mr. Chair. I just want to remind my colleagues that, in fact, there were a lot of testimony this afternoon in regards to this bill. We had Commissioner Encarnacion. Well, we had certainly the chair of the Virgin Islands Government Health and Hospital Corporation. We had certainly the CEO from Snyder Regional Medical Center. We had the CEO from the Wang Lui Hospital. We had NAMI. Here we had testimony from the Bar Association. We had testimony from Chief Joseph from the Public Defender's Office. We had one individual that had some serious concern that happened to be a private provider. A private provider that enjoy what's being provided to her on the behalf of the government of the Virgin Islands. She does a fantastic job. But let's be mindful that the government still have a responsibility here. All the other individuals that sat here commended the bill. They made recommendations on how the bill could be strengthened. We have an amendment to address those concerns. Be careful what we are being led to believe. We had the Attorney General's office that reviewed this. Are they very much concerned about HIPAA? You think they're going to move legislation that's going to jeopardize this government? We had our legal counsel's office that worked extensively on this measure and went back and forth with the stakeholders to make sure that the contents that was put forth in this bill was very much important. I toured the Elder Schulterbrand facility, must have been about 6 years ago, in the 31st legislature and again in the 32nd. And the same conversation in regards to that building next door has been around since then. Not a thing ain't happened. Not a thing ain't happened. Every single day we are faced with individuals that's fallen out on our roadway. We have businesses that's under siege. We have families that have to endure situations of chronic episodes. They can't wait for something to be done. We're taking baby steps here. We're talking about a comprehensive bill that not only talk about the facilities, but also talking about right fitting the code, rather than having it scattered all over the place. I implore my colleagues to move this along. We'll fix what needs to be fixed in rules. We'll fix it up to session. Rome wasn't built in a day. We have been at this for quite a long time. We need to get moving. Let's not allow the perfect to be the enemy of the good. This is too important. This is too important. Thank you very much, Mr. Chair, and I want to thank all of the testifiers here today and for all the work that you do. I mean, you see the manic episodes that happens, in these various clinics and throughout the island. We have a responsibility to this place. Let's do the right thing. Thank you very much, Mr. Chair.
Thank you, Senator Francis. All I'll say behind that is that this isn't one of those feel-good legislations. This is something that's needed, urgently needed in the territory. All right? We've shepherded through things. Sorry I have to say, but we've shepherded through feel-good legislations like the gun violence awareness office and all kind of foolishness. And here it is. We have something that's really needs to be addressed in the territory. And not that gun violence doesn't need to be addressed, but the office was just redundant. And here it is. Now we have a lack of services. And we need to address this. So I'm hopeful that we'll be able to put our heads together, just like how the bill sponsor was able to call some stakeholders so that we could have this discussion. Like he said, it's not perfect, but it's one for us to work upon and make sure that we bring some kind of relief to this territory. So I just want to thank each and every one of you for putting your testimony on the record and for having any input to the discussion. I wanted to ask Director Testemark or Commissioner Martinez if you had anything that you wanted to add to this discussion before we recess for 2 minutes.
Good afternoon, Mr. Chair. On behalf of the VIPD, we stand behind the legislature, the proposed legislation. We're willing and ready to answer any questions that may be posed. We've been a part of this process along with the bill sponsor, several of the other legislators who accompanied us to Austin, as well as a number of departments that were there that are here testifying today. So again, we're here to answer any question.
And Commissioner, your agency has been faced with a number of, or faced with having to respond to a number of these behavioral issues, and finding yourselves in between a rock and a hard place where we have no place to take these people, correct? Is this problematic?
That is correct, Senator.
Is this
problematic? That is correct, Senator. We respond to behavioral health cases of behavioral health issues on a daily basis. And it's not that we don't have a place to take them. The only place that we have at this point is to take them to the hospitals.
Right. The hospital or to the prison?
No, we take them directly to the hospitals. And after the determination by the hospitals, then based on that determination, they're either taken to, generally to BOC, and from there, then the decision is made as to what's going to happen to them.
Thank you. Director Tessamark, are you online?
Yes, good afternoon. I'm sorry, I was having a little challenge here. Yes.
Can you turn on your camera if you can?
Yes.
We are hearing you, but not
Hi,
seeing
good
you.
afternoon. You can see me? I'm seeing me.
No, okay, now I can. You may proceed. Any input? Just asking for if you have any input.
No, we know that BOC is now the agency that houses most of our mentally ill. We do collaborate with the different stakeholders. We do send individuals away with their assistance with Department of Health. So we definitely look forward to this bill and any help that the legislature could give us. Also, just as long as they also fund it, because there'll be a legislation, but we need to make sure that it comes with the funding to do the things necessary to take care of those individuals that's interested in our care.
Right, and having to house them or even take them to other facilities and whatnot is costly to you as well.
Yes, it is. We utilize staff to take them away. So not only do we have to replace the staff that goes with them, the cost, like the commissioner stated, it is borne by the Department of Health. However, there's some cases where BOC also bore the cost also with reimbursement from Department of Health.
Okay, thank you. You have a point of information? No. Point of inquiry, Senator Francis.
Thank you very much, Mr. Chair. I was wondering if we could get Ms. Paxton to weigh in. I know she wear one hat today, but certainly she had served as a NAMI representative for quite some time, and I just wanted to get a her involvement and trying to support and assist family members as well as caretakers with mental health situations. If she could just weigh in, because I think it's so critical. Who feels it knows it. And while we sit here today, if you don't feel it, you already know what we're talking about. But who feels it knows it. So I want to ask her if she could just, kind of just weigh in on the conversation and the importance that we move that type of legislation forward.
Ms. Paxton from AARP, you recognize?
Thank you very much, Senator. Yeah, everyone, all the previous testifiers, you've already stated it's obvious. There needs to be some movement forward. not having access to the necessary care is not only detrimental to the health of the persons that's living with a mental illness, but it's also detrimental to the family members as well. I myself personally am a caregiver. Without access to the necessary resources and information, certainly affects the way how I'm able to live as an individual. We also need to make sure that we're paying attention to what the lack of the access to resources and facilities is doing to our loved ones. They all deserve to make sure that they're living a quality life. And if you don't make sure that you're making sure that you're taking care of their basic needs, the housing, making sure that they have a reason to get up in the morning, then what are we doing? What are we doing? Everyone needs that purpose. Every single one of us needs that purpose. Whether we're getting up and we're going to a job, whether we're volunteering, we strongly believe in collaboration. And so if it's working with government agencies, other nonprofits, there needs to be some kind of movement going forward. I myself have been a part of the conversations with regards to this bill, and know I as I stated from the testimony, from certainly from the ARP perspective, we fully recognize that there needs to be the increase in the funding. We know that it's not enough what we're proposing, so that's where we're asking everyone here in this room, policymakers, lawmakers, to make sure that we are putting the necessary funding in place to make sure that the system is going to be really of great benefit and do what it needs to do for our community. So there really isn't anything else that I think that we need to say. We know that something needs to happen. We have been having this discussion for many, many years, and I certainly have not been a part of it. And I have certainly felt the weight as a caregiver, and just from the NAMI side of things. While we do focus on caregivers, we know that we are making sure that we're paying attention to what's happening with the persons that's living with a mental illness, and there is need there. There's need for our loved ones, and there's need for the caregivers that need that support to make sure that we have something in place, so that when we all go home, we all are making sure that our loved ones are living their best lives, and we are also living our best lives as well. And I think everyone here in this room, we have the opportunity to do that. And we should be doing that.
Thank you, Ms. Parkson. At this time, if there's no other way in, we'll take a 2-minute recess and resume. The Committee on Health, Hospital, and Human Services will be in recess for 2 minutes. the Committee on Health, Hospital, and Human Services for Friday, July 29th is back on record. At this time, what we'll do is we'll give testifiers 30 seconds to close out, and I'll start from on my left with Deputy Commissioner and AARP representative, and then come over to my right. We'll hear from the, what is it, Deputy Assistant Director, and proceed towards, yes, because we didn't hear much from you guys, so. All right. Deputy?
Okay. All right. Thank you, Senator. Thank you to this legislative body for listening to this important bill that's before the floor. I do want to stress that we put a lot of emphasis today on the residential treatment facility, which is indeed much needed in the territory, no doubt. However, I don't want the rest of this bill content be lost in that conversation. We have many of the wraparound services incorporated in this bill, from early detection assessment with children for adverse effects, from implementing procedures and new programming in the school system to ensure that kids are properly identified early, to working close with Department of Education with the assessment teams to make sure treatment planning for kids in needs is addressed, for working with the VI Police Department to ensure they're trained and supported in what they face every day, having to encounter individuals with behavioral health needs, making sure they adequately know how to interact with those individuals, having a crisis team implemented in the territory to support the 988 initiative, which, by the way, 988 was implemented in the territory on July 15 with the hard work of many of the stakeholders involved here, and most definitely with the VITEMA, working closely with the Department of Health. And Senator Francis' office also is keeping a close eye on the 988 initiatives, which we'll further discuss. But there's so many key pieces within this bill that we cannot afford to leave on the table as we get hung up on the one piece of the residential treatment facility, when on a national level, the Substance Abuse and Mental Health Service Administration focus is on community-based behavioral health services. That's all the evidence-based models are pointing towards. It shows that if you detect early prevention, early intervention, and provide the services such as case management, clinical therapy, psychiatric services on an outpatient basis, it further reduces the need for inpatient care and expensive acute services. Thank you.
Thank you, Deputy Commissioner. Ms. Parkson, you're recognized for your closeout.
Thank you, Senators, for allowing ARP Virgin Islands the opportunity to be a part of this discussion. And also from a personal perspective, thank you for allowing me the time to share my personal experience as we all are trying to navigate dealing with our loved ones and behavioral health care services here in the Virgin Islands. Just want to urge all of us here in this room to make sure that we continue to put in the work that we're going to be working on addressing all of the basic needs, doing the hard work with the 988 hotline, and making sure that we all have access, because at some point in time, if you're not a person that's receiving care, you might be the caregiver that's going to be needing to support those loved ones. So make sure that we're providing access to all that need it. Thank you.
Thank you. You recognize? And put your name on the record, Assistant Director on my right. Yes, go ahead.
Okay. It's not.
Go ahead,
Okay.
it's on.
Giselle Ramos, Assistant Director. I cannot leave here today without thanking our staff in behavioral health, because no one knows what we do and what we go through for behavioral health. So with this bill moving forward would really help behavioral health move forward. And I must say, like DC Steele mentioned, that we do have to provide those services within the community, and that's where it starts. We don't necessarily have to dwell on the fact that we don't have a residential facility, but the fact that we have the staff that are committed to provide those services within our community is what is essential right now. And providing this bill will actually help us collaborate with every external agencies that provide services within the community for behavioral health.
Thank you. And I too thank the staff for all that you go through. I was frightened for a minute. I thought you was going to tell us all that you go through. We will be here throughout the weekend. Council, we're not going to leave you out.
Good afternoon, Attorney Taylor Jones, on behalf of Department of Health. Yes, we put extensive work into this bill day in, day out. And even though I just joined the Department of Health, I can see everything that the Department of Health is doing. And we're here for the community and helping all these individuals in this community. So moving this bill forward will continue to help them even more. So I'm here to support everything.
Thank you so much. And Commissioner, congratulations for finding a young attorney, bringing her back home on board. Assistant
Afternoon.
Commissioner?
Yes, sir. Good afternoon, Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. I'm not going to comment on what has been spewing today. I really just want to appeal to everyone that's hearing the sound of my voice to really try to understand what the differences are between mental health, behavioral health, forensic patients, residential facilities, off-island facilities, violence, what triggers violence, education, levels to care, pre-care, post-care, immediate care. All of those terms wrap into not only this bill, but the work that the Department of Health does. I think there's still a lot of misinformation, there's miscommunication, and so there's the belief that certain places and things are being wasted when they're absolutely not. Each person, whether we are categorizing them as forensic or not, require a different set of treatment. And just because there's a four-wall structure does not mean that everyone can go into that structure. We are available also to provide education. That way we move forward singing from the same sheet of music. We've been here for years. From 2017, I've sat, not literally here, but in front of the Senate and kind of heard some of the same things. And that is because we repeat some of the same things because we're not really listening. When I say we, I can mean everyone, to what certain definitions and terms are. And I think once we get an understanding there, we can then move together forward to really address and identify the topic of behavioral health as an umbrella, which houses everything underneath to include mental and emotional health.
Thank you so much. That was loaded. Thank you.
Usually is.
Attorney Joseph, you recognize for a 30-second closeout.
Thank you, Senator. Thank you to all those that attended and listen and viewing audience. Thank you to all the participants who did an extreme amount of work on this bill. I'll say this, whatever the next steps are as it relates to amendments, residential services, anything of that nature, I think we can all agree that it must be done cohesively and in an expedient manner. For too long now, we've battled with the same issues, and we all working from different perspectives with persons with developmental or behavioral health issues. They come into our doors, and it's not an easy task to deal with them. We know that the departments such as Department of Health and others work extremely hard to offer services, but again, looking at it from the perspective of in a criminal context, we see things that we believe can be adjusted, and we noted those things in the bill. And that's not to say that we are not in agreement with the general direction as far as moving forward. We just suggest that these things be done, but as noted earlier as well, it just needs to be done in a cohesive and an expedient manner. We owe this to the individuals within our communities and our families and to ourselves. So thank you for the time and your consideration on this bill.
Thank you, Attorney Joseph. Chairman Finch.
Thank you. 3 points. It's the duty of government to take care of its most vulnerable citizens, and this bill attempts to do that, one.
That's one.
Secondly, we must remember that there's a cost to doing nothing. The hospitals and the jails take the brunt, but most importantly, people are not served, and this bill attempts to serve people.
That's true.
Third, the beauty of this bill is in its comprehensiveness. Within the mental health world, all the pieces are needed. Residential programs without an outpatient means that people are stuck. Outpatient without a residential backup can have problems. Crisis intervention without ongoing support doesn't work. Doing family supportive services without backups for those families doesn't work. We need all of the pieces. Only putting money in hospitals and residential care means that's where everybody ends up, in the most expensive settings. So let's not let go of the comprehensive vision that this bill does. Thank you.
Thank you so much for that. I was tempted to ask you to repeat those three, but we'll replay the tape after. CEO?
Good afternoon again, and thanks to everyone for all the hard work that they've put together on this, to put this together, and definitely want to commend the bill sponsor and all the other senators that are sponsoring this legislation. I think it's very important for the community, and the hospital, Schneider Regional, is committed to being an active partner in the process and addressing the needs of behavioral health patients in the territory. We look forward to continuing to collaborate with all the stakeholders, and I definitely want to say thank you to the hardworking staff at Schneider Regional who day in, day out take care of everyone that needs our care, needs acute care in the territory. So thank you very much to our hardworking and caring staff.
Thank you. I thought the chair was going to say that on behalf of both hospitals, too.
I'll thank the JFL staff as well. Thanks to the JFL staff.
Thank you. Commissioner Encarnacion.
Thank you very much. Just a clarification and to let everyone know, we've actually had 2 engineers reported that Elder Shelterbrand Annex is not sound. So that is one of the reasons we cannot legally or ethically go ahead with that situation. So, but we will speak about that another time. Everyone should also know that.
I'm going to interrupt you. I'm sorry. So that means that both districts, the buildings are not sound to.
We have 2 over there. Remember, the annex is the building that's not occupied right now. That's the area that the senator was focusing on, but it is not a sound building, so we're not able to rebuild right now.
Right, but I'm just saying you have that one and the one at Anna Soap.
Correct.
Okay.
Okay. And then, of course, DCCO spoke about a psychiatrist, and I wanted everyone to know that a person is being onboarded, and she, too, is a local Virgin Islander that's coming home to serve her people. So just wanted the community to know that as well.
Excellent. Let's treat them right.
That's right. The proposed bill is in line with the national focus of community-based services and not simply commitment of those suffering from behavioral health crisis. That is important and key. The identified and needed support for the expansion of the current wraparound services, like we've always spoken about, throughout the territory really and truly is the true focus of this bill, and it's something that I would like the community to really talk about, think about, and act upon. Public health is all about prevention, and that's what we do. The proposed bill also unifies the scattered pieces of the code that isn't entirely new, but rather better organizes existing sections. The bill was drafted by researching national standards, and as I mentioned before, all outpatient and inpatient care will be closely regulated. So the concern that was brought before is not a concern to me, because regulation and regulatory entities are something that we deal with on a continued basis. So I know that we will be sound. And I wanted to go to adverse childhood events, and I know that Senator Gittens, you spoke about it a little bit, but the Office of Gun Violence is focused on prevention and entity areas like adverse childhood events. Why are these individuals picking up a gun at a young age? And how can we prevent it? And it's all about behavioral changes. Wanted to just recognize that. And of course, I wanted to thank the staff of the Department of Health. We work hard, as Giselle has identified, in so many different entities, but collaboration is wonderful, and we appreciate everything that you do. Finally, I want to thank Dr. Julia Sheen, Attorney David Bourne, and all the other strategic partners and in the governor's office that has worked and assisted drafting the bill. It was very important to also have hospitals, CEO that's here, Commission, as well as CEO Cook, to be part of this, and of course, Chairman Finch, we appreciate all the input you had. And private information, private entities' information is important, it's also solid, so we also appreciate everyone that has provided input and information towards this bill, and I ask and I pray that this bill actually goes the next step. Senator Francis, thank you so much for giving us all your time.
Thank you, Commissioner, and again, thank you all for your input on these measures. And so at this time, I'll go ahead and excuse you. And while you're being excused, we will handle the other business to address the two bills that's before us. And colleagues, we'll start with bill number 34-0244. Amendment, Senator Francis, you recognize for your amendment.
Thank you very much, Mr. Chair. I offer amendment number 34-595 and being offered on behalf of Senator Genevieve R. Whitaker to amendment to bill number 34-0244. Bill number 34-0244, section 1 is amended by striking subsection B in its entirety. I so move.
Second.
Okay, properly moved by Senator Francis, second by Senator Blyden.
You could tell your boss.
Hearing no objections, so ordered.
Motion.
Motion, Senator Francis, you recognize.
Thank you very much, Mr. Chair, and colleagues. I move that bill number 34-0244, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 191A and D, to expand and clarify the definition of naturopathic medicine and physical modalities used in the practice of naturopathy, and as amended, be approved by the Committee of Health, Hospital, and Human Services and sent to the Rules Committee for further vetting. I so move.
Second.
Thank you. Properly moved. Whomever is online, can you please mute your mic? Bill number 34-0244 has been properly moved by Senator Francis and second by Senator Blyden. Roll call on the bill as amended.
Senator Marvin A. Blyden.
Yay.
Senator Blyden. Yay. Senator Samuel Carrion. Senator Carrion, absent. Senator Kenneth L. Gittins.
Yes.
Senator Gittins, yay. Senator Alma Francis Heiliger.
Yes.
Senator Francis Heiliger, yay. Senator Janelle K. Soro.
Yes.
Senator Soro, yay. Senator Kurt A. Violet. Senator Violet, absent. Senator Novell E. Francis Jr. Senator Francis Jr., yay. Mr. Chair, you have 5 yeas, 2 absent.
Thank you, Madam Clerk. Bill number 34-0244 as amended, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 191A and D, to expand and clarify the definition of naturopathic medicine and physical modalities used in the practice of naturopathy, has been properly moved and voted favorably upon in this committee and will be forwarded to the full body for further and final action. Do I hear amendment or motion? Amendment, Senator Francis.
Thank you very much, Mr. Chair, and colleagues. I offer amendment number 34-593, amendment to bill number 34-0279, being offered by yours truly, Senator Novell E. Francis, Jr. Bill number 34-0279, section 3 is amended as follows. A, in internal section 1001, 1 in paragraph 8, strike behavioral health or psychiatric social worker and insert licensed certified independent social worker. 2, in paragraph 18, after the words Virgin Islands, add, and who is recommended for participation in the program by the Director of Division of Behavioral Health Services or the Attorney General. 3, delete the language in subsection 32 and insert new language to read as follows. Persons with a substance use disorder means a person who habitually uses any narcotic drug, opiate, or as defined by Section 593 of this title, so as to endanger the public morals, health, safety, or welfare, or who has lost the power of self-control with reference to persons of substance abuse.
Motion?
Motion, Senator Blyden, you recognize?
Thank you, Mr. Chair. I move to waive the reading of Amendment 593. I so move.
Second.
Properly moved and seconded by Senator Francis. Properly moved by Senator Blyden, second by Senator Francis. Here no objections, so ordered. Motion, Senator Francis.
So move.
So move.
For the amendment.
So move for the amendment.
Hearing no objection.
Hearing no objections, so move. Yes. Yes. Blyden moved it, and second by Francis. The waiving of the reading.
Amendment is now so moved.
The amendment is now so moved.
Need a second.
Senator Blyden, you second?
Yes, second. I said second.
Okay, we didn't hear you on this end. Thank
Sorry,
you.
I probably was on mute. Sorry.
Thank you. Senator Francis, you recognize for your motion?
Motion, Mr. Chair. I move that Bill number 34-0279, an act amending 19 Virgin Islands Code, Part 5, restructuring, reclassifying, and adopting the first comprehensive Virgin Islands Behavioral Health Act to provide for services and interdepartmental coordination of agencies and organizations to provide a structure of support to individuals throughout the Virgin Islands who suffer from behavioral health challenges, to establish community behavioral health services, as well as to provide the first comprehensive public behavioral health facility to treat individuals voluntarily and involuntarily who face behavioral health challenges, amending and repealing conflicting laws, and providing for other related purposes as amended be approved by the Committee of Health, Hospital, and Human Services and sent to the Rules Committee for further vetting. I so move.
Second.
Properly moved by Senator Francis, second by Senator Blyden. Roll call on Bill number 34, that's 0279 as amended.
Senator Marvin A. Blyden.
Yea.
Senator Blyden, yay. Senator Samuel Carrion. Senator Carrion, absent. Senator Kenneth L. Gittins.
Yes.
Senator Gittins, yay. Senator Alma Francis Heiliger. Senator Francis Heiliger, absent.
What you say?
Senator Francis.
I didn't get an amendment till just now.
Senator Francis Heiliger, can you vote? They're calling on you.
Not voting.
Not voting? Good. Go ahead.
Senator Francis Heiliger, not voting. Senator Janelle K. Soro.
Yes.
Senator Soro, yay. Senator Kurt A. Vialet. Senator Vialet, absent. Senator Novell E. Francis Jr.
Yay.
Senator Francis Jr., yay. Mr. Chairman, you have 4 yeas, 2 absent, 1 not voting.
Thank you, Madam Clerk. Bill number 34, that's 0279 as amended. An act amending Title 19 Virgin Islands Code, Part 5, restructuring, reclassifying, and adopting the first comprehensive Virgin Islands Behavioral Health Act to provide for services and interdepartmental coordination of agencies and organizations to provide a structure of support to individuals throughout the Virgin Islands who suffer from behavioral health challenges, to establish community behavioral health services, as well as to provide for the first comprehensive public behavioral health facility to treat individuals voluntarily and involuntarily who face behavioral health challenges, amending and repealing conflicting laws, and providing for other related purposes, have been voted upon favorably here in the Committee on Health, Hospitals, and Human Services, and will be forwarded to the Rules and Judiciary Committee for further action. Allow me to, before your point of personal privilege, Senator Francis, allow me to restate the one for Bill number 34, that's 0244, which was passed by this committee. Please note that this bill, as amended, will be forwarded to the Rules and Judiciary Committee and not to the full body for further vetting and action. Thank you.
Point of personal privilege.
Senator Francis, unless you want to yield to the lady and then you bring it last, then Senator Francis Heiliger, you recognize for your point of personal privilege.
Thank you so much. I just wanted to share with my colleagues and the general public that I am in support of 34-0279. Unfortunately, with the 4-page amendment from discussions today, it will not be able to fully clean up some of the issues that still would exist with this bill. We have discussed that it will be moving on to rules where further amendments would be done. But as the only sitting senator that is neither a member of finance or rules, I do not get a second bite at the apple to guarantee this. So once these amendments are done, and I hope that they are done in rules and forwarded to the full body, hopefully by then they're cleaned up and I would be able to support entirety. Thank you so much.
Thank you, Senator. However, you're always invited to attend the Rules and Judiciary hearing as well. Senator Francis, you're recognized for your point of personal privilege.
Thank you very much, Mr. Chair. And, I've been in this legislature for 8 years now, and, I appreciate the work of my colleagues, and you have the right to vote yes or no, and I respect each and everyone's vote in that respect. But I really want to take the opportunity here to thank everyone that contributed to this measure. Again, it was a heavy lift. It went through several iterations. I want to thank our legal counsel, Attorney Nandi Sekou, as well as Attorney Tharps for their work on this, as well as the Chief Legal Counsel. They spent many times reviewing this particular measure, but also all of the stakeholders, the Governor's Office, Attorney Bowen, and everyone that was involved in assisting in putting this measure together, all of my colleagues. This bill is done in memory of my dear friend, Lionel Roberts Jr., a.k.a. Changa, an individual that was challenged by behavioral health issues. He became a part of my family just about every single day. I had the opportunity to spend some time with Changa. And, Changa was an individual that read the newspaper from beginning to end. He had gone to the military, went through his whatever experiences he went through. However, he was a fine gentleman. When he's not having his episodes, but nonetheless, a very warm-hearted individual, very caring individual. A lot of times he protected me, look out and cover my back. Read the newspaper from beginning to end every single day, and you could have a decent conversation with him about anything globally, locally. Changa, rest in peace, my brother. Thank you very much, Mr. Chair.
Thank you, Senator Francis. Hearing no other alibis, I want to thank everyone as well, Senator Francis, your staff, media, and security, of course, Boy Blue in the back there. Everyone, Ms. Picard, thank you so much for always being a trooper. Ms. Carty, all the way from St. Thomas. Wow. Welcome. And of course, we want to say a special happy birthday to the Chief of Staff for Senator Francis. Could you stand so that they can see you? Shauna, happy birthday. Happy 18th birthday. Yes. Thank you so much again. And no further business of this committee. Have a great and safe weekend. The Committee on Health, Hospitals, and Human Services for Friday, July 29, 2022 is hereby adjourned.